put volume maybe just a little smidge high, because we can hear you well, but it was a little bit distorted. You usually sound much better than that.
How's this?
Perfect.
Yeah.
This is better?
Yes.
I pushed
Thank you.
Mr. Raffone several inches back.
Oh, okay.
Okay, you're all set, Representative.
As chairman of the House Health, Human Services, and Elderly Affairs Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to the executive order 2020-04, this public body is authorized to meet electronically. Some committee members are participating in this meeting from the Legislative Office Building. This is a public hearing on bills referred to the House Health, Human Services, and Elderly Affairs Committee. It may be followed by an executive session. Please note that there is no physical location for the members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform, and that the public has access to listen contemporaneously and, if necessary, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. This notice, the notice for this meeting, complies with House rules and RSA 91-A. Anyone who has a problem accessing the meeting should call 271-3600, 271-3600, or else email hcs@leg.state.nh.us. In the event the public as a whole is unable to access the meeting will be adjourned and rescheduled. I want to introduce the staff that is on the meeting assisting us, and that would be Christina Daya. Please note that all votes that are taken during this meeting shall be done by roll call vote. We will start the meeting by taking a roll call attendance. When each member states his or her presence, please also state whether there is anyone in the room with you during this meeting, and this is required under the right to know law. Would the clerk please call the roll?
Thank you, Chairman. Representative Marsh. Representative McMahon.
Present, and I am alone in my office at my home in Windham.
Representative Nelson.
Present in my home in Brookfield. I'm alone.
Representative Acton.
Present. I am alone in my home in Fremont.
Representative Gay.
On the way.
On the way. Representative Cushman.
Present.
Representative Folsom, present. Representative Kelsey.
I'm present in my home in Bedford alone.
Representative King.
Here.
Representative Cofalt.
I am here in my home office in Wilton. I'm alone in this room. There are other people in the house.
Representative Weber.
I am in my second home in Concord. I am alone in the room, but I'm sharing the house currently with a friend who is in another room and leaving shortly. And while I'm here, excuse me, could I just relay to the chairman that Patricia Tilley and Beth Daly would like to speak after the reps and senators because he doesn't have his phone right now. So thank you.
Thank you.
Representative McKay.
Yeah, Jim McKay. I'm home alone in Concord, no cats.
Representative Snow. Representative Snow. Representative Knirk. Representative Knirk,
Oh, am I?
I see you.
No, I'm not muted. Can you hear me?
Yeah, and now I can.
Okay, sorry. Jerry Knirk here. I'm home in my study in Freedom. My wife is in the house, but not in the room. Thank you.
Thank you. Representative Soloway.
Representative Soloway is present at his home in Lee, New Hampshire, and alone in the office.
Representative Cannon.
Representative Cannon is here in my home alone in Somersworth.
Representative Nutter-Upham.
I'm here alone in my home in Nashua.
Representative Shapiro.
I'm home in my office alone in Keene.
Representative Woods.
Yes, I'm here in my study in Bow. I'm by myself, but my wife's elsewhere in the house.
Representative Merchant.
Yes, I'm here in Claremont in my home, and my wife is somewhere in the house.
Representative Pearson.
And I am here in the LOB.
We have 18 present.
And we will keep an eye on the other three who will, I'm sure, come shortly. How is my volume now? Is it better?
Excellent.
Thank you. I open the hearing on House Bill 220, establishing medical freedom in immunizations. And the chair calls on the prime sponsor, Representative Lang. Do we have Representative Lang?
Yes, he's on screen, just needs to unmute.
Thank you, Mr. Chair. Thank you for allowing me to testify before your committee today. I'm Representative Tim Lang from Belknap 4. I'm appearing before you to introduce House Bill 220, establishing medical freedoms. I will say that the title is a little misleading. The idea is that in this bill, we are looking at establishing that in the state of New Hampshire citizens have the inalienable right to bodily integrity free from threat or compulsion that a person accept any medical intervention, and that includes immunizations. This bill is fairly simple. Well, it's one simple paragraph. However, it's a far-reaching bill. But I would say that this bill has something for everybody. That by establishing this principle, we look at liberty, right? The right of an individual person to have bodily integrity. I control my body. So if you believe in that you have individual freedoms and it extends to your body, then you have something. If you're a proponent of my body, my choice, then there's something here for you as well. That you get to choose what happens to your body, and the state cannot mandate that you do any kind of medical procedure, and furthermore, you can't be discriminated against for any medical procedure. This bill was brought forward. I serve on JALCAR. I'm in my third term in the House. I'm serving my third term on JALCAR. And last year we saw, the year before, I don't recall, to be honest with you, I think it was last year, we saw a rule being brought forward through DHHS that would require immunizations for foster parents in order to be foster parents. When the question of religious freedom came up or individual choice came up, the department basically said it doesn't matter. And I felt this was, and that the parents wouldn't qualify to be a foster parent. Now, I can understand in certain circumstances where you may have a foster child who might have some compromised immunization system, I can say the word, apologize. Immunity, compromised immunity, and therefore you may want to put them with parents who are vaccinated. However, in this case, that wasn't even the case. This was going to be a blanket statement, and some religions and some people truly are either they can't, due to their religious preference, have immunizations, or by their personal choice can have immunizations. And if they qualified in any other way for a state program, that program, with the exception of this immunization based on either their choice or their religious beliefs, they would be allowed to have a foster child. But because of their religious beliefs, now they're being exempted from and discriminated against by the state and not allowed to be foster parents. And I found this to be reprehensible and inconceivable, to be honest with you. A more nuanced bill was or more nuanced rule was needed, but it was passed, and that's the law, that's the regulation now. And I felt that we should not be doing that. So I brought this bill forward. There's going to be lots of people, I'm sure, that want to talk, including Assistant Commissioner Tilley, who I know very well from my work on the reopening task force. But I'll leave you with this. We can, butt this bill to death. And what if this bill to death? But the bottom line is you believe that an individual has the right to choose what they get poked with, what they cut open with, and that the state can never mandate or force a medical procedure on an individual, or you don't. It comes down to that. And I believe that I have the right, or every individual in the state of New Hampshire has the right to make that choice. And that the state, if I choose whatever medical procedure I want, or not choose that procedure, the state can't discriminate against me. Again, I'll leave a lot of the questions for anybody else, but I'll answer any questions anybody may have. But I believe this is a fundamental right of bodily integrity. I mean, we require police officers to get search warrants to search people's houses, and yet we're going to allow the state to mandate what you do medically. I think that's wrong, and I think that this bill would correct that problem and make sure it never is a problem in our great state of New Hampshire. I'm happy to take any questions.
I left my in the car, whereby I normally get appraised as to what members of the committee wish to ask a question. So I'm going to rely on Representative Weber to tell me who of the committee has a hand up.
Okay, well, Representative Weber was first, followed by, I'm hoping you're writing this down, Representative Knirk, Representative Shapiro, Representative Woods, Representative Cannon.
And the chair first calls on Representative Weber.
Thank you, Mr. Chairman, and thank you very much, Representative, for taking my question. I absolutely agree that everybody has the right to control what happens to their body. What about my right if I am hiring somebody to come and look after me during an illness? I'm hiring a part-time employee. It appears to me that this bill, would it not bar my saying that the person who comes to look after me, who might look after other people in their homes as well, has to have a vaccination before I hire them?
So if your question is, does this extend into private industry? The answer is, as written, yes, it does. That wasn't my intent of the bill, and it did come to me, and I'm happy to help and work with anybody on the amendment. My intent was to bar the state from mandating and discriminating. Individual businesses, I think, have the right to determine their own hiring practices, and should, again, a business, especially since in the healthcare field, where if I was working in a cancer ward, then having immunizations would be extremely important. So I believe the business has the right and the justification to be able to do that. However, I don't think the state has the right. I should not have to have a special card to show up to DMV to get my driver's license because the state mandated something. More concerned about the state mandating my participation in society rather than I am the individual businesses. Individual business will be taken care of through the free market practice and employment practices. Of a business makes an employment practice that a majority of the people disagree with, no one's going to go work for that business. The business will adjust its practices. So I'd be happy to work with anybody on an amendment to clean this, to make it so it's more clear that this is intended that the state cannot mandate any kind of medical intervention.
Thank you.
Representative Knirk.
Representative Weber just asked precisely the question I was going to ask, and it's been well answered, so I withdraw. Thank you.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you, Representative. Likewise, you partially answered my original question, but I have another question, which is if the intention of your bill is not directed at businesses, how would this play out with school districts or private schools or daycares who feel that it's in everyone's best interest to mandate vaccinations for children who are attending?
So thank you, Representative Shapiro, for that question again. So currently it's kind of I want to call it chicken and egg, but I'm not sure what else to call it. Currently we have certain mandated vaccines for a public school. However, we also have a complete exemption process that allows parents to exempt out of that. So we, in theory, don't have a mandated vaccine program. Most vaccinations are given, my understanding, I got 4 kids and some are, my wife controls the vaccinations and she's believed in some, didn't believe in others. So we occasionally had to sign the form that said that our children were not vaccinated and allowed them to attend. But I guess what I'm going to say to you is this, is that, again, most decisions to vaccinate are done at an early age. I think majority of the vaccines are given under the age of 3, not at the age of school. And so I don't know that this will have any impact on the percentage of people that get vaccinated. I don't think any parent, when the kid's 2, says, oh, I need to send my kid to public school, so I'm going to get them vaccinated. They get vaccinated based on their conversation with their doctor. It's a choice. It's the decision between the parent and the doctor having that discussion. And we have a high rate of I'll use the word compliance. I'm not sure the word to use, but we have a high degree of vaccinations in the state of New Hampshire, and I don't expect that to change even if this bill passes.
Follow up?
Follow up.
So just to be clear that the intention of this bill is not, given that there's an exemption for schools, vaccinations for students in schools, your intention is not to change that, but to leave that the same.
My intention is to make sure the state can't mandate vaccines. Or actually, my intent is any medical procedure that the state cannot step in. I'm trying to future-proof this bill a little bit because I don't like coming back and tweaking bills if we can help it. But my intention is to future-proof this bill and say any medical intervention the state can't mandate. And again, there's nothing wrong with the school district asking for immunization records so they know who's vaccinated and who's not if they choose to. But again, I don't necessarily think we need to mandate this, and I don't think a mandate would change the percentage of which children get vaccinated or not.
Thank you.
Representative Woods.
Thank you, Mr. Chair. My questions have been answered. Thank you.
Representative Cannon.
You're on mute.
Representative Cannon.
Try this.
My machine didn't want to unmute. I'm a school board member, and we just recently worked on our policies. And the schools actually have a requirement for providing information about vaccines. This bill talks about discrimination. I'm wondering if, just as we have today, that there's special in classroom plans to separate students to make sure they adhere to the social distancing guidelines. Would that be considered discrimination if we're bringing kids into the school?
I'm not sure I understand your question, Representative Cannon, but if I can answer it the way I think you got it, was I don't think it's any different than a peanut allergy, right? So yet when you have a child in a classroom with a peanut allergy, there are certain controls that are put on, and that's not discriminatory. That's related. So I guess I would align it with a peanut allergy, I guess your answer, but I'm still not quite clear on your question.
Follow up?
Give it another go.
Let me do it this way. Given that in the case of COVID, it's passed by through the air, through water droplets, whereas a peanut allergy would be someone who ingests something that's an allergy. In our schools currently, we're placing students 6 feet apart, and there's a piece of plexiglass in between the seating to protect other students in the room. So if a student is not vaccinated, ultimately when they're available, would it be discrimination to have a section within the classroom that is separated from the other students who have been vaccinated or have yet to be vaccinated because of a scheduling issues?
Thank you, Representative, for your question. And I guess I'd answer it in this way, is that unless there's I'm going to say no, it's not. Again, if you're following science and the school district is following science and you've got your plexiglass and you got your masks and you got your social distancing, then whether a child's vaccinated or not doesn't have a whole lot to do with it, does it? If you're following all the other protocols. So while vaccination is a component, it's not the only component. We'll hear from Trish Tilley later, and as I hear on a regular basis that none of these answers are a silver bullet. I think we've read that vaccines, even now, they're talking about either variants or they're talking about the fact that you could still, even with the vaccine, get COVID a second time. And so, again, relative to the specific virus that's going around, again, if you're Trish Tilley will talk about multi-layer threat protection. And that, again, if you're following all the multi-layers and you miss one, but you've got the other 5, then you're still pretty safe. So I would say, yeah, again, I would consider it if you were starting to create the haves and the have-nots, that's a problem.
Thank you.
Representative King.
Thank you, Mr. Chairman. But my answer has been, or my question has been answered.
Thank you. Representative Cushman.
Thank you, Mr. Chairman. Representative, can you tell me, do we currently implement in public schools any other kind of separation between children who have some vaccine exemption and those who do not, for any other diseases that vaccines are required for?
Sure, having served on the school board for 6 years, I can tell you that in my school, we've never implemented anything like that before.
I have a question for the prime sponsor. I remember when schools mandated vaccines, they were basically 5 or 6 or so specific vaccines that all schools had. And some of them have gone on, I understand, to 20 or 30 things, some of which some people think are dubious. Would you be comfortable with a school mandating the traditional 5 or 6 as long as they did not go beyond those?
I'll leave that to the medical experts to have that discussion. Again, I don't think we should be the state should be mandating what I poke my body with or any child pokes their body with. The parents are the best arbiter of the medical care of their children, in consultation with their medical providers, and that the state's not the best arbiter of telling me what I have to do.
My follow-up is, it seems to me that around the country, not just in New Hampshire, the whole question of who educates our children is now up for discussion again. And charter schools, which are a kind of public school, but private schools have been operating during the pandemic in a way different from many public schools. Would it be acceptable to you to let the public schools continue to mandate while other schooling options for parents have become more or could become more affordable? Would that be an acceptable thing to you?
Again, if the private school is acting as a private industry, it has the right to do and choose as it will. and let it manage its own student body the way it chooses to. Again, this is about the state mandating something that covers 1.35 million people in the state of New Hampshire. And
Representative, is there anyone else, Representative Weber, from this committee who wishes to ask a question?
Yes, there is, Mr. Chairman. I have Representative Nelson, followed by Representative Knurk.
Thank you. Representative Nelson, please.
Thank you, Mr. Chairman. Would just like to know who is discriminated against? Is the student that's coming in or those that are in school? So if somebody has a condition that could compromise somebody, is it being discriminated? Yeah, you know what I mean. Discriminated against the student who's trying to come in because they don't want to tell, or the student that's in school that doesn't want to get what they could be bringing in?
thank you for your question, Representative Nelson. Again, my issue was around the and discrimination may be the wrong word that was put in there. It's not the word I used when I gave it to OLS, is what they stuffed in there. My intention was that you can't be denied access to any state programs or state activities. Again, this is about the state. You know, if you go back to some basic constitutional laws, that you learn that the idea behind the Constitution was to limit what the state can do, not limit what the individuals can do. And so if you believe that this is a constitutional issue, and this is about limiting the state and not limiting what people can do. So my goal was not to have a person discriminated from participating in state programs and functions.
Thank you.
Representative Knurk.
You're muted.
Yes, thank you. Yes, thank you. Okay, I was going to withdraw my question as it was quite similar to Representative Nelson's, but now I am more confused than I was before because we just had a long discussion about schools and whether they could require vaccinations. And now you're saying just state, but since schools, many of them, public schools, are run by governmental entities, as in the towns and cities, it seems like we need to clarify that language quite a bit, because my concern rests, as Representative Nelson's, that we are discriminating against the child who cannot be vaccinated from coming to school and participating fully if they are in danger of catching any number of diseases besides COVID, measles, and other things. And it all has to do with public health and herd immunity. So would you be also welcome then to an amendment which would say somehow that it's only state programs that schools can discriminate? Would that be a comfortable amendment for you?
I'd be uncomfortable making a statement that schools can discriminate, but
well, in the context of what we're saying here.
So again, I guess I would say that if there's just cause. So again, we talked about the fact that hospitals and people have compromised immunities. So if the school had an issue with a student that had a compromised immunity, then it may be able to do certain things that it wouldn't be able to do otherwise. But again, it has justification in that with the child. But again, it's up to Health and Human Services how they want to amend this bill. My big amendment, my big discussion point was that my intention was not to push this out to individual businesses in the community. This is about the state, going back to that constitutional argument, the state cannot mandate and on its population, that it's a control on the state, not a control on the individuals.
Representative Cushman.
Thank you, Mr. Chairman. Representative Lang, would this bill, would this protect against discrimination for accepting medical interventions, such as using medical marijuana?
Yes.
Thank you.
Any further members of the committee wish to ask a question?
Yes, I have a question from Representative Nutter Upham, and I'm going to request Representative Knurk to lower his virtual hand if he's all set.
Oh.
It's Representative Nutter Upham only, and Representative Knurk's okay at this point.
Representative Nutter Upham.
Thank you for taking my question. So I'm in favor of half of this bill. And I've received, not quite hundreds of letters from people who saying they shouldn't be forced to take an injection. And I believe in that kind of freedom. However, The second half, lines 5 through 6, no person may be discriminated against for refusal to accept an unwanted medical intervention, including immunizations. So you kind of stated before you'd be open for an amendment. And so I, of course, would not want to go into a hospital where none of the nurses or doctors were immunized. So if you want to clear up that language in an amendment to take out this, differentiate between the state part and individual businesses, I might consider voting for it.
Thank you, Representative Upham. I will happy to look at that. Again, that wasn't my intention to do that, but I will say that even right now, you have no idea who has vaccinations or not when you go into a hospital, right? You have no idea.
Well, I have. Oh, may I follow up with a? Yeah, I mean, because I worked in hospitals, and of course, I was required to at least get a TB test every year, and they of course offered. I mean, so yeah, they didn't have my immunization record, but there were certain diseases such like TB that they had rules around. So everyone who worked at the hospital had to have the TB test every year, and the flu vaccine was offered, not forced, but offered. So anyway, it's a complicated business, and there's typhoid Marys out there. We want to be careful.
Absolutely, Representative Nutter Upham, I agree. And again, if the individual business chooses to, and where the TB test is reasonable, again, I don't see people running away from that. But again, this is about what you're injecting into your body, and and not only that, again, any medical intervention, and worried about discrimination or lack of access. Again, I never want to see a situation where the state can mandate something and say you can't go to DMV and get your license unless you got a certain card that says you got this done. That just seems to me to just be bad. Again, we should not be mandating on our individual citizens these kind of interventions.
Thank you, Representative Lang. Representative Weber, is there anyone else?
Representative Woods has his hand up.
Representative Woods.
Thank you, Mr. Chair, and thank you, Representative Lang, for taking my question. Just following up with Representative Nutter Upham's question relative to hospitals. The state runs a hospital at the State Hospital for Psychiatric Care. This would preclude the state from following the mandates in other hospitals, prevent them from mandating appropriate immunizations, especially given the current status?
Well, again, we're going back to the COVID conversation. And again, I don't think any nurse at any hospital is mandated to have the COVID vaccine. It's offered. As we heard Upham Nutter talk about, that again, she worked in a hospital. They didn't mandate vaccines. They made them offered and available to any nurse or any first responder that wants them. And even in the state of New Hampshire, we don't mandate our first responders get the COVID vaccine. We make it available to them, and many have chosen. I expect that this isn't going to have a major change on the vaccination rates within the state of New Hampshire. I just want it clear that people have, if they choose not to get it, that's okay. And that's their choice. And that the state can't mandate it, and then definitely not down the road mandate that you can only participate in certain state functions if you did that. That bothers me, that's a possibility, and I don't want to see that.
Thank you, Representative Lang. Anyone else from the committee?
With that, I see no further hands, Mr. Chairman.
Thank you very much. I will next call, as our custom, any elected officials, and I recognize Representative Juliet Harvey-Bolia to speak. And I would ask everyone henceforth, please to be brief. Representative Harvey-Bolia.
I do not see the representative in the list. Representative Harvey Bolia, if you are there, could you please raise your hand?
And I don't see her either.
Then the chair recognizes Representative Melissa Blasek.
Hello, can you hear me?
Yes.
Yes. Oh, thank you for taking my question, Mr. Chairman. I'm going to keep this very brief. Medical freedom is the right to bodily autonomy. I can't think of a more fundamental a right than the right to govern your own body. I also can't believe that this is something that we need to codify because, to quote John Locke, every man has a property in his own person. This nobody has a right to but himself. Yet it does seem to be necessary to list this freedom. When a government forces a medical procedure of any type, they've largely eliminated informed consent, which is a violation of medical ethics. In conclusion, I urge you all to vote ought to pass to begin the process of enumerating this most essential and foundational of rights.
Any questions for the representative?
I don't see any hands up, Mr. Chairman.
Thank you very much.
Thank
the
you.
Chair now recognizes Beth Daly from the Department of Health and Human Services. Dr. Daly.
Good morning, Representative Pearson and members of the committee. Sorry about that. It took a minute for them to unmute me. My name is Beth Daly, and I'm the Chief of the Bureau of Infectious Disease Control here at the New Hampshire Department of Health and Human Services. I'm here today to provide testimony in opposition to House Bill 220. Immunization, as you all know, is considered one of the most important public health achievements of the last century. It's prevented millions of illnesses, disabilities, and deaths here in the United States. But despite the success, we know that not everyone gets vaccinated. Vaccination coverage is not 100%, nor are most vaccines 100% effective. So these outbreaks of vaccine preventable diseases can still occur when an unvaccinated person becomes infected and introduces that disease into a community, especially one that has low vaccination rates. It is therefore critical that certain requirements for immunization remain in place, such as those that pertain to employment and healthcare settings, and those for school and childcare entry as well. These requirements are in place for immunization to prevent the spread of communicable disease to protect our most vulnerable residents. As one example that you've already discussed, some healthcare facilities require employee vaccination to protect the lives of their very vulnerable patients, such as requiring influenza vaccine to prevent outbreaks in long-term care facilities where residents can die if they become infected with influenza. All hospitals in our state have policies requiring influenza vaccination for their staff. Now, some do allow for certain exemptions, such as for medical or religious reasons, while others only allow medical exemptions. These policies have increased vaccination rates among our healthcare workers from less than 60% choosing to voluntarily get vaccinated to going above 95 to about 95%, I should say. So if you do eliminate these policies, vaccination rates will without question decrease substantially. An additional setting of concern that you've also spoken to are schools and childcare facilities. Under RSA 141C 20A, this provides the department with the authority to require certain vaccinations prior to school and childcare entry. All states in the United States have these requirements, and many states have even tightened their laws following large outbreaks of infectious diseases that were driven by decreasing vaccination rates. This is a major problem. In 2019, as one example, there were over 1,200 cases of measles in 31 states across the country that was driven by low vaccination rates. Now, as you pointed out, not all vaccines recommended for children are required for school and childcare entry. We always balance public health protection with individual choice, and so we only require those that are most essential and likely to be transmitted in this setting. These requirements are developed with public input through the administrative rules process. Despite our high childhood vaccination rates here in New Hampshire, we continue to have thousands of cases and outbreaks of vaccine preventable diseases. Just that's data from the last decade. So, and lastly, just to point out that people do have a choice. They do not have to be vaccinated. They only need to be vaccinated if they want to participate in certain activities where there is impact to others who are vulnerable and they need protection from infectious diseases. Relaxing requirements for immunization will lead to preventable disability and death and result in significant harm to our population. And as such, the department strongly opposes House Bill 220. And I thank you for the opportunity to testify, and I'm happy to address any questions you might have.
Are there any questions? Representative Cushman.
Thank you, Mr. Chairman. Is it Dr. Beth Daly? Sorry.
Yes, I'm a doctor of public health.
Okay, thank you. Can I ask, is there proof that outbreaks of these communicable diseases are due to unvaccinated children in schools? And because many people who get the measles, for example, from these outbreaks, I know were vaccinated.
Thank you for that question. May I respond, Chairman?
Yes.
So in the outbreak that I referenced in 2019, 90% of those individuals who were part of that outbreak were unvaccinated. So no, the data shows that that people who are unvaccinated are primarily affected. However, because these vaccines are not 100% effective, there are always people who, even though they have made that good choice of getting vaccinated, are still impacted and they develop illness themselves.
Follow up.
Can you explain to me your reasoning for believing that HB 220 would reduce vaccination rates?
Yes, because it's our experience and we have data that shows that when you implement policies requiring vaccination rates increase.
One more.
So you're saying that when we force people through changes in law where they have no choice but to get vaccinated, that increases vaccination rates?
Yes.
Thank you.
Is there anyone else in the committee?
Mr. Chairman, I'm pleased to say that Representative Marsh is with us and has his hand raised.
Well, Representative Marsh.
Thank you, Mr. Chairman. I just wanted to let everyone know that I am now present and to be compliant with 91A. I am at home alone in my home office in Brookfield, and there is no one currently in the room.
Thank you. And for the record, Representative Gay is present here in the committee room. Anyone with a question from the committee for Dr. Daly? Representative Gay.
Thank you, Mr. Chairman, and thank you, Dr. Daly, for taking my question. I'm curious as to how y'all are handling Moderna's statement. Their top doctor is saying that we cannot say that it's effective at preventing people from getting sick and spreading it. It's Moderna boss. I'll just read the headline. Moderna boss says COVID shot not proven to stop viral spread. What it's saying is that it's supposed to make you not get sick. So that my concern is that, I'm also an adherent to the right to one's own medical decisions. And I personally was vaccinated and received shots like DPT as a kid, but I got about 5 before I started first grade. Now 75 are recommended and offered. That's a big difference.
Thank you. So if may I answer? Was that the end? I'm sorry, the format makes this challenging. Okay, I will answer then. So first of all, actually, so CDC recommends that children get vaccinated against 16 diseases. Now, when you take into the number of doses in this particular series to be fully vaccinated, that's where you come up with those 75 doses. But actually, because the way they manufacture vaccines and they have, improved their technology over time, you're actually getting less antigen injected into your body than in, prior years, right? They've improved the way that these vaccines work over time. And then to your question about the Moderna vaccine, what the distinction is there is actually that it's 95% effective at protecting you from developing COVID-19. That is very highly effective, and we're very pleased by that. It's going to protect you as the person who has received the vaccine. What they're still studying is whether that means you can potentially have the virus, if you get exposed, go up into your nose and into your mouth. And the vaccine doesn't prevent that virus from being in those spaces. It prevents you from getting sick, but is it possible for that virus to be there and that you could spread it to other people even though you're not sick, right? Because we know that this virus is very interesting disease that's made it very challenging that you can develop asymptomatic infection and transmit it to other people. So that's what they're trying to study. And it's a distinction. It's absolutely protective for you if you're vaccinated. They're still studying whether or not it can be transmitted though from you, even though you're vaccinated, to other individuals. So hopefully that makes sense how I've described that. It's a little bit of a complicated topic and one that they're still researching.
Follow up.
That is exactly my point, though, that we're discussing. It sounds like, please correct me if I'm interpreting this incorrectly. It sounds like we are concerned about mandating the COVID shots because we don't want to spread it. Whereas my point and question is, if we're not sure that it's prevents spreading, then what's the harm in letting people opt to not take it and just take their chances, which sound pretty good with other medicines like ivermectin?
Well, I'm not sure that we're talking about mandating COVID-19 vaccine. Currently, the state's position is that we have no intention of mandating COVID-19 vaccine. So if you're interested in applying that to other vaccines, we do already know that the rest of the vaccines are very effective at preventing transmission, and COVID-19 vaccine is also effective at preventing transmission. They're still studying some features of that. Can they say it's 100% effective? No, but we know from science that whenever you're symptomatic with a disease, you're going to spread that disease more readily because the virus particles are coming out of your nose and mouth as you cough and sneeze. So even if people who are vaccinated have the virus inside their nose and mouth, they're much less likely to spread it because they're not actively sick, coughing and sneezing those virus particles around. Now, can they still transmit it? Perhaps. That's what's being studied. You can't say 100% that they won't, but the majority of people will not, and that's makes it very effective.
Thank you.
Is there anyone else from the committee who has not asked a question of Dr. Daly?
Representative Acton has a hand up, Mr. Chair.
Representative
Okay.
Acton.
Go ahead. Yes, Representative Acton.
Thank you, Mr. Chair, and thank you, Dr. Daly, for taking my question. My question is regarding our natural immune systems. Certainly, there's vitamins and a lot of techniques to improve our natural immune systems. My worry is that the reliance on so many vaccines could be damaging our natural immune systems. Do you have any knowledge of the reliance on vaccines where it may be reducing our natural ability to fight off things like the flu, in which case we're heading down not a positive road by being so reliant on vaccines?
So thank you for that question. That's a great question, and one question we've certainly been asked. So remember that your body is actually confronted with millions of bacteria and viruses every single day. So your body has the opportunity to develop lots of natural immunity to all kinds of different bacteria that live in our environment that we're exposed to on a regular basis. These are not the ones that we vaccinate against for. So no, there is no impact regarding that. These vaccines have prevented millions of illnesses and deaths since they've been, invented and given to our population.
Okay, thank you.
Representative King.
Thank you, Mr. Chairman, and thank you, Dr. Daly, for taking my question. Is preventing people to attend school as an example, or to travel on an airplane as an example, potential example, another way of mandating?
So I'm not quite sure I understand the question. We do have mandatory vaccination requirements for school and childcare entry. There's no requirements for boarding an airplane, nor do we have any intention of developing those.
Follow up. So there's been talk about, with the COVID vaccine in particular, of having to have a vaccination record with you when you board a plane. That to me sounds like mandating. Is that your interpretation?
I'm not aware of any conversations in New Hampshire around that subject. If you're talking about nationally, I can't speak to the national policy that's being discussed on travel requirements, or if those are being implemented by, by private companies. But again, people still have a choice. They're not being required to receive a vaccine if they don't want one. There just might be implications from that decision so that they don't put other people at risk for not choosing to be vaccinated.
Thank you.
Anyone else from the committee?
I see no one, Mr. Chairman.
Thank you, Dr. Daly. There is someone else from Health and Human Services.
Ms. Tilley, I believe, is here and has been admitted as a panelist.
Good morning, Chair and members of the committee. Thank you.
Patricia Tilley.
Good morning, Chair. I think I'm unmuted.
Yes, you are.
Great. Thank you so much. Thank you again. My name is Patricia Tilley. I'm the Deputy Director of the Division of Public Health Services here at the Department of Health and Human Services. I only want to underscore Dr. Daly's testimony and remind the committee that we also share Representative Lang's intention that individuals should generally have choice and informed consent. But DHHS opposes this bill due to the broad language that may have a negative impact. In particular, the broad use of the word discrimination raises questions, as we've heard, about school and childcare vaccine requirements, private industry, healthcare settings. It may also have implications far beyond communicable disease. It should be noted that the communicable disease statutes in New Hampshire protect and support individuals to make choices. For example, 141C20C provides opportunity for religious exemptions. But our laws also protect individuals from the decisions of others. As noted, vaccine requirements protect those who are compromised. But since much of this conversation has focused on vaccine, I just want to close with the notion that vaccine gives your family freedom. Freedom for elderly patients to go to the store without fear, freedom for your children to learn in the way that works best for them, and freedom for your spouse to work without the fear of bringing illness into the home. From my time on the reopening task force, I've learned vaccines also make good business sense. A vaccinated workforce is not only healthier and more productive, but allows employers to focus on their business, freeing employees from quarantine and travel restrictions at times. The concern DHHS has with this particular bill is the broad use of the word discrimination. We believe that this may open us up to unintended consequences. So thank you, and I will defer my time. Thank you.
Thank you very much. Christina.
Yes, Representative Pearson.
We will now be taking questions from the general public, and we will go to the 1-minute rule. This is a rule that has been established, not just this year, but in the past, when there are multiple people wishing to testify. And it is the position of the House of Representatives that the citizens have a right to be heard. It is also the case that we have to do an awful lot of work in an abbreviated amount of time. So therefore, when I call on somebody from the general public, you will have 1 minute to speak. At the end of the 1 minute, you will be muted, and I will call the next person. This is, as I said, an ongoing policy, and it is for situations like this. The chair calls from the general public. Patricia Edwards, you wish to speak.
I do not see her in the list. If you, Ms. Edwards, if you are online, could you please raise your hand?
I'm working off the list, Christina, that I was just given about a half an hour ago. I'm starting on page 1 at the bottom and working up.
Okay, I do not see Ms. Edwards.
Thank you. Eric Power, the chair calls to speak.
Hello, this is Eric Power. Can you hear me?
Yes, we can. Thank you. Go ahead.
Yes, this is Eric Power. I'm a 26-year resident of Brookline. I've also served as a school board member for the Hollis Brookline Cooperative School District for 3 years. And I am very concerned about mandatory vaccines, and I do not believe that I'm in support of this bill because I believe that vaccines should not be made mandatory for anyone in the state. I think that everybody's bodies is their own. The children, decisions for them need to be made by the parents. And vaccines, there is risk there. There's been, there's some safety problems with some vaccines. And so where there is risk, there needs to be a choice. And so I would recommend passage of this bill, recommend ought to pass, because I think it's very important for New Hampshire to maintain its live free or die motto and to maintain our personal liberties. Thank you very much.
Thank you and well done. The chair calls Maria Nardi.
Hello, can you hear me okay?
Yes, we can.
Okay, thank you. My name is Maria Nardi. I'm a resident of Hollis, New Hampshire. I did provide an email testimony. I'll just read it because I need to be brief. So just wanted to point out that, I've never been against vaccinations. We've all had our vaccinations in this family, but I am completely against any mandating of any vaccination, especially the one for COVID-19, which I understand is not, considered to be mandatory, but so vaccines, they come with, there's always a health benefit risk there. So you have to weigh the health benefits versus the risks. And for, a vaccine like COVID-19, which, the data from the CDC by and large, clearly shows that it is not a dangerous virus for, healthy people under the age of 60. I have supporting evidence for this if you need it. It's in the email that the email testimony that I put forth. Also, this has been
Ms. Nardi.
Up, you should have been muted. The chair now calls Leslie Nuchow.
Okay.
Can you hear me? Can you hear me?
Yes.
Yes.
You can hear me. Thank you. My family and I just moved to this beautiful state. We came here from New York in September because a year and a half ago, New York removed the religious exemption and my son was kicked out of school along with 26,000 other children. And we moved to New Hampshire seeking freedom and the ability to make health decisions for our family without the state forcing us to submit to medical procedures that we don't want. New Hampshire stands as a beacon of freedom, and we fled here because we believe the live free or die state will stand up to tyranny and defend and respect everyone's right to make their own medical decisions about their own bodies, regardless of their political affiliation or personal beliefs. As a registered nurse, I understand the science, and what I know to be true is that science is ever evolving. At one point, we were told by science that cigarettes were beneficial, that DDT should be sprayed directly on the skin of children, that Vioxx was safe. This latest shot, according to the manufacturers themselves, is still in the experimental phase.
Thank you very much. The chair calls David Strang.
Good morning, members of the committee. My name is Dr. David Strang. I am an emergency physician with 32 years of practice experience. One of the most basic tenets of the practice of medicine is that of informed consent. Informed consent. Think about what that simple phrase means. We as healthcare providers inform the sick, the injured, the patient. and they give us their consent to proceed or not to. In the process of providing informed consent, we are obligated to present the patient with the risks and benefits of the treatment, whether it be a medication, a surgical procedure, or any intervention to which they are being asked to consent, even immunizations. If after being presented with those risks and benefits, they decline the treatment, that is their inviolate right as human beings. Government plays no role in this decision. If you dare to vote no in this bill, you are by default voting yay to eventually allowing a big brother police state, one where there is no individual freedom, no right to self-determination, and one where there is no control over your own body.
Thank you, Dr. Hayes.
Strang.
Dr. Strang. Now the chair calls Dr. Randy Hayes.
Can you hear me all right?
We can.
Thank you. I am a family doctor, 35 years, retired, and 25 years the founding chair of the Concord Hospital's Ethics Committee. Immunizations are one of the crown jewels of science-based medicine. Between 94 and 2013, 730,000 deaths of children and 21 million hospitalizations prevented. There is a long history of U.S. courts allowing states to legally mandate particular vaccines for particular populations where there exists overwhelming public health risk. I, along with the medical society, strongly oppose HB 220, which overemphasizes privacy rights of a person at the expense of minimizing compelling public health benefits of such treatment. It is not a state versus individual right. It is working through the complexities of modern living. Thank you.
Thank you, Dr. Hayes. The chair calls Christine Stoddard, who is identified as a lobbyist from the Bi-State Primary Care Association.
Good morning, Mr. Chair and members of the committee. For the record, my name is Christine Stoddard and I work for Bi-State Primary Care Association. We advocate for expanded access to healthcare services and also represent community health centers across the state of New Hampshire and Vermont. I would like to echo what Dr. Daly said and what Patricia Tilley said, and also focus particularly on the discrimination aspect of this bill. Sorry, I was just walking in my office and I'm out of breath. When community health centers are required to follow CDC recommendations on immunizations and have policies on those, if one of their employees chooses not to vaccinate or to receive a vaccination, they might be required to wear additional PPE or stop their clinical work. Does this mean that they would be discriminated against by their employer? And I think that's an unanswered question in this bill that would be important to address. And also, I would echo their concerns on the state's facility licensing requirements on TB testing and immunization requirements.
Thank you very much. Dr. Eric Schessler, it says here you're a pediatrician.
Hello, can you hear me?
We can, thank you.
Yes, I'm Dr. Eric Schessler. I'm a general pediatrician that works in Manchester. I'm also the president for the American Academy of Pediatrics. And we strongly oppose this bill for a lot of the same reasons Dr. Daly had mentioned previously. I'm one of the individuals that gets to give out a lot of these vaccines, and we do a great deal of informed consent with families. And families do ultimately have the decision with regards to what happens to their kids. But we do want to protect everybody, and I want to offer that protection to everybody consistently. And I have a large population of kids who can't get immunized. And the best way for us to protect those kids who can't get immunized for various health reasons is to make sure that as a population, we are doing everything we can to keep everybody as vaccinated as we can. And we know any laws that decrease or improve, or I should say expand the non-medical exemptions, decreases immunization rates.
Thank you, Dr. Schessler. Dr. Randy Hayes.
I believe he's already spoken. Perhaps that was the last bill. Let me bring him on and see.
Thank you. Dr. Wendy Gladstone.
Can you hear me now?
The chair is recognizing Dr. Wendy Gladstone.
You have Dr. Hayes on, Mr. Chairman.
Yes, Dr. Hayes, I'm afraid, has spoken before. He's listed here twice. So we're moving on to Dr. Wendy Gladstone.
Yes, good morning. My name is Dr. Wendy Gladstone. I live in Exeter. I'm a retired pediatrician and former president of the New Hampshire chapter of the American Academy of Pediatrics. I am speaking today on behalf of the chapter's membership, which consists of hundreds of board-certified pediatricians from across the state. As Dr. Schessler, our current president, mentioned, we strongly oppose House Bill 220 for many of the reasons already given. I would like people to think about medical freedom as freedom for children who are unable to be vaccinated to be protected from contagious diseases, which are spread by unvaccinated other children. Of course, nobody in the state wants to be able to demand whatever medical procedures they like, but there are some situations in the preservation of the public health where requiring vaccinations is essential, and passing House Bill 220 will weaken our current situation, which is to have a very robust vaccine program to protect our children. Thank you.
Thank you. The chair recognizes Thomas McLeod.
Yes, thank you, Mr. Chairman. My name is Thomas McLeod. I'm a resident of Mount Vernon. I'm the chair of the Liberty Defense Fund in New Hampshire and a member of the leadership group of Health Freedom in New Hampshire. Mr. Chairman, in 2019, our family left our home state and moved to New Hampshire in search of medical freedom. We support this bill. I have prepared more extensive remarks on the ethical principle of informed consent, but due to the 1-minute restriction, I will now submit my prepared remarks as written testimony. Thank you.
Thank you, sir. The chair recognizes Rebecca Kishinevsky.
Ms. Kichineski, if you are online, could you please raise your hand? I don't see her online.
The chair recognizes Irina Walsh.
I do not see Ms. Walsh.
The chair recognizes Paulina Sayas. And it's your email address ends in MD, so I assume this is Dr. Sayas.
I do not see Ms. Sayas.
The chair recognizes Laura Condon.
Hello, can you hear me now?
Yes, we can.
Okay. My name is Laura Condon. I'm from Bedford, and I'm a volunteer advocate with the National Vaccine Information Center. And I work to educate, be a resource, and advocate as needed. And I support the informed consent ethic, and I support this bill. I note that there is no mention by DHHS of the risk or harm from vaccines, but we know that through the Vaccine Injury Compensation Program, then over $4.5 billion has been paid out to those injured and killed by vaccines. There are now reports coming in of adverse effects of COVID vaccination, including 501 deaths, including one of a 44-year-old New Hampshire woman. There is also serious injury and illness following COVID vaccination as reported by the CDC, including a higher rate of appendicitis, heart attacks, and strokes. The VIIRS report is essential part of reporting these vaccine injuries. I call on everyone to fulfill their obligation. We do have immune systems. The evidence of mild or no symptoms in the majority of those infected with COVID is evidence of natural immune systems at work.
Thank you, Ms. Condon. The chair recognizes Tatiana Taranov.
I do not see Ms. Tatanoff.
The chair recognizes Holly Stevens, a lobbyist with New Futures.
Good morning, Chairman. Can you hear me?
Yes, I can. Thank you.
Good morning, dear Chairman and members of the committee. My name is Holly Stevens. I'm the Health Policy Coordinator at New Futures. I will let you read more about New Futures in my written testimony to save some time. New Futures is testifying today in opposition to House Bill 220. You've heard a lot of discussion from doctors and Dr. Daly from the department regarding why mandating vaccinations in certain situations is so important. I do just want to caution you that this bill as introduced is very wide, you know, and covers a lot and could have a lot of unintended consequences. And with that, I'll conclude my oral testimony, and you can ask me any questions if they come up as you're contemplating this.
Thank you very much. And finally, on my list, we have Holly Ruocco.
I do not see Ms. Ruocco.
Christina, do you have any late signers who wish to testify?
I do have some hands. I do actually see Rebecca Kishinevsky, whom you had already called, but she appears to be online now.
All right, I didn't quite hear the name.
Rebecca Kishinevsky.
Okay, the chair recognizes Rebecca Kishinevsky.
Thank you so much. I appreciate your time and consideration. Our family also moved here recently from New York State. We moved to this beautiful country, this beautiful state for increased freedom in the live free or die state. And I just want to say that it's so vital when there is any risk involved that there be informed consent. We learned this the hard way through World War II and in other times and spaces in history. And just really call upon New Hampshire to be leaders, to empower the state of New Hampshire, to be able to make informed consent for our own selves and our children, and trust in the individuals to do the right thing for our families and for one another. Thank you.
Thank you. Is there anyone else?
Yes, we have Marie Ramos from the New Hampshire Medical Society.
Thank you very much. Bring her on.
Thank you, Mr. Chair. My name is Dr. Marie Elizabeth Ramos. I am a family physician that's been practicing full scope family medicine, including surgical obstetrics, for almost a dozen years now. Through my career and with the Medical Society, we are speaking in opposition of this bill, partly because of what has been said, but I'd like to add additional commentary. One, I would like the committee to be aware of the difference between personal choices regarding non-necessary procedures versus public health necessities that have been shown to save lives. I would like to quote the World Health Organization that says that, quote, in 2018, about 86% of the world's children received vaccines that would protect them against polio, diphtheria, tetanus, pertussis, measles. Immunizations currently prevent 2 to 3 million deaths per year. Despite the success, however, more than 1.5 million people worldwide die from vaccine preventable diseases each year.
Thank you very much. Is there anyone else?
I have Christine McPherson.
Yes, the chair calls her and she has 1 minute.
Hello, can you hear me?
Yes.
Hi, thank you. With the 1 minute I have, I'd like to share that I also moved my family from New York State. And as I understand this bill, it is about not whether vaccines are effective or useful for public health, but about whether the state has the right to impose their will. And you as a group of legislators have a very difficult position right now. You don't have the right to make a medical choice for me, my family, or anyone else in the state of New Hampshire. You only have a right to inform public health practices and decisions which take a variety of forms, not just vaccination. So we could argue for days and days about whether vaccines are wonderful and effective, but the point is should you as a legislator decide for other people, please do the right thing and don't try to decide for other families. I can tell you from my own devastating experience, I had 3 top doctors in New York State and New York City behind my family, and it didn't make a damn bit of difference. And I lost everything, my home, my mother, my community, everything. Please don't put yourself between doctors and children and families and parents and schools and jobs and income. Please, I beg you.
Thank you, Christine. Is there anyone else?
I have Wendy.
You have what? Wendy.
Wendy.
The chair calls Wendy, and first start by letting us know whether you're for or against the bill, and then you have 1 minute.
Thank you. Can you hear me?
Again.
Okay. I strongly approve of this bill. I'm hearing a lot of big corporations and organizations opposing this bill. And while I appreciate everyone getting a voice to their opinion, there is no data or science that you can present to me that can convince me that anyone has my loved one's best interest in mind more than me. So I urge you to approve this bill. This is not about our choice of vaccinations. This is about our freedom. It's about our choice to make our own choices and nothing else. I appreciate your time today, and I strongly urge that you approve this bill.
Thank you, Wendy. Anyone
Thank
else?
I don't see anyone else. We do have Rebecca Kishinevsky. She's already spoken. Actually, we have John Schmidt, who's just raised his hand.
Okay, the chair recognizes John Schmidt.
Mr. Schmidt, you're currently muted.
Okay. I'll just let you know, no one's ever going to vaccinate me. I'll fight to the death before anybody vaccinates me, state or anybody else. And the other thing I would ask you reps to do for your own good and for the sake of the people that you represent, do some research on the germ theory of disease versus the terrain theory. The germ theory has never been proven. All these vaccines are based on the germ theory. It's bullcrap from that fraudster Pasteur, and it was debunked by Bachamps a long time ago. All these vaccines, there's no need for them. Thank you.
Thank you. Anyone else?
Unless you're planning on hearing a second round, there's no one else.
With that, the chair closes the hearing. Everyone who wanted to speak got a chance to speak once. Now, I would make this suggestion. I was hoping to exec the bill, but I would like to hold it briefly, or a couple of weeks, and ask Representative Lang, are you still on the meeting?
Yes, he is.
Thank you. Representative Lang, I would suggest that the various members of the committee who had suggestions communicate with you. We are being told that there's just not a lot of time for subcommittee work. However, if people who said that they had suggestions, maybe to make the bill acceptable, would communicate with you directly, and then you could craft an amendment and get somebody on this committee to sponsor it for you, we could present that when it's time to exec. Would that be acceptable to you?
Mr. Chair, thank you. Yes, that would be completely acceptable. Feel free to email me at my legislative email address, and I will be happy to take any recommendations in play and do all the legwork and get the amendment written up and drafted so it can be presented to the committee.
Then we'll do that. Thank you for being willing to do that. Is Representative Marsh on the meeting?
Yes, I am, and I'm sending an email to Representative Lang, so we'll work this out.
I'm asking Representative Marsh if you could take the next bill. My cell phone, which is my lifeline to the sentient universe, is out in the car and I've got to go fetch it. So would you run Bill 221 for us, please?
Yes, I'll be glad to do that. Give me a second to pull up the list of people.
Well, I can start it anyway. We open the hearing on House Bill 221, making the state vaccine registry an opt-in program. The chief sponsor is Representative Lang, and I will call on Representative Lang. And as he starts to speak, Representative Marsh, if you would take the meeting.
Thank you, Mr. Chairman. Thank you, Mr. Vice Chairman, and thank you, committee members, for taking my testimony today. I introduce House Bill 221, an act making the state vaccine registry an opt-in program. As many of you know, the state vaccine program was voted in, the database was voted in a few years ago. And in the initial legislation, it was made as an opt-out program. However, all of the information I've gathered is the opt-out program is fairly non-working, and that people aren't informed they have the right to opt out, or if they are informed, it's small print on the back of a form that they sign when they go get their vaccines, and it's not a verbal opt-in or opt-out. So people are unaware of the fact that they can choose to opt out of this database and state database. So what this bill does, and I brought the bill into alignment. If for those of you who are in the House, again, I'm Representative Tim Lang from Belknap 4. I'm in my third term, and back in 2017, we had a constitutional amendment about the right of the New Hampshire citizens to be safe in their information from the state and collection of information from the state. This was a constitutional amendment that passed the House with greater than required amount. I think it was 2/3. And went to the people of New Hampshire for a vote in 2018. And the citizens of New Hampshire, I think it was 85% of the citizens of New Hampshire agreed that the state should be, that the right of a citizen to be protected in their data from the state is important enough that they put it in the Constitution. That is now Article 2B. And so this bill is to align our current statute with Article 2B. So instead of this opt-out provision that is not clearly informed to the people getting a vaccine, we've chosen to invert this and make it an opt-in. So again, the healthcare provider, just like an informed consent, would have to ask the person getting the vaccination whether they can have their data stored in the state database. Again, I think this brings the program into an alignment with what the citizens in New Hampshire want, as evidenced by that 85% vote on protecting the privacy of their data. That is all I have.
Thank you, Representative. I recognize Representative Kirk for a question.
Yes, thank you very much for taking my question. Representative Lang, you made a comment about that patients were not getting the opportunity presented to them to opt in. And I have a question. Since the registry is very important for the communication back and forth between, let's say, a pharmacy and a provider, or to the DHHS to help look at where we need better vaccine coverage, would you be amenable to an amendment which would require, a information sheet be given to a patient for them to read to understand what the rationale is for this program, and require their signature for them to be able to decline opting in? In other words, it would not be an automatic opt-in, but they would have to decline that and acknowledge that they are aware, again, informed consent, of the impact upon their health care that may come from them not opting in. Would you be comfortable with that?
I understand your question is as long as there was some sort of written informed consent that was explicit for the opt-out, that they were informed they could opt out. Again, I guess I don't see, I'm putting this in alignment with the Constitution. I guess if that's the only way you guys will pass the bill, I'll take that better than nothing. But again, as you read the constitutional amendment to 2B that says an individual's right to live free from governmental intrusion in private or personal information is natural, essential, and inherent. That's what was passed, and that's what the citizens of New Hampshire wanted. So I think that it's more appropriate to ask, can we keep your data, rather than ask, is okay, do you want to opt out of having the data? I think it's more appropriate to ask permission to get the data first.
Representative Knurk, you're recognized for follow-up.
Yes, I appreciate that, but is it not important as part of informed consent for the individual to understand the implications of them not opting in? In other words, informed consent requires a two-way street. It requires education as to what the implications are if you do or do not do a procedure, or in this case, signing in.
Thank you again, Representative Knurk, for your question. Again, my answer is, if the choice is, do you want to opt in? And if you don't opt in, then this is the potential, then I'm fine with that. I don't want the inverse. I don't want to force them to opt out. And, oh, by the way, if you opt out, this is what happens. I want the citizen to make an informed decision and say, yes, I want my data in the database.
Thank you. Are there any other questions for Representative Lang? Representative Merchant.
Thank you, Mr. Chair. Representative Lang, is the underlying concern here is that data is going into a state database and the data would be shared outside of the reason for it being in the database? And we have many databases within the state itself. And I think a constitutional amendment was to try to prevent the state from releasing the data without the patient's approval. Is that kind of the intent behind the bill?
Again, the constitutional amendment doesn't talk about sharing data at all. The constitutional amendment just says that, again, as I go back to it, it's an individual's right to live free from governmental intrusion into private or personal information. And so I think that's a very broad statement. And it says that anytime the government's going to collect data on me, I should know that it's collecting the data and approve it, rather than.
So if that's, if I may, Mr. Chair. Sorry.
You may have a follow-up.
Mr. Chair, if I may follow up.
Yes, you may. You may follow up, Representative Merchant.
Okay, thank you. So as long as the patient is aware of the fact that there is a way for them to prevent the data from being released, would that not suffice as well?
So again,
what I'm trying to get to is that the database itself is the important.
So again, the constitutional 2B doesn't talk about the sharing of data. It's about the collection of data. And so my statement would be that, again, if the person opts in, then they've given consent to the state to use the data as it chooses. But if the person never has a choice to opt in, and it's an automatic, you have to opt out, and somehow you're supposed to magically know that you're supposed to opt out, then I think that's inappropriate, and that's in violation of the constitutional amendment and the will of the people. 85% of the people do not want the government to collect their private data, and we're talking about the most, one of the most sensitive data. We're talking about medical data. And so even more so, we should be even more stringent. And so if the state's going to collect this data, I think we need to have sign off by each individual citizen that chooses to allow the state to do that.
Thank you.
Any other questions for Representative Lang?
Representative Marsh, I will do what you did for me, and that is if someone in the room has a question, I will text you. And I just texted you. Representative Gay has her hand up.
I recognize Representative Gay.
Thank you, Mr. Chairman. And thank you, Representative Lang. How would you feel about the handout sheet that Representative Knurk is talking about, is recommending, but use that sheet as an opt-in? I also don't like the idea of having to opt out. Papers can get lost. People can miss knowing that they have to opt out, and I don't want my data collected by the state. So, but I think the informative sheet sounds really useful. So how would you feel about using the same sheet that Representative Knirk is talking about, but use it to opt in?
So thank you, Representative Gay, and welcome to see you again, ma'am. So again, if you read the language of the bill on a second sentence, says no patient's immunization or vaccine information shall be entered into the registry without explicit written opt-in consent of the patient or the patient's parent or guardian. So again, I think an informative sheet that the person can see, the patient can see, choose whether, they can write on there what is the reason why the state has this database, and then the person can choose to opt in or opt in if they choose to. I think that's appropriate, and that's exactly what's written in my bill.
Thank you.
Are there any further questions for the representative? Seeing none, I will ask Representative Pearson if he wants to take the chair back or if he wants me to continue with this hearing.
I'd love you to continue, Representative Marsh. Thank you.
All right, very well. The chair calls on Beth Daly.
Thank you, Representative Marsh and members of the committee. My name is Beth Daly again, Chief of the Bureau of Infectious Disease Control here at DHHS. I'm here to provide testimony in opposition to House Bill 221. The immunization registry, which we also refer to as an IIS, Immunization Information System, is an electronic system that tracks administration of vaccines. They offer many benefits to our public health agencies, as well as healthcare providers and individuals. They prevent duplicate immunizations. They increase our immunization rates by promoting up-to-date immunization recommendations and helping to remind patients when immunizations are due. It also benefits patients and families when they want to access a complete electronic copy of their immunization record that would include information from all of their healthcare organizations, regardless of where the vaccine was provided. And then finally, we use that information to assure accountability of our publicly purchased vaccines, as well as to target communities with low vaccination rates to prevent and respond to infectious disease outbreaks. New Hampshire is the last state in the country to implement a registry, and every other state has one in place. Under RSA 141C20F, this statute directs the department to establish and maintain a state immunization registry. This statute expressly states that patient participation in the registry is voluntary, and the corresponding administrative rule outlines a process for patients to opt out of participation, which already includes asking people if they want their information in the registry. And in fact, the rules explicitly say that the opportunity to opt out of the registry shall be provided in writing in a clear and succinct, conspicuous manner, in simple language, and provided to that patient or the patient's parent or guardian if the patient is a minor. We have not provided information to the public yet on the opt-out process. So it's true, people have not heard about this yet. And that's because we're not collecting any non-COVID vaccine data yet. We're just standing up our registry now. And when we are ready to begin collecting that vaccination data, information on the opting out process will be very broadly shared and available quite easily on our website. This bill seeks to change our registry to one that is opt-in, which we oppose for a number of reasons. First and foremost, our current opt-out approach already protects an individual's ability to choose not to participate while not adding costly burden to providers and patients. Nationwide, almost all of the states have opt-out policies rather than opt-in. And there are just 3 states that have opt-in policies, in large part because of the lower cost, lower burden, and increased public health benefits of the opt-out model. So Texas, I want to tell you about really quickly. It's one of those 3 states that have an opt-in policy. It's been in place for many years. They're actually now working to implement a change to become opt-out after they conducted an evaluation of the cost associated with their opt-in model. And they found that it cost them $1.4 million annually to obtain consent for Texas's opt-in model. Another point I want to make is that nationally, the proportion of patients who opt out of IIS participation is just 5 to 10%. So requiring that providers ask in writing and with a signed document that every patient opt into the registry. When 90 to 95% of the population do not opt out, this creates substantial unnecessary burden and cost for our healthcare providers. So keeping our registry opt out will reduce administrative burden and free up the time of our healthcare providers to engage in appropriate patient care activities and allow healthcare providers to efficiently document their patient records for immunization. If we allow an opt-in registry, it will result in incomplete and low-quality information that will significantly decrease the utility of this system. And national public health experts recommend these opt-out consent policies because they do respect an individual's right to privacy, while also maximizing the availability of the data that we need. In New Hampshire, these individuals who do not want to participate already have a process in place to opt out. And as such, the department strongly opposes House Bill 221. And again, thanks for the opportunity to testify, and I'm happy to answer any questions.
Thank you, Dr. Daly. Do we have questions for Dr. Daly? Representative Shapiro, I recognize you.
Thank you, Mr. Chair, and thank you for taking my question. When the representative initially introduced the bill, he indicated that instructions about opting out were in small print or not readily available, but it sounds like that hasn't actually gone into use yet. So I'm wondering, as well as having instructions about opting out on a website, what would you think about, either in written form or oral form, a discussion about opting out occurring as the immunizations are given in the provider's office?
Thank you, Representative, for that question and suggestion. So that process is already outlined in our administrative rules. The provider, as they're providing that immunization to the patient, does need to provide them an opportunity already to opt out of the registry. So that is accounted for there. The providers are the ones who ultimately have the responsibility for carrying out this process of opting out their patients, and the ones that have to provide information about the registry. And so I'm not aware that any providers in our state are providing this information yet to patients because we have not requested any immunization data from them, other than we are currently using the registry for COVID vaccine tracking.
Thank you.
The chair recognizes Representative Gay.
Oh, thank you very much, Mr. Chair, Mr. Vice Chairman, and thank you, Dr. Daly, for taking my question. I'm just about to look up the population of Houston, because that's just one small part of Texas. I'm from Texas, and you could put New Hampshire in there multiple times just in the city. So I'm expecting that the 1.4 million to opt in Texas would be negligible in New Hampshire. And as a proponent of keeping my medical records separate from any state registry, I think that's pretty low price to pay for my privacy.
Representative, do you have a question?
Yes, does she respect my right to privacy?
I certainly do, and there's a process for you to opt out of the registry.
I thank you. Are there further questions for Dr. Daly?
I have a question. Leah Cushman has a question.
Representative Cushman, you may ask.
Representative Cushman has a question.
Yes, thank you.
Excuse me, Representative Cushman, you've signed up to testify, and I was about to recognize you, so I do not recognize you for a question. Okay. Are there any other questions for Dr. Daly? In that case, the chair calls on Representative Cushman to testify.
Thank you, Mr. Vice Chairman. Members of the committee, I have sent you an email with a policy memo on this bill. I strongly support this bill. I've supported it before it was even a written bill. I lived in Massachusetts for a while when they implemented their immunization registry and found the problems with their system. They also have an opt-out system, and in their law for the immunization registry, it's actually required that they inform you that your information will be going into it and that you may opt out. However, in practice, this is not taking place. And I was going to ask Dr. Daly if she had ever researched the reality of whether patients were informed by providers that they have the right to opt out. We have seen problems with opt-out forms in public schools when it comes to medical and dental clinics, where parents receive a form and it says, if you don't want your child to participate, then fill out this form, and then the forms are lost, and they end up getting treatments that they did not consent to. So this is my testimony. So my, as a nurse, I am a strong proponent of informed consent. Self-determination is a basic human right. You know, this is our medical information, and under HIPAA, we have to give consent to everyone else for them to have our private health information. Government should be no different. It should be an explicit, outright consent, and not a easily obscured and missed through human error opt-out process. And I would just ask that you all support this bill. Thank you.
Are there questions for Representative Cushman? Seeing none, I thank you, Representative Cushman, and call on Holly Stevens from New Futures. Christina, is Holly Stevens still on the call?
Yes, she is.
Thank you, Chairman, and all of the committee members. I was still on the call, but I raised my hand to make it easier for Christina. New Futures appreciates the opportunity to testify in opposition to House Bill 221. And I always forget this part. I need to say, for the record, my name is Holly Stevens. I'm the Health Policy Coordinator of New Futures. I don't want to repeat anything that Dr. Daly said, because I think she said it a lot better than I ever could. But I did want to reiterate that, you know, she talked about things such as children that are potentially over-immunized or under-immunized when their parents want them immunized. You know, when we're monitoring community immunization rates to know, you know, what the spread of a disease may be. Identifying coverage gaps and things of that nature. And we know from history, I mean, even looking at the medical provider surveys, when those were an opt-in survey to participate in, the response was so low that the data collected wasn't even usable. They didn't know where anybody was. They didn't know where they were practicing. They didn't know if they're in retirement. Didn't even know if they still resided in the state. So we know from our own experience in this state that when we make things opt-in, people rarely will do what needs to be done in order to overcome that barrier to opt-in. Whereas we know that when we make them opt out, people that don't want their information in there absolutely make sure that they make it known that they want an opt out. And so I think, you know, when we've got a lot of individuals that might move from one primary care office to another, and if they have small children, they may not know what immunizations their children have had. So they go to the new doctor's office, and that doctor's office has no way of knowing, without having releases signed and obtaining a full medical record, what that child has or hasn't had. And I think it goes without saying that Representative Merchant could easily speak to the fact that the pharmacies seem to send information to the doctor's offices that never gets recorded, in the electronic medical records. So, you know, any vaccines that may have been obtained in a pharmacy, which I know children's vaccines right now you can't get in pharmacies, but we don't know what the future is going to bring. We do know that the pharmacies are looking at trying to expand into at least influenza PD vaccines. And, you know, just in an effort not to end up over immunizing children. This is extremely important. Or as I said, under immunizing them. If they have a vaccine that they need to receive 3 doses of in a certain amount of time, this is a very good tracking system. Families that have a lot going on, it's very difficult to track these kinds of things. And it would make it much easier if this information was right at the fingertips of any doctor that they brought their child to see. You know, I know that Representative Knirk mentioned having a form that says, you know, when the doctor or the pharmacist is going to give a vaccine, somebody has to check a box and sign it. You already have to do an informed consent. When you receive the vaccine, that there's no reason why you can't say that that has to be, you know, information about the registry has to be in a certain font size, bolded, you know, whatever. Maybe they need to initial by it, that they've read it. You know, you can make that informed consent crystal clear that you know that somebody understood that it was an opt-out registry. And if they wanted to opt out, they would check a box. So with that, I think I've taken up enough of your time. I know you've got a very busy morning. But for all of those reasons, New Futures does oppose this bill, and we urge the committee to vote inexpedient to legislate or look at doing an amendment such as the one that Representative Knirk had mentioned. If you have any questions, I'm available to take them now or in the future. Thank you.
Thank you, Ms. Stevens. Are there any questions for Mrs. Stevens?
Yes.
Go ahead, Representative Gay.
Thank you, Mr. Vice Chairman, and thank you, Ms. Stevens, for taking my question. If I'm going to opt out, does that mean at every single provider I go to, I have to tell them not to submit my information?
It's my understanding, at least when or at least I'll say it's been my experience, that every single time I go to my doctor's office, if they're going to give me a vaccination, I have to sign a new informed consent for that vaccination because they're administering something. So I think that can easily be added to that informed consent form. So you don't have to tell them anything. You just keep checking the box. It's just a little box that you would check right when you sign the form. You have to sign the form anyway. So it's not as though the doctor can forget to put it in front of you because they can't give you the immunization without getting the informed consent signed.
Any other questions for Ms. Stevens? Seeing none, the chair recognizes Patricia Tilley from Department of Health and Human Services.
I don't believe Tricia Tilley was able to stay on. This is Beth Daly, and so you can proceed.
Okay, thank you very much. The chair recognizes Laura Condon.
Hello, can you hear me now?
Yes, we can.
Okay, thank you. My name is Laura Condon. I'm from Bedford. I support this bill and I urge you to support it too. This chapter 141C20F has been on our books since 1998 and has never been changed. This bill actually doesn't change the law. It simply reaffirms the intent of the current law that the state vaccination registry shall be voluntary and clarifies the process for ensuring voluntary participation. In fact, provisions of that chapter indicate that it's voluntary, and I direct you to paragraphs 2, 3, 6E. And in fact, I'll read 6E, procedures for the registrant or the registrant's parent or guardian, if the registrant is a minor, to withdraw consent for participation at any time and to remove information from the registry. Consent can only be withdrawn if it was given in the first place, indicating this is an opt-in registry. This bill affirms that participation will be voluntarily, actively given, and not presumed. Let me remind you that this program is a redundant program. Doctors, pharmacists, schools, and you already have vaccination records. The law requires that all of these individuals have vaccination records. This is in addition to those records. In addition, parents have no access to this registry. You cannot access it, only medical providers can. So to represent that parents could use this as a tool to look up their children's vaccinations is not true. Although this law has been on the books for a long time, there is no active vaccination registry, even though over $4.6 million has been allotted to this program since 2014. There have been 2 bills that have attempted to change this registry into a mandatory opt-in registry. Opt-out registry. That is not the New Hampshire way, and both bills failed. If one is swept into this registry without consent, getting out of it is not as easy as one might think. You require the signed signature of a vaccinating physician in order to be removed from the program. You cannot unilaterally remove yourself from this registry. There's a surprise in this registry too. By rule, vaccination events are recorded in the registry. Now, I understand one might think that vaccination event would mean being vaccinated. But in fact, the rules define vaccination event to include even refusal of vaccination. So even those who refuse a vaccine and think they might not be swept into this registry will also have to complete an opt-out form, because even those who decline vaccinations become a part of this registry. Obviously, there are security concerns with any sort of database. And, we all see hackers, hacking into hospitals, banks, government entities. And so the security protection there is important. We must ensure that this registry remains active and that this is an opt-in program with your affirmative signature. I know some people have said, well, there could be a little checkbox. This is currently not being used. I have, and I'll send it by email, a Hannaford Pharmacy vaccine informed consent form they've used for years. And in teeny tiny print, buried in the middle of the paragraph, in the middle of the page, there is language: I authorize the information to be forwarded to my primary care physician, authorizing physician, or local Department of Health / in tiny letters, registry. So no one's ever going to see that. There's not a checkbox to consent for that or not. I urge you to please pass this bill and to reaffirm and confirm that this is a voluntary opt-in registry. Thank you so much.
Thank you. Are there questions for Laura Condon? Seeing none, I thank you for your testimony and call on Paula Minahan from the Hospital Association.
Good morning, Mr. Chairman, members of the committee. Can you hear me? I think you can.
Yes, we can.
Thank you. For the record, I'm Paula Minahan, Senior Vice President, State Government Relations with the New Hampshire Hospital Association, representing all our hospitals in the state. The Hospital Association is opposed to House Bill 221. I have submitted written testimony, which I will not read for you, but I do want on the record to state that, and I think Dr. Daly did a really good job. So a lot of my testimony kind of reiterates what she had indicated, but we do have very big concerns about the opt-in process, which would be very cumbersome for both the individual and the healthcare provider, creating barriers to producing a comprehensive immunization record for individuals and impede sound clinical decision-making if the healthcare provider cannot rely on complete information for their patients. I did provide you with a number of resources in my testimony that I would encourage you to review. I think it's interesting information from the CDC and other national resources, and I just would like to have you look at that later. The Hospital Association wants New Hampshire to develop a stable, reliable, and comprehensive vaccine registry that can be used by and for healthcare providers and individuals. Our hospitals and healthcare providers have been advocating for years to have a functioning vaccine registry in our state as a reliable tool in their toolbox, and we ask that no changes be made to the registry's structure before it even truly gets off the ground. And for these reasons, the Hospital Association does not support House Bill 221, and we ask that you find this bill inexpedient to legislate. Thank you, and I'm happy to answer any questions.
Thank you. Are there questions for Paul Minahan? Seeing none, at the suggestion of Representative Pearson, I'm now calling into play the 1-minute rule, and all further testimony will be limited to 1 minute as we are way behind schedule. The chair calls on Representative Jess Edwards.
Yeah, hi, I'm Representative Jess Edwards, representing Rockingham District 4. The last 4 or 5 years of my career, I was a privacy and security officer for medical device manufacturers. One of the times that I was the bad guy in the corporation was when marketing people would come to me and say, hey, we need to get away from this corporate policy of opt-in, because if we make it opt-out, it tricks more people to give us data that they wouldn't want to give us otherwise. And if we have their data, then we can do more things for them. We can make better products. We can give them better information. So at a International Association of Privacy Professionals conference about 5 or 6 years ago, a representative of the Obama administration got up and advocated strongly for the privacy community to switch to opt-out instead of opt-in, because the rate of getting data was vastly higher. But it completely ignores the concept that your data is yours. It should require an active permission by you to share your data with the government. And so
Thank you, Representative Edwards. The chair now recognizes Courtney Tanner from Mary Hitchcock.
Good morning. My name is Courtney Tanner. I am the Director of Government Relations at Dartmouth-Hitchcock. Dartmouth-Hitchcock is opposed to House Bill 221. I want to draw your attention to written testimony that I submitted electronically from Dr. Keith Loud. Dr. Loud is the chief physician at Dartmouth-Hitchcock's Children's Hospital, the only children's hospital in New Hampshire. I just want to highlight a couple of key points from Dr. Loud's testimony. COVID-19 has served as a reminder of the value of immunizations. Vaccine registries are a tool to increase and sustain sufficient vaccine rates. A systematic universal registry allows citizens to seek and obtain immunizations in a safe and convenient way while keeping providers informed. Dartmouth-Hitchcock believes that House Bill 221 would be a step backwards. This would hinder New Hampshire's work to improve the health and the safety of our children and our communities. Thank you very much, and I'm happy to be a resource for the committee.
Thank you, Courtney Tanner. The chair recognizes Mr. McLeod, Thomas McLeod.
Thank you. My name is Thomas McLeod. I'm a resident of Mount Vernon, the chair of the Liberty Defense Fund and member of the leadership group of Health Freedom New Hampshire, speaking as member of public in support of HB 221. Mr. Chairman, in May and June of 2020, my organization submitted right-to-know requests to DHHS seeking documents on precisely how the department would implement opt-out in the vaccine registry. It is clear that even as the department brings the registry online, it has not yet implemented software features necessary to guarantee even opt-out procedures. Mr. Chairman, the vaccine registry is not just for tracking vaccination, it's also available for research. In New Hampshire today at Dartmouth College, vaccine registry data from Vermont is being used by Professor Brendan Nyland, but his research is not medical research. Professor Nyland is a political science researcher, and his work involves using people's private medical data records to study how to influence them politically and how to bring their political views more closely in alignment with public health goals. Professor Nyland's research has formed the basis of political attacks on so-called vaccine resistors in New York Times and other public.
Thank you, Mr. McLeod. The chair recognizes Dr. Wendy Gladstone.
Good morning. This is Wendy Gladstone. I am a retired pediatrician. I live in Exeter. I'm a former president of the New Hampshire chapter of the American Academy of Pediatrics. I'm speaking today on behalf of the chapter's membership, which consists of hundreds of board-certified pediatricians from across the state. The New Hampshire chapter strongly opposes House Bill 21. We're in agreement with the comments made by Dr. Daly, and I will not repeat them. However, I will emphasize to the committee that although the question was made as to the cost for individual practices for implementing an opt-in or an opt-out strategy, medical practices are already very pressed for time, and the administrative burden of requiring signed form consent of an additional document to be printed and scanned into the medical record as would be required by this bill would be another reason to oppose it. We believe that the passage of this bill would result in an impaired ability for the state to adequately follow immunization status from a public health perspective. And
thank you, Doctor. The chair now recognizes Dr. Marie Ramos.
Thank you, Mr. Chair. My name is Marie Ramos. I'm a family physician speaking on behalf of the New Hampshire Medical Society in opposition of this bill. I want to share and echo many of the sentiments that were shared within our public health leaders of the community, but I wanted to share specifically my experience as being a family doctor in the state of California, working in a rural community. At the time when I started my practice of a town of 3,000, the immunization rates for the children were 30%. After the state of California started a vaccine registry, I was able to not only help our practice increase the vaccination rates up to 80%, but also I was able to reduce the amount of unnecessary repeated vaccinations for our patients. It's very important to remember that during a certain time in California, there was an outbreak of measles, and that was very true within the little town that I worked in. If it wasn't for vaccinations, not only myself, who was pregnant at the time, but also many of my patients who were sick and ailing and couldn't get to specialists within an hour would have been at higher risk.
Thank you, Dr. Ramos. The chair recognizes the last person who signed up in advance, and that is Dr. Hayes.
Can you hear me all right?
Yes, we can.
Thank you. I'll be very brief. I'm a retired family doctor and appreciate the testimony of everyone who's spoken. I speak on behalf of myself and the New Hampshire Medical Society as well in opposition to HB 221. The registry programs throughout the country, and there are 49 other states who have them, essentially will assume that the public health benefit and confidentiality safeguards that these programs provide allow the states to safely and ethically assume an implied consent to people who, to the general public's enrolling in what is essentially opt-out programs. In this time of coronavirus pandemic, our country is all too aware of the importance of having a robust, informed, accountable public health infrastructure to help us deal with any public health emergency. I believe that.
Thank you, Dr. Hayes. Christina, are there any other members of the public who have their hands raised?
Yes, we have Eric Power.
I recognize Eric Power.
Hello, this is Eric Power. I'm a resident of Brookline, and I'm in support of House Bill 221. I think it's a very important bill to have an opt-in. There's a lot of good reasons that have been stated for it. It's very difficult to get out of this process. And I'm also very concerned. I heard one of the speakers talk about the vaccination event. A vaccination event could be a refusal to have a vaccine. I was asked at the doctor's office, do I want the shingles vaccine? Do I want the flu vaccine? I'm concerned those refusals will be recorded and be part of this database to be used for whatever purpose. I think that there's a small cost for this, but I think it's a very small price to pay for our privacy. And I think our privacy is very important. I don't like the idea that we're having implied consent. I think we need to have explicit consent to be having our data be put into these databases to be used by the state and others. And without our consent, I think it's not appropriate. So I would urge ought to pass for House Bill 221. Thank you very much.
Thank you. Christina, are there any other members of the public who wish to speak?
Yes, we have quite a few. We have Representative Melissa Blazek.
I recognize Representative Blazek.
Thank you, Mr. Vice Chair. Thank you, members of the committee. I just wanted to make a quick point. Currently, as we speak, the registry is not active, meaning no vaccine or person is currently being tracked by this system. And I don't see the health of the public of this state suffering at all. So I don't see the issue with erring on the side of freedom. We cannot trick the public into consent, and people can be responsible for transferring their own medical records. I actually resent the implications of some of the opposition testimony that the public cannot practice personal responsibility. Thank you.
Thank you. Christina, who else has their hand up?
Representative Marsh, if I may interrupt here, we're making a change in the person who is wearing the muting device. That would now be Representative Weber, because Christina Dyer is trying to help multiple committees.
And Mr. Chairman, I have Alexandra Manala up next.
I recognize Alexandra Manala.
Ms. Manella, I think you need to unmute. It says you're
I'm
unmuted.
speaking in support of this bill. We should absolutely have an option to opt in here. My message to the physicians, the Hospital Association, Dartmouth Hitchcock, the Department of Health and Human Services. I understand your intentions to help us, but our privacy is more important than your objectives. Okay, we have an inherent right to live free from government intrusion. All right, so we're not interested in your registries. So to the representatives, I ask you to support this bill and allow us to opt in. Thank you.
Thank you. Representative Weber, who else has their hand up?
I have somebody whose name is Kelly, and I have just brought her up.
Thank you, Kelly. If you could please tell us who you are.
Oops. Hi, I'm here. Can you hear me?
Yep.
Yes, we can.
Okay. My name is Kelly Potenza, and resident of New Hampshire. I live in Rye. Basically, there's a lot of testimony here that's talking about something that is truly non-existent at this point. So I think the point, and I think the speaker was Laura that was talking about it, is this is something that's already in place. We are just supporting this. So it is basically, this bill simply clarifies and explicitly states that the vaccine registry shall be an opt-in program. So it's already, the law is already there. The bill doesn't change the law. It just clarifies it. So I think that's the key point here. There's a lot of testimony going on, but the point is that, and I sent you guys an email that just clearly states this. This bill just ensures that the intent of this law is basically properly protected.
Thank you for your testimony. Representative Weber, can you tell me who else's hands are up?
I see no other hands at this time, Mr. Chairman.
Thank you. As there's no further public testimony coming before the committee, I will declare this public hearing closed and turn the meeting back to Representative Pearson.
It gives me great pleasure both to thank Representative Marsh for filling in for me and declaring a 5-minute recess. Representative Gay, pass.
Thank you.
Welcome. I know. Once we get used to this, and second,
Mr. Chairman, if you are in the room, and it appears to me that you are, somebody in the room is going to have to unmute the room so that we can hear the people in the room.
How's that?
You're back. Thank you. And Mr. Chairman, if you can hear me, the other issue that I have is I am without enough different pieces of electronics to see the list of people who have signed up to testify. So if you can call people from the list, and then I will be able to promote those people who are not already on the call.
And I have the list, Representative Weber, as of 8:30.
Well, if we go down through that list, and then I can promote, and I will promote people as you call them, and then you can, I can see the hands up from other people who might not be on the list.
To quote the great actor from the television show Mr. T, I love it when a plan comes together.
Well, it's a plan anyway. The execution may be marginally flawed, but we'll do our best.
By the way, everybody, I just want to make a quick announcement for those who may not be aware. Just a little while ago, in our email came an amendment to HB 601, the next bill that we're hearing, that is a replace all amendment.
Oh, God.
Yes, exactly. So it's important that we have that, since that is actually what we will need to be discussing. So I should have looked up exactly when it came to help guide you, everybody.
From whom did it come?
I'm trying to find that right now. 601. God, here it is. It came from Ann, which would be Ann Fitzgerald, and House Committee Services. Actually, no, it came from HCS. So look for HCS in your search. It came at 10:19 a.m.
And hard copy was delivered to the room shortly thereafter.
Exactly, yeah. Ann Fitzgerald sent an email that she made copies and they were going to bring them down. So you guys should have them, and everybody else should be able to find it in their email again at 10:19 from House Committee Services. It usually identifies as HCS.
Is that 253 you're just talking about too?
And thank you, Representative Knirk. You stole my thunder.
Oh, okay, sorry. Well, actually, though, may I also make one other thing, too, that I have sent this to Chair Pearson, and everybody else should have it. I know that we may or may not do any executive bills later today. We just this morning I just received amendments that I had submitted for HB 240 and HB 163 a couple of hours, or an hour or so ago. I emailed those to the committee members. Also, again, asks HCS to bring down about 8 copies for the room. I do not know if we will get to those, but I wanted you to be aware that those are available in case we get to them. Just behind the scenes work.
Thank you very much.
You're welcome.
All right. With that, I open the hearing on House Bill 601, and for the benefit of not just committee members, but all of those whose name is on my sheet interested in testifying, you will need to know that the bill that you prepared to testify on has been replaced. And it's one of those amend the bill by replacing all, which doesn't mean every single word, but it just means a lot of them. And so with that, the chair recognizes Representative Ammon to speak to the bill of which he is prime sponsor. And please go out of your way to let us know the differences, because we've all prepared on the old bill. So Representative Ammon, please present your new bill, new amendment.
I am not seeing Representative Ammon. If he is on the call, if he would raise his hand, that would be helpful. Okay, got it. Thank you, Representative Ammon, and you should be able to proceed.
Thank you, Mr. Chair, and thank you, members of the committee. For the record, my name is Keith Ammon, representing Hillsborough, District 40. I live in New Boston. I represent New Boston, Mount Vernon, Milford, and Hollis. I'm the prime sponsor of House Bill 601, which seeks to address a problem that needs legislative attention. We have a new state database being built, and you've probably heard similar testimony in the last hearing. New state database being built for the social services system, but we do not have informed consent for individuals receiving services in that system. House Bill 601 in its amended form proposes to legislate informed consent. By way of background, I agreed to sponsor House Bill 601 after I learned about a state contract awarded during the state of emergency that would create a new closed-loop referral system for social services at the Department of Health and Human Services. The new system is meant to link social service providers, including state agencies, not-for-profits, and private providers into a database that allows them to share and retrieve personal information about New Hampshire residents seeking and/or receiving social services. The purpose of the database is to help with coordinating care. While this is certainly a worthwhile goal, I think the legislature should understand how this system will work and what privacy protections will be in place in the database for individuals seeking services. Before the state created a vaccine registry or a prescription drug monitoring program, privacy issues were discussed. This database should not be different. As you may recall, in 2018, New Hampshire voters adopted a privacy provision to the New Hampshire Constitution. They did so by 81% of the voters. And that reads, an individual's right to live free from governmental intrusion in private and personal information is natural, essential, and inherent. Those words don't protect themselves. It's up to the legislature, the executive branch, the judicial branch, to make sure that those words, adopted 81% by our constituents, have effect when it deals with their personal information. We all have constituents who may be going through tough times and need social services that could range anywhere from food assistance to housing assistance to other services for child welfare and so on. These constituents will now be added to a database that will house their information for other social service providers to see and share, a loosely defined network. From what I understand, a person may sign only one consent form, and that will allow their information to be shared beyond the agency actually providing them services. This committee is well versed in privacy issues as they relate to health and human services. There are questions that I think the department should answer that would help us as legislators understand the new database program and what it may mean for our constituents and their privacy rights. Here are 3 questions I hope the committee will have answered. Question 1, does the person seeking services know what information is being shared about them to other organizations? For example, is it household income, description of their issues, or what other information? Question 2, does the person seeking services know when and how often their information will be looked up and which organizations specifically are accessing it? That question deals with searchability of their information. Question 3, could the person seeking services be turned down for services if they don't want their information to be in this database? Could they be denied services because they want to protect their privacy? Moving on, my intent is not to impede the work of the department or the services provided to individuals needing assistance. My questions are raised by the implementation of this new database system and how it affects the services and privacy protections of our constituents. In light of some of the concerns raised about the bill as presented, in light of the bill concerns, and I emailed this last night to the committee about 7 p.m., the draft, and it was finalized a few 15 minutes ago or so by OLS. To address these concerns, I had an amendment drafted by OLS for the committee's consideration. It's Amendment 2021-0253H. 0253H. The amendment replaces the bill to specifically address 2 issues. So here's the differences. First, it would require an informed consent form for individuals each time their information is shared so they can take control of protecting their privacy. Second, it requires that services can't be withheld if they choose not to be included in a database. And the draft amendment was sent to the committee. I know our legislature and our constituents take privacy very seriously. We set parameters to make sure agencies, government agencies across the state use private information in limited ways. I appreciate your expertise in reviewing these issues. There are others who will be able to speak more specifically to the language in the amendment that will come after me. So in conclusion, I hope you look favorably on House Bill 601, and I thank you for your time, and I'm happy to answer any questions as able.
Are there any members of the committee who have a question of Representative Ammon?
Representative Shapiro has his hand up on screen.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you, Representative, for taking my question. As you know, most medical practitioners operate under the HIPAA Act, the Health Information Portability and Accountability Act. Have you researched how the specific informed consent in your bill would align or not align with HIPAA?
That's an excellent question. It's my understanding, I'm not a medical professional, that HIPAA, it's a federal requirement, but it deals with patient privacy. This bill deals with a person's information in the social services system. So it's, I guess there would be some analogies between the two, but I think this is a simpler issue as it deals with a person receiving social services, which may or may not include, require HIPAA compliance, which would be a separate issue. That's my understanding.
Follow up?
Follow up.
Maybe I'm not understanding completely, but it does seem that on page 2, lines 16 to 18 and 20 to 22, where you talk about a very specific consent form, that it includes health information as well as social service information. And I am specifically concerned that these may be overly broad in giving permission to share information because they don't seem to say specifically what organizations you're sharing the information with. Could you comment on that?
Yeah, I could try. I mean, so the intent of that form is anytime a new person comes into the system, that their information, before their information is shared, because we know once it's shared, it's hard to put it back in the box, that they would have to sign a consent. And the differences between the two, section 5 and section 6. I'm sorry, here I'm looking. The forms are identical. One section deals with if you're presented in paper form. The other is if you're presented in electronic form. The consent form would be filled out before that information went to other agencies, including the ability to opt out. So your question about HIPAA, I think, is interesting because there might be some overlap depending on what information is stored in this database, that some of the information may also have a HIPAA component to it. And I couldn't answer the specifics on that, but you might want to ask the department about that.
Thank you.
Any other members of the committee?
Yes, Mr. Chairman, Representative Knirk's hand is up.
Representative Knirk.
Thank you. I actually had a question also about the forms that are printed. Since that says verbatim what the form has to say, I was concerned about the reading level, since we usually think about trying to write documents for people at about a 6th to 8th grade level. And the question would be, do we think that the average person will understand what a searchable database is, particularly if they happen to perhaps be a little older with a gray hair like we see in our committee?
That's a great question, and I think that's a valid concern. Readability is should definitely be as broad as possible. I'm actually a database professional, so I have a lot of experience designing and administering databases. So maybe that was an oversight. Do you have a suggestion for a different term? The idea is that the data can be stored, but if it's searchable, then lots of agencies can access it, because searchability means it's not just their name or some identifier. It could be searchable based on income level or what services they've received in the past, right? So it could be like a gold mine for harvesting data from the database. If it's not searchable, then there would have to be a specific point of contact about that individual and that agency in order for that data to be shared, if you understand what I mean.
May I respond? I would just say that it is always a difficulty if you are an expert in this. It's difficult to bring it to the right level. We might want to get somebody else to look at it who doesn't understand it and see what word would work for them. But that's a different issue. Thank you.
Thank you. That's a great point.
Mr. Chairman, I have Representative Nelson, and then Representative Woods, and then Representative Cannon, and then Representative Merchant.
The chair recognizes Representative Nelson.
Thank you, Mr. Chairman. Reading this over, I just want to double check on something. Personal information. In the past, we've had committees, for example, that have studied such things as somebody that has had an abortion, not the name of somebody, but just information to try to track how many abortions are done in the state of New Hampshire. Would that number, not the person's personal information, be counted or would be used, or would prohibit them using the number of abortions?
As an example, that's a controversial example, but let's say it was some other issue like visiting a food bank or something, right? This amendment deals with personal identifiable information. So aggregating data across town, county, or whatever way you want to aggregate it, if you aggregate it high enough, it becomes non-identifiable, and that would be a different issue that this bill is not trying to address. Does that answer your question?
Yes, it does. Thank you.
Thank you.
The chair recognizes Representative Woods.
Thank you, Mr. Chair, and thank you, Representative Ammon, for taking my question. I'm trying to get my arms around just exactly how this process would work under this bill and the perhaps downside, and thinking about an individual who applies for a particular program, a state program, and then by chance wants to apply someplace else for another state program. Does that mean they would have to go through the same process again? If the agencies couldn't speak to one another, it's sort of like going to the doctor's office. You were just there 2 days ago and they want you to fill out all the forms again. In this situation, sometimes the folks that need the services don't have access to ready online filling out forms. And we've seen the confusion with the COVID program about people trying to get on. So I'm trying to get my arms around how this is going to play out in practice.
Yeah, that's a good question. So we're trying to find a balance between two things. One is the people receiving services, their rights, particularly the right to privacy, and the efficiency of the system, right? Those two things are at odds. And this bill puts a spotlight on the privacy issue because before now it hasn't been addressed. And so I think just on a higher level, that's kind of what we're trying to look at here. And as legislators, both of those needs of our constituents are important. So that's just a high level like introduction to how I think we're approaching this. How it works on the ground, the consumer of the service basically can opt in to this network. And there's an issue with the definition of the network of providers, that it's kind of loosely defined. You know, it can change over time. And so the network might have a certain number of providers in it at the current time, but then over time that network grows and changes. And if there are no privacy protections, not only don't you know who has your data currently, but over time, more and more providers or different providers can get access to that data. So this bill is trying to put a brief pause when that data moves, that if you're consuming a service, that you are at least informed and are given a chance to express your willingness to have your data move through the network. Does that answer your question? That's the privacy concern that we're trying to address here. The exact implementation, it's difficult to predict. I think you'll have someone from IT of Health and Human Services come behind me. That might be a question for someone that understands better the implementation, because I'm not familiar with that directly.
The chair recognizes Representative Cannon.
Thank you, Mr. Chair, and thank you, Representative, for taking my question. As I was reading through this amendment, there are 17 mentions of health. And so I raised the question again about HIPAA requirements, as I just filled out a form for my therapist and psychologist to send information along, and I had to identify the specific things I would allow to be transferred from their office and who they were and who I was transferring that information to. And there's nowhere in this particular document that is as specific as the HIPAA requirements that were on that form were met. So I'm wondering if another amendment would be coming for this bill that would let us know how this differs from what our HIPAA requirements are.
Yeah, that's a great question. This is not as granular as the HIPAA requirements. This is more of just a catch-all, opt-in or out. So there's three versions of this. I give my consent, share my data with who you will. The second is I give my consent, but it should not be searchable. And the third is I do not give my consent for my data to be shared. And it's specifically talking about this new database, this closed loop referral system that the data will be centrally housed by Health and Human Services. And I don't know the extent that it's going to be shared with other agencies, but the central store of the data will be with Health and Human Services. And they will be, in my understanding, controlling access to that data by other organizations.
Thank you, Representative.
Representative Merchant.
Thank you, Mr. Chairman, and also thank you, Representative Palmer, for taking my question. More of a practical side, when I see things that are in statute, language dealing with a form specifically, what history's shown me is that once something gets into statute, it's very difficult to change it. And over time, things do change, and it's very difficult to keep up with the change because it's in statute. Any reason to why it's in statute versus requiring the agency to have rulemaking authority to create rules around the particular consent forms as an option versus putting in the statute?
That's an excellent question. One of the reasons why the language for those forms was kept very simple and targeted to the point. Dealing with privacy and efficiency, those two things being at odds, it's sometimes in the interest of a bureaucracy to put privacy secondary to efficiency because it's less work, it's less things to do, right? And so that's why it's important to have this in statute, because it gives the legislature control over that balance between privacy and efficiency. And you'll see that there's language that says those words, that the agency can't try to talk a person in or out of any of those options. So that it should be up to the individual to make the decision and not be coached one way or the other when they make that decision.
Mr. Chairman, follow up if I may. Thank you, Mr. Chairman. Also, thank you, Representative again. The legislative branch does have sort of an oversight legislatively on agencies with rulemaking authority. So therefore, that agency has some control over how the rules are written. I just concern myself with something in the statute. I hear you concerned about the government overreach, but there is checks and balances, I think, built into the process through GELCAR to allow for an agency to write the rules and also for the legislative branch to review those rules that are written. It's just more of a comment than a question, but would you be opposed, again, back to the issue of knowing the fact that GELCAR is there to protect the legislative body and the public at large?
If GELCAR would have the option to approve the specific language of the form, then I would not be opposed to that. But if it's something that disappears into the fog and never gets seen again and can change without oversight, then I would be opposed to that. So
thank you.
This is Chairman Mark Pearson. I chair the New Hampshire Commission on Deafness and Hearing Loss, and it seems that at every meeting, people are asking, we don't know how many deaf, blind, hard of hearing people there are in the state. How do we collect that information? On the other hand, I'm aware of an individual who is a constituent of someone else who is totally blind, has a dog, has a white cane with a red tip, and really doesn't want anybody to know he's blind. How does your amended bill strike that appropriate balance so my commission can start to get the data it needs to make its decisions while protecting individual rights for privacy?
Well, if the person, and I'd imagine the form would be presented in Braille for the blind, the person would have the chance to opt out of having their data shared. Is it in a central location, in one location, just not shareable with other providers in the network? I'd have to ask DHS about that. But the question that you're asking, again, I think deals with aggregated data, which if you aggregate it, if there's only one blind person in a town and you aggregate it to that town, then you're pretty much identifying that one person. You're not protecting their privacy.
Most people in that town know he's blind.
But they're not government agents, most likely, right?
Say that. Okay.
But if you aggregate it to a county or some higher level, then it protects the individual's privacy. And so I think if you wanted to know how many blind people were in the state, you can do that while protecting privacy.
Would your bill help or hinder that, or is it neutral to that?
I believe it's neutral. And again, if your constituent who is blind doesn't want to tell anyone that he's blind, and doesn't want people to invade their privacy, what job is it of the government to invade that person's privacy, right? Like in a free society, you don't get perfect order. You get people complying voluntarily, and you do the best that you can with the data that you're able to collect.
Thank you for your answer. Before you go, you had mentioned the word amendment. Since I decide when bills get exec or not, are you open to us waiting on this so that an amendment might be offered?
Yeah, I'm not opposed, and I'm sorry if I overstepped. I meant draft amendment.
No, you didn't. No, not
Okay.
to me, you didn't.
I'm not opposed. I guess if we wait too long, then the horse will be out of the barn, right? So I think we need to address the privacy issue up front before the system gets going, because if you wait until the data is flowing and you don't know exactly who it's being shared with, then it's kind of hard to put that back in the bottle. So I think we have some time, but not.
I wasn't planning on waiting very long. We have to get everything out the door by the middle of March anyway.
Okay, no opposition then. Thank you.
Thank you. Representative Knurk.
Yes. Yeah. Just a very quick question. You commented, and my apologies if I missed the name earlier. You've commented about this database. What is the name of this database that we're discussing that you're concerned about?
The name that I have, that I was made aware of, is the closed loop referral system. Now, I don't know if that's the specific project name for the database. There might be some other name that they're using internally, but that's what I'm referring to it as.
Follow up?
Follow up.
Just a real quick thing. I got an email and it was a little bit unclear. There was some kind of company called Aunt Bertha that sounded like they were weighing in on this. Have they been involved in this effort of yours or not?
No, I do not know that company. You might want to ask them. Thank you.
Thank you. And seeing no additional members of the committee, except for Representative Gay.
Thank you. Thank you, Mr. Chairman. And thank you, Representative Ammon. I have actually two questions. One, I'm trying to identify what data we can keep totally separate and what data can go on the database. So that's my first question. Can the social worker or whoever else is providing a service send a person's records to another provider? I'm assuming that they can send it as a packet rather than, oh, here's the database, just look them up. So that's question one. And then question two would be, there's some way to put a column of shareable data that, like for aggregated counts, like blind, this person is blind, so that it's not tied at all to the person. Maybe it's going to be tied, except if somebody's not honest. But those are my two questions. Can you do have to share the data about people because they're usually not taken care of by one service. It sounds like it's linked to others. So is it possible to do that without just putting them in the database and making the database accessible to the other service provider?
Yeah, the first part of that, or your first question is interesting because if you have a central repository, meaning that there's one database, maybe there's a web portal or some way to access it, that's one point of failure as far as the data being hacked even. So the security of the data. If you're sending the data, copies of the data, to different organizations and now they're housing the data, you see what I mean? That now there's copies of the data all over with different providers. Now your attack surface for that data to be exposed to the internet or the dark web grows, because now you don't have a control over the security of that data. It could be in emails or documents on hard drives that might be accessed So that's another concern. That's the way I hear your first question. Is that what you're asking?
Oh,
Follow up.
it says, one of the options is, you may share my personal information with any other public or private health or social service agency in this or any other state. You just can't include it on a searchable database. So that means somehow we have to make it possible to share the records with another provider. So is it possible just to give people permission to certain data? I mean, they have to get it. It says, you may share my personal information. So how do you protect that when you share it with another provider without making the database open,
To everyone?
accessible?
You know, I don't have a great answer to that because I don't know the specific implementation in mind. You know what I mean? It depends on how the system is structured. This is more coming from like the consumer viewpoint, you know, how they interact with the system, and that's why it focuses on those consent forms. So I couldn't answer, but you might want to ask someone from IT and they could have a better answer.
With no further questions from the committee, the chair recognizes Dr. Jonathan Ballard from DHHS.
Good morning, Mr. Chair and committee members. My name is Dr. Jonathan Ballard. I am a practicing family physician and the Chief Medical Officer for the Department of Health and Human Services. If it's permissible to you, I would like to speak in tandem with a couple of our experts who may be able to answer some of these questions. Mr. David Wieters, our Director of Information Services, and Jenny O'Higgins, our Senior Policy Analyst with the Division of Behavioral Health. Speaking first, thank you, Mr. Chair. First of all,
Dr. Ballard, I need the second name again so I can find it.
Jenny O'Higgins.
Okay, thank you.
First of all,
I believe I've promoted both of them.
Thank you. When we were reviewing this piece of legislation, it was unclear to us exactly what it was aimed at initially. It's very broadly written, and it applies to every health and social service agency, private, for-profit, or nonprofit. And it refers to the sharing of information between providers. That could include any hospital, social service agency, pharmacy, insurance company, and as written, and as including the proposed amendment, would apply to the entire healthcare system and is not directed at the Department of Health and Human Services. We already have a fragmented, disorganized healthcare system, and efforts are obviously trying to be done to decrease the burden on citizens to have their healthcare needs met. This bill will further fragment the system, and therefore DHHS is opposed to this bill. We believe it would increase costs to the state, decrease the coordination of care among healthcare providers and social service agencies, and it conflicts with other laws and mandates both state and nationally. It impairs our ability to respond to emergencies, and there are a number of provisions about this bill that would cause significant harm to our most vulnerable citizens. We'll defer to David Wieters, the Director of Information Services, regarding this reference to the closed loop referral platform, not a searchable database. And you also recognize that the committee has heard testimony that the sponsor of this legislation does not know how the specifics of what this proposed platform is being interpreted at or implemented as. Therefore, we have not been involved with this discussion about how this bill or the intent behind this bill came about. A few very specific situations that I read when I first read this bill that made me very worried, mainly as a medical provider. I am a doctor for children and adults, and when I see children, if, for example, I had a child that I was seeing with a broken arm, and I was suspecting of child abuse. If this bill were implemented, my interpretation of it would be that I could not report this child's potential neglect or abuse to a social service agency without the potential abuser's consent. I felt very concerned about this bill as written. Also, I was concerned about the ADA compatibility of this bill, requiring written signatures and no other options available. Also, in the era of COVID-19, a hard written consent, as well as more paperwork, was written paper and touching of surfaces in close proximity made me more concerned as well. I was also concerned about fraud, the abuse of this law. How would these signatures be verified, and how would they be interpreted when there's an open investigation of neglect and abuse that's happening? If you require a written signature, it seems like it would be an impediment to provide services and coordinating of care between providers. The no exceptions rule. There's no exceptions at all written into this legislation for emergencies or harm to a person if the information is not shared. It conflicts with our state laws for mandatory reporting of infectious diseases. It also conflicts with other mandatory requirements for using digital signatures in this era. I think with that, I would like to defer it to Mr. David Wieters, our Director of Information Services, to potentially respond to some of the questions posed.
Thank you, Mr. Chair and members of the committee and Dr. Ballard. Just to add on to his comments as a overarching nature, the other components of this is the increased cost to not just the one system that were referred to in the conversation today, but since this is a broad legislation, it would impact all of our systems of sharing of information for both in emergency as well as continued sharing with our federal partners as well. So those systems costs would need to be contemplated and are not funded in this bill at this point. Those costs could, if left at a broad state, could be more than $1 million in general funds to the various systems that we would need to accommodate the 3 different options of opt-in, opt-out functionality. As it relates to the closed loop referral system that we are moving forward to increase the care coordination across our state, it is definitely our intent to have a very solid data governance strategy, which is a strategy in IT speak to really maintain the privacy of the data and the security of the information. So we have partnered with our vendor to have an informed consent at the time of service. So if someone shows up at the emergency department or at a food pantry and is seeking services there, but then also needs additional services somewhere else, they would be able to leverage this system to do a consent process to share on the platform, as well as follow any required processes that they have for sharing that data. To be specific, the platform has an acknowledgement document or a consent document that all clients will sign to support the sharing of information on the platform. It does describe how their data would be shared across the platform, and it would be shared within the network for services specifically that they're being referred to. It does not take the place of any provider-specific consents, authorizations, or privacy notices that must be used by providers based on their specific privacy practices. In the case of community mental health centers, they have very strict processes as it relates to 42 CFR Part 2 substance use data, that they would still need to have their consent documents also to share that information for referrals to other services. So we definitely see this as a primary part of that closed loop referral system, and it was already being established as rules and policy for moving forward. This platform will allow for clients to seek services across locations or services, and it basically does address the ability to share data in a consolidated manner. And to address one of the comments from Representative Ammon was that
if we were using a paper process, which we are currently today, and sharing either via phone, email, or fax, that data is shared in multiple locations. It is not always consistent, and it certainly isn't in a timely manner. Our goal is to use this platform to maintain consistency with the data, as well as make sure that the data is accurate and is in a secure location in compliance with federal and state laws. And I will defer over to Jenny O'Higgins for any specific examples that she wanted to bring up as well.
So hi there. Thank you, Mr. Chair and members of the committee. I'm Jenny O'Higgins. I'm the legislative liaison and senior policy analyst for behavioral health at DHHS. And my work is often focused in the substance use disorder system in New Hampshire. So I just wanted to briefly look at two specific examples of how this impacts a vulnerable person in the community. So both our doorway system and our maternal opioid misuse model would be examples of programs that could utilize better care coordination and the ability to sort of close that loop. So when I see a client, being able to understand that they made it to the place that I referred them for the services that were needed, and better monitoring outcomes are just those two programs. As you know, there are 9 doorways across the state that act as access points, offering a connection to substance use treatment and recovery services. And people who access doorway services often have very complex needs. The doorway may serve as an access point for substance use disorder treatment, but to get there, people need to be connected to housing and food security and job opportunities, mental health services, and other social supports. And we know this to be true from our ongoing doorway work. So in addition to the doorway program, New Hampshire has been awarded a federal Medicaid funding under the maternal opioid misuse model. And that model is really addressing fragmentation in care for pregnant and postpartum Medicaid beneficiaries who are experiencing opioid use disorder. And the mom goals are to improve the quality of care and reduce the cost of providing care to mothers and infants. It pays special attention to enhanced coordination of existing reproductive health, maternity, opioid use disorder, and mental health care services. So this bill would make the coordination of care for these moms and babies more challenging, including our response to and treatment of neonatal abstinence syndrome. The doorway program and the mom model were both an outgrowth of identified gaps in our systems, and we really can't afford to move backwards or slow down our approach to addressing substance misuse in New Hampshire. So the good news is that people often go on to get well. The reality is that people often have many barriers to achieving their recovery goals, and people find recovery through many pathways, but it's not often that they go on to get well on the street. They need housing, and it's not often that they go on to get well while experiencing food insecurity. And so sharing this information across providers really allows for a comprehensive and a collaborative approach to a really complex issue. And when we treat people in silos, we continuously are left wondering why we don't see positive outcomes. So in New Hampshire, we see that a majority of Medicaid's highest need and highest cost beneficiaries really have multiple physical conditions, co-occurring mental illness, and/or substance use disorder. And most of these individuals are in fragmented systems of care with little to no coordination across providers. And what we're trying to do is really to decrease the poor quality and high costs and better coordinate their care for the population that has the potential to really improve their health outcomes and to control spending. So I hope that was helpful, and I think all 3 of us are here to answer any questions that we can.
The chair recognizes Representative Marsh with a question.
Thank you, Mr. Chairman, and thank you for taking my question. I'm not sure which of the members from the department this is best voiced to, and you can choose for yourselves who's best. It's my understanding that there are various procedures in place to prevent people from fraudulently accessing services or accessing duplicate services. Would this bill affect those systems that you currently have in place to reduce fraud and abuse?
This is Jonathan Ballard. David, do you have information about the systems in place for protections with verifying fraud and waste, abuse and waste?
Certainly. This is David Wieters, Information Services Director. We do have several systems in place for third-party liability and fraud fraud, waste, and abuse. This bill, as it is right now, I don't know if it would impact it directly. However, having the ability to share and have a platform in which to see the services that are being provided potentially would address that, but there was never the intent of this platform to be involved in the fraud, waste, and abuse component. So that was not the goal. The goal was to provide services and care coordination for our clients. So I don't believe that this bill would impact that. We would have to do further research on that, Representative Marsh, and members of the committee.
Thank you.
Representative Weber.
Thank you, Mr. Chairman, and thank you all of the people who may be answering my question. My question is, outside of the platform that's being created now, I know that I have many constituents who interact, for example, with the one-stop application for various welfare, housing, food benefits provided by the state across several programs. And I'm wondering if you know how this bill is going to implicate the functioning of that system and all the other systems. I know that Ms. O'Higgins talked about the Doorways program, but I'm concerned about other platforms that are designed to take away silos for people whose access to service is very much limited by their ability to access a computer or access a telephone or whatever.
Thank you, Representative Weber. This is Jonathan Ballard. The system you're referring to is called New Hampshire Easy. It's simply a website that connects individuals with the different services that they are eligible for. The system, though, does integrate multiple state agencies, and so therefore it depends on how this bill is interpreted. Is DHHS the lone state agency, or is divisions the agency? David Wieters has a lot of information knowledge around the behind the scenes mechanics of that website. David, can you elaborate?
Sure. So that New Hampshire Easy system, or the one-stop application for housing, food benefits, and Medicaid eligibility, shares information specifically internally, so that we can see the eligibility. But then once it gets internally, it's shared externally with our housing providers and food pantry services. So it certainly would indicate that we would need to, that is one of the many systems that we would need to modify as this bill is written, to inform the people that are applying for those services and benefits of their choices. And so they would require us to update that system and how it communicates on the back end and then out to those provider services. That is one of the larger systems that we would have modifications to.
Thank you. That's very helpful.
Are there any other questions from the committee?
Yes. Yes.
Yes, Representative Cushman.
Thank you. Thank you, Mr. Chairman. So this is for either one of the information system, either the liaison or the information system experts. Does the person seeking services currently know what information is being shared about them to other organizations within the database?
So in the case of all of our systems, when it comes to like the New Hampshire Easy that we were just referring to, and that system certainly shows the data that you're sharing upon an application and what that information will be shared in order to provide food, housing, and Medicaid services. In the case of the closed loop referral system, again, there is it's a either digital signature, they could do it by phone, or they can do it in person without, if they can't sign themselves, they would be able to see a copy of the document of what they're consenting to share, and they would know the information that they were sharing on the platform itself. and where that information would be shared with in terms of referrals.
Follow up.
So each time that their information is accessed from a different organization, do they get alerted that their information is being accessed and reviewed?
Thank you, Mr. Chair and Representative Cushman. They would not be alerted each time that they would be sharing information. Each time a provider accesses their information, they would be alerted when they were initiating a referral. So in the case of a person stopping in for housing supports, getting a referral for food services, they would be alerted at that time that they would have a referral for food services. If there was an additional referral for SUD services, they would be notified by their case manager that they were getting a referral for those services as well. So from that perspective, they would be notified upon referral, not upon access.
Thank you.
Welcome. Representative Gay.
Thank you, Mr. Chair. And this is an IT question, but I guess all three of you would have an answer. How is someone authorized to access a person or family's records? I think if my records were in there, I would certainly know that the people who are going to help me need to see them. But my personal concern is that if the database is just open and anybody can access anything, that's a violation of privacy. Can you use keys so that the people who are authorized can access those people?
Thank you, Mr. Chair, and members of the committee. That's a good question. I would say right now, it's very similar to the way you would sign a consent when you go to the hospital to share your information with your family member on behalf of yourself. Once you sign that consent, that person could request that information at any time. It's the same with this, where we would have that consent at the initial to say, we're sharing your information with these providers for these services, and they would be able to request that information to be able to provide those services at any time. When it comes to open access to a client's information that was not referred for services, I will need to reach back out to make sure that this is addressed. However, I believe that it is not open unless you have an open referral for services.
One follow-up.
Okay, so if I understood you properly, there is or will be authorized access required, so that anybody's records cannot be accessed just by anybody who can reach the database. It has to be you have, and maybe it's multiple organizations, but they have to be authorized to access that person or family's records. That's a question.
Thank you for the question. I believe you are correct. I will need to research and validate that 100%. However, in the cases of, like, for many of us, I would have access to the system, but I would not have access to individual records. I would only be able to look at the data in aggregate, as Representative Hammond was referring to earlier to a question of how we would report data. We would be looking at a high level. We would not be able to see the individual record information because I do not need access to that. So we use a policy of minimal use, which is part of HIPAA, to ensure that if you don't need access to the data, you should not have access to the data. And so the care coordination team, so if you're a case manager in housing supports, and you're a case manager in food services, and you're a case manager in behavioral health services or mental health services, and all three of those agencies are providing services to a single client, all three of those agencies would have access to the data. However, if you're not providing access to that individual client and you are another food service or housing service, you would not have access to that individual's data.
Thank you.
Representative Cushman.
Thank you, Mr. Chairman. one final question, could the person seeking services be currently, as the system is without this bill being passed, could they be turned down for services if they don't want their information to be in the database?
Thank you for the question. The answer there is absolutely not. No, they don't. They do not need to participate in the platform in order to receive referrals. However, it would go to the secondary process of making referrals through the system. So the individual caseworker, depending on which social services that they're working with, they would have to take the name and information and still get a consent from that individual to then share the data either by fax or phone or email with the other agencies to provide those services. So the only difference is that it would not be on the platform and it would not be digitally transmitted. So it'd be dependent upon the manual processes that are currently in place today that we're trying to resolve the time to delivery of those services with this solution, this platform.
Representative Kelsey, you had your hand up.
I did. Thank you, Mr. Chairman. Representative Cushman actually asked the question that I was going to ask, so thank you.
Thank you. This is Chairman Pearson, would it make it more difficult to help people who seek our help if there was much less data in the system?
Mr. Chairman, this is Jonathan Ballard, Chief Medical Officer of DHHS. I believe absolutely this bill, if passed even as amended, would make it difficult for persons to receive help. Obviously, this bill is not targeted towards the specific services that Mr. Wieters is referring to for closed loop referral services for individuals that need assistance from DHHS. It's much broader. It would affect everyone, and it would cause additional barriers to receiving help. If a person were doing a telemedicine visit and needed services, this bill obviously makes no provision for that type of referral to happen without an in-person signature. There are many different facets to this bill would cause that would stop persons from receiving the help that they need throughout the healthcare system.
Thank you very much, the three people from DHHS. We do not have very many people who wish to speak, so I want to press on. We will be taking a half-an-hour break when we finish this, but I do not wish to continue it only for about a 20-minute continuance at another date. The chair recognizes former Senator Robert Clegg, who identifies himself as a lobbyist and is opposed to the bill.
Thank you, Mr. Chairman, members of the committee. I'm here to represent Carolyn Virtue, who is from Granite Case Management. She's a member of the Medical Care Advisory Committee, and they were meeting this morning, so she couldn't be here herself. She does want you to know that the DHH contract that this is trying to amend and fix was put in place to add a closed loop referral platform in New Hampshire using CARE monies or CARE Act money, and was passed without approval of the counselors. The contract was a sole source to a vendor which is not HIPAA compliant, and there are many closed loop referral platforms available. Many are HIPAA compliant, and that we need to understand that some of New Hampshire's MCOs and larger hospitals utilize their own HIPAA compliant data sharing platforms already. The move to create and endorse a system of non-medical providers to share New Hampshire citizens' health information requires further study, in her opinion, by the legislature. New Hampshire currently does not define social service agency in law or rule, and she asks that you carefully consider creating and defining social services agency without further delay. The sponsors are likely referring to the information and referral systems ServiceLink and 211. These systems are not healthcare providers or social service agencies. They do not employ the trained staff, which would rise to using the definition provided in the bill as filed or the amendment. At the very least, if those systems are to be transformed into actual healthcare delivery systems, careful consideration should be given to the establishment of the same. The bill turns them into something they are not without guidance for the transformation. Closed-loop referral systems begin with the management of physician practices and patient referrals to coordinate medical care. This is outside the capacity of the current service link system. Carolyn would urge the committee to leave healthcare delivery to qualified professionals and care providers, which are governed by state and federal guidance, including the Federal Health Insurance Portability and Accountability Act, HIPAA, privacy rule. Creating social service agency and statute allows for quasi-provision of healthcare outside of existing state and federal government. The bill seeks to codify an idea which adds yet another layer of bureaucracy to New Hampshire's healthcare infrastructure without removing layers of similar services, which may result in further duplication of systems. While Carolyn agrees there may be some merit to a closed-loop referral system, New Hampshire is ill-prepared to move into a state-run system at this time. We do not possess the necessary framework to implement it. The whole program should be suspended until the legislature has legislated their will and the will of those they represent on the initiative itself. Creating a form for a program the legislature has not endorsed for implementation, in effect, creates the program. More than a form is needed to effectively legislate and create this system, a system with proper privacy protections in place for those individuals served. Data storage, information sharing, and referral management solutions are powerful tools. Streamlining process through in-the-cloud referral routing, tracking for healthcare delivery system with multiple care locations, hospitals, clinics, specialists, practices, site care, can produce efficiency. However, we must keep in the adverse, a system if not properly managed or maintained, it may duplicate other practices and be subjected to breaches. The legislature should consider the value of information once collected. How will it be or not be shared? How long will information be stored? And how can an individual revoke permission for sharing? Can the information be sold? How costly will the system be once the current money is not available to fund it? She wishes to point out that right now the care money would provide the money to make this happen. But what happens when there is no care money? She thanks you for your consideration, and I can answer any questions that I can, but she will be available and more than happy to speak to anyone who would like to understand. And I hope that most of you know, Carolyn's been 40 years helping the elderly who stay at home rather than in nursing homes. So she's well aware and well versed in how dangerous this system could be to them.
Thank you, Senator Clegg. Is there any question for the senator? Representative Gay.
Thank you, Mr. Chair, and thank you, Senator Clegg. I guess I really have a question because I'm really lost. This bill was, as I understand it, the attempt was to give people an option to restrict how far their personal information would be disseminated by using a common database. From what you're saying, it sounds like you're addressing the whole issue of whether we should have a closed system, which I assume is a database. Is that right? That you're talking about we should not, right now, without knowing more, we shouldn't be adopting a closed system. Whereas I'm coming in here not knowing, not thinking I'm agreeing to it, I'm trying to restrict access to it, trying to restrict how the data gets out. Am I lost here?
Thank you, Representative Gate. No, you're not lost. Representative Ammon saw a system that suddenly showed up that had no privacy protection. And he did the right thing in the sense that he went out and said, let me see if I can protect the privacy. We're hitting it from the fact that we've adopted something, or we have something in the state of New Hampshire that nobody knew about. Somebody walked in and said, hey, I think this is a good idea. And under the current system, the governor said, yeah, okay, let's do it. It hasn't come before any legislative body yet to see whether or not it's good. And as I understood it from the previous speakers from the Department of Health and Human Services, it obviously didn't have their input before it was started, because typically some of the things that they were talking about would have been corrected before it ever hit your desks. So we're hitting it from the fact that, while I think what Representative Ammon did is laudable, I think he did a great job. He's trying to fix something that is so broken, I'm not sure it should even be here.
Any other questions for Senator Clegg? Seeing none, thank you for your testimony.
Thank you.
And I did not get this notice until just now, but sorry about that. Representative Jess Edwards was in the queue. So Senator, golly, am I promoting you? Representative Edwards, you're free to testify before us.
Thank you. This is Representative Jess Edwards representing Rockingham District 4. Last term, I was a member of the Mental Health and Social Service Business Process Alignment and Information System Interoperability Study Committee, which shows that legislatures can run on too long naming committees. But I think we did some really good work there under the leadership of Senator Khan. We recognized that that there's this tremendous opportunity to manage community care through the state. And we saw that psychiatrists were precluded by federal law, or excuse me, state law, in a way that was too restrictive relative to federal law, so that psychiatrists couldn't really participate as full members of this care coordination community. So we submitted a bill to change that. I think that bill passed. I lost track of it. But so I'm coming at this letting you know I respect the need and the value of coordinated care. But one of the things I think we've picked up on the several of these kind of bills over the last couple of years is that we don't have enough respect for the privacy rights of our individual citizens. And we end up getting these entities together that say it would be easier, it would be better if we could just take this information and use it to help our patients. And they do that from a goodness of their heart and a dedication to their mission. But the patients, the individual patients who own their own data are not usually at the table. So I come at this generally in support of 601. I don't like the fact that the form got put in there. I think Representative Merchant talked to that. I think it's a mistake to put forms into legislation. That's a good jail car activity. But even more to Representative Shapiro's earlier point, the intent, I think, of 601 is to be consistent with HIPAA. I don't think we should be making redundant documentation for healthcare providers. To the extent that opt-in would be required, I think it should just become integrated in all the HIPAA forms. And the way to do that is not to put it in this legislation, but to write the legislation in a way in which the legislature reaffirms its commitment to our newest constitutional amendment to protect privacy, and to make sure that the entities that work for us, while they're trying to do great work for our citizens, that they also do it fully respectful of the fact that citizens own their data, and it isn't the property of the state until the citizen actively agrees to give them their data. So that's really the end of my testimony. Thank you for allowing me to speak, Mr. Chair.
Would you take any questions, Representative?
Only if I can be a senator.
Would you take any questions, Representative, in anticipation of your future demotion to the Senate?
Yes, I would.
No hands are up, sorry. You're on your own.
Yes, my hand is up.
Oh, Betty, Representative Gay is wishing to ask the future senator a question.
Thank you, Mr. Chair, for not hitting me. And thank you, Representative Edwards. I'm in full agreement with you. So what is your recommendation about 601 since we're offered what we're offered? Is this going to help if we took the form out? Because that will, hopefully the wording either is or can be made more in line to support HIPAA for all these social needs. What do you recommend?
What do I recommend? I would never step on the chairman's toes, and I don't know how busy you are. I don't think the bill is well-intentioned, and as much as I support it, I don't think the way it's written, it's ready to pass in its current state. So what does that mean to the committee? Does this mean you want to retain it? Do you want to work on it? Do you want to it feels to me after 2 or 3 terms of hearing about privacy issues, it may be a good time for us to take a study committee that just solely and only looks at the extent to which our healthcare system is working in collaborative ways to protect the right of privacy of patients and the right to consent and the right to share that consent amongst a community of providers. If this became a study committee that only looked at systemically, what are we doing overall to protect patient privacy? That may not be the worst idea I've had this week.
Thank you, Representative, for observing where my feet are. They're about 30 miles away from you, but thank you. What you just said sounds like a wonderful thing that you could work on over the summer and file as legislation in the fall. And I've already said to Representative Ammon that we're really jammed up here in study committees to make a bill better. We're not going to use a lot of them. However, I also told him that while we're having a big exec session next week, I would be happy to wait an extra week should an amendment be suggested to him. So with that, let's see. No hands are up. Thank you, Representative Edwards. And now the chair calls on my predecessor as the custodian of bad jokes and awful puns in the House. And by that, I mean, of course, retired Representative Neil Kirk.
Mr. Chairman, can you hear me?
Yes, Mr. Kirk.
Good morning to you, sir, and to members of the committee. For the record, I'm Neil Kirk. I live in Ware, and I support this bill. However, after hearing the testimony from former Senator Clegg and the testimony from the folks at Health and Human Services, I think this bill is not ready for prime time. However, simply ITLing it or turning it into a study committee is not going to solve the problem that we're currently faced with. Therefore, this is my conclusion, I'll support it later. Therefore, I think we need to have a moratorium on this particular closed loop system, which was funded by the CARES Act through the Executive Council and is with a company or an organization called Unite Space Us. That's the organization that the department is contracted with to provide this system. If there's a moratorium on that, we will have time to do the right thing with respect to privacy. And that is focus, not as broadly as apparently this bill does, but focus on that particular system. Here's the situation we're currently faced with. We've just passed a constitutional amendment on privacy. And this is the first time that I'm aware of that a new database is being created. The PDMP and the vaccine databases were created years ago before the privacy amendment. This is the first one that's being created afterwards. And as Senator Clegg mentioned, there is no legislative authorization for this. It simply went through the COVID process. So the legislature, I think, needs to take back ownership of this, put in a moratorium to give it an opportunity to determine what kinds of privacy protections should go with this new system consistent with the constitutional privacy amendment. Now, there are two kinds of people seeking services in this system: people for whom the state is paying, like on Medicaid, and the entire self-pay, self-insured private pay group. They're all included under this bill, under this system. And the state seems to be expanding its interest in collecting information, not just on the Medicaid people and other people for which it pays, but on everybody else in the state who are paying their own way or are having private insurance pay their way. That's an extraordinary expansion of activity on the part of the department without legislative oversight. The key thing about that this bill is trying to address, and it was, I think, intended only for the Unite Us system, not for 911, not for any of the other systems that the state may have, was to make sure that the consent was real, that it was in very clear language what you were consenting to and what the consequences were. And it was also very clear, this is the second thing, that informed consent not only means that you give your consent, but that if you don't give your consent, you are not subjected to penalty. That is a denial of services or some other penalty. Without both of those two things, you don't have, I think you would have in this case, a clear violation of the Constitution. The reason for putting, a number of you have raised this question, the reason for putting the specific nature of the consent form into statute was that when the legislature has not done this, as in the case of the vaccine registry and the case of PDMP, the kinds of consent forms that the department comes up with and that are indeed approved by GELCAR don't really reflect legislative intent and don't meet the two criteria that I've just indicated. Fully informed consent and acknowledgement to the individual that if you don't give us consent, you can still get the service. If you don't have that, what do you have? Indeed, I checked in North Carolina where Unite Us is already in play and they have consent forms out there. And I believe you should have received by email a copy of their North Carolina consent form. It's very clear, or it's not very clear what you're consenting to. And it's also very unclear what happens if you don't give your consent. That to me is exactly what we don't want to happen in New Hampshire. There is a reference in that consent form to the privacy policy, but that's 4 pages of dense legalese. And of course, we all know that no one reads that. So in summation, the bill as presented to you, including the amendment, does not deal with all of the issues that have been raised by people who oppose to it. And even though I support the concept as Representative Edwards does, the bill is not, I think, ready for prime time. If you do not put in a moratorium, if you simply retain it, the system will go ahead, the department will go through the rulemaking process and so forth, and the legislature will have no input into this system. And when in fact the retained bill is brought forward next year, the system will be in play, and as Representative Ammon said, the horse will be out of the barn. So my request to you is that you, or that Representative Ammon, rewrite this in a way that there is a moratorium and that the committee will act on this, or other legislation will be placed into the hopper for next year. Thank you, Mr. Chairman. I'd be pleased to answer any questions.
I have one, Representative Kirk. It sounds like is it true from what you were saying that you would be willing to help Representative Ammon do this?
Yes, that is true.
Any other questions? Representative Gay.
Thank you, Mr. Chair, and thank you, Your Honorable Kirk, very much for calling. How do we place a moratorium on a project that we didn't initiate? I mean, it's fine with me. I'm ready to do it, but how do we do it?
Thank you for the question, Representative Gay. You simply ask Legislative Services to draft it, and they will.
It's a bill. It's just a bill. But it's a bill.
Any other questions of former Representative Kirk? Seeing none, thank you, and good to hear your voice again.
Thank you, Mr. Chairman.
The chair recognizes Lucy Hodder to speak.
If Ms. Hodder would put up her hand, I'm not seeing her in the list. Our list is alphabetized by first name, which is not always helpful, but that's okay. But I don't see her in the list, Mr. Chairman.
Thank you. Should she pop up, we can come back to her. I also see Erine, E-R-I-N-E, with apologies if I mispronounced it, last name Gray, Erine Gray.
And I just had Erin Gray. And she's
the third one on the list.
Hi, good morning.
Okay, yep, it just came up to the top. I had her without her hand up. And she is now permitted, which makes me think that maybe Christina is back. But anyway, go ahead.
Good morning, Mr. Chairman and members of the committee. My name is Aaron Gray, and my company, Aunt Bertha, runs findhelp.org, the largest referral network for social services in the United States. We are a public benefit corporation based in Austin, Texas, and we have earned the trust of more than 300 customers, including the states of Florida, South Carolina, Pennsylvania, and more than 200 healthcare organizations, including many that do business in New Hampshire. When we learned that the state of New Hampshire was interested in implementing a statewide referral network, we were obviously delighted. We met with the state, but they decided to move in a different direction because our solution did not meet their specifications. I'm not here today to complain about that decision or ask you to somehow reverse that. We have our relationships in the state and we plan to be here for the long term. The reason why I'm here is to support HB 601, which in no way, based on my experience, dramatically changes the direction the state is heading, but will ensure the protection of individual privacy. There's a stigma that comes with needing social services, and it's important that we all recognize that that stigma exists. For example, on our network, we see search activity in New Hampshire for food and housing, but we also see a rising need for addiction services, mental health counseling, even domestic abuse support. We certainly believe the ability to quickly refer people to help is critical during an economic crisis. With a growing need for electronic access to social services comes a corresponding need to make sure people's information is protected. On our networks, we do not share personal information unless the person in need knows who has access to it. And right now, that's not the way New Hampshire is heading. In fact, the state identified it was looking for a company that embraced an all-in consent approach that would, quote, reduce the number of informed consents needed to connect clients with services. The approach outlined in the contract would then create a master client index in which members of the network could indeed search and retrieve people's personal information. Now, some would say that's perfectly okay since the person in need is agreeing to an informed consent. The trouble with the all-in consent described is that not only is it truly informed, since the network of individuals and organizations that could have access is not defined. The term network is vague. The person has no idea who can see their information now or in the future. Who makes up the network? The network as currently defined can be anybody who has been trained and works or volunteers at any nonprofit, healthcare institution, or government agency in the entire state of New Hampshire. So this imposes important ethical considerations. Would people that receive this help in this manner worry that someone in their church might find out that they were survivors of incest or domestic abuse? What if the person needing help worked at the state and they were going through some tough financial times? Would they worry that their coworkers might know that they can't feed their family? Public health agencies are spending a lot of time and attention addressing the social determinants of health because studies show that if people's basic needs are met, they tend to be healthier. Some may say that all-in consent is needed to perform care coordination of our neediest among us. Our organization has set up these types of networks with over 300 customers and millions of people, and in no way has care coordination been hindered by a truly informed consent model. As it currently stands, the consent process does not appropriately consider these ethical dilemmas about information sharing. That's why we would support a better approach like the one outlined in HB 601 that should create the right balance between the state's interests, which are very important interests outlined by the department, and that of your citizens. Thank you.
Thank you for your testimony.
Can we ask her the name of her company?
Would you repeat the name of the group that you are representing or speaking on behalf of?
Yes, I'm the founder of Aunt Bertha, which is runs the organization findhelp.org.
You're garbled a bit. Would you spell the name?
A-U-N-T, Bertha, as in the name, B-E-R-T-H-A.
Oh, I was going to ask you to say hi to your Aunt Bertha for me. It's in your email address.
It's inspired by my mother, who was disabled at a young age, but she was very much the person in the neighborhood helping others. So thanks for asking.
Wonderful. Thank you. And for the record, we welcome.
Oh, okay. You're
For the
just, you got,
we welcome Representative Snow to the meeting, and would you tell us where you are and if there's anyone in the room with you?
Thank you, Mr. Chairman. This is Ken Snow. I'm in my apartment in Manchester, and my wife is present elsewhere in the apartment. And I'm sorry I am tardy, but I had a doctor's appointment.
Welcome to the meeting. And we have Christine Stoddard, who's interested in testifying. Would you put your hand up, please, so we can bring you into the meeting?
I am not seeing Christine Stoddard.
And do we have Lucy Hodder?
I have a message from Representative Knirk who says that Lucy Hodder is not able to attend at this time.
I have no one else on my list. Is there anyone else who wishes to testify?
I see no other hands, Mr. Chairman.
Seeing that none, then I bring this hearing to a close.
I beg your pardon. Sorry. I have a Gary Cahoon whose hand has just gone up.
He just got in under the gavel drop. Yes, Mr. Cahoon, please.
Mr. Cahoon, you'll have to unmute yourself, please.
I'm sorry, can you hear me?
Yes, we can now.
Okay. Thank you, Mr. Chairman, members of the committee, for the opportunity to speak very briefly on House Bill 601. Much of what I wanted to say was encompassed in Dr. Ballard's testimony and Mr. Kirk's testimony. But I would simply like to make the point that I understand from Representative Ammon's testimony that the intent of the bill was to require a consent form to have one's name entered into a registry being established by the Department of Health and Human Services. However, the plain language of the bill doesn't say that anywhere. And by the plain language of the bill, it's very broad, as Dr. Ballard pointed out, and very general, and would apply to all healthcare, as I read it, to all healthcare providers under any circumstances. What that would mean to me as the owner and operator of Friendship Manor in New Ipswich, which is a residential care or assisted living home, is that if I had a resident who came in and opted out, in other words, if they said, no, I don't give my permission, by the plain language of the bill, it appears to me that if Mrs. Jones, who came in and opted out, later had a stroke and I had to send her out to the hospital, without her specific permission, which she might not be able to give, I couldn't tell the hospital her name, her address, her phone number, her social security number, her insurance number, or any other demographic information that the hospital would require. So my point is simply that the bill as written doesn't really address what it's trying to achieve and is written much too generally. Thank you very much.
Would you take questions, Mr. Cahoon?
I would be happy to.
Does anyone have a question for Mr. Cahoon?
Yes, please. Leah.
Representative Cushman.
Thank you, Mr. Chairman. Mr. Cahoon, are you aware that there are provisions in the Health Information Portability and Accountability Act for giving information in emergency situations to providers who will be continuing care?
I am. And upon admission, we have residents sign a release of information in an emergency. It's also true under the HIPAA Act, for example, that the fact that a resident is at Friendship Manor is protected information.
Thank you.
Seeing no one else. I bring this hearing to a close, and we have a half an hour break. We will reconvene at 1:25.
Oh, well, this was the fastest lunch I ever made.
I'm getting a message from Ms. Dyer saying if somebody in the committee room could please unmute the committee room. It appears to me that the committee room is still muted.
I think he's waiting for a couple minutes until lunch is officially over.
Okay, no problem. I'm not sure who was in communication with whom here.
Thank you so much.
Because you said
Thank you.
25.
I did.
Good evening, Representative Weber. Can you hear us now?
I can.
Okay. I feel like we're living in that commercial. Can you hear me now?
Yeah, I'm going to encourage that from now on, when they recognize somebody, they say, please unmute. Because we waste 20 seconds every time. We're waiting, nobody says anything.
It's not that easy. It takes me that long for them to be moved over from the list that's waiting to testify to the list of people who are authorized to testify. So most of them do actually unmute quite promptly once they have gotten the ability to do so.
But I mean, it only takes a split second to say, please unmute. For the ones who don't.
Okay, here we go. This is the continuation of the hearing on House Bill 246, establishing a protective order for vulnerable adults, House Bill 246. And we have what I see to be only 6 people signed up to testify on today's list. Christina, do you see more than 6?
They're actually closer to 12, but I do think that some folks from the prior hearing may not have signed up this time, so there may be some hands that come in. I did see some as late as people signing up as late as noon.
At this point, since there are only 12, we will allow each person testifying 2 minutes. And after 2 minutes, the individual will be muted. No one will hear anything else after 2 minutes, and we will go on to the next person. We do this to allow everyone who wishes to speak the opportunity to do so, and so that we may finish our schedule. Because of the COVID virus, we are way behind in the work we need to do. With that, the chair recognizes Representative Norm Silber to speak.
An ardent Republican attorney who moved from Florida.
I'm not seeing Representative Sol.
I do wonder if we do have a phone number with a hand raised. I'm wondering if that might be Representative Silber. I'm going to check the number on the remote testimony list. Don't see that that's the number listed for that. Chairman, would you like me to allow the phone number person to talk and see who it is?
No, let me go through the names and
Okay.
Then ask people, once they hear their name, immediately make sure that your hand is raised. The chair recognizes Doug McNutt, who identifies himself as a lobbyist with AARP.
Thank you, Mr. Chair. Can everyone hear me?
We can.
Okay, great. I won't take up much of your time, but I just wanted, my name is Doug McNutt for the record, and I'm the Associate State Director for Advocacy for AARP New Hampshire, and we represent over 220,000 members statewide in New Hampshire. In a past life, I was the Director of Elderly and Adult Services and was responsible for the Adult Protection Program and have been involved in a series of pieces of legislation related to elder abuse and neglect and exploitation. So I wanted to just comment on a few things, and then I'd be happy to answer any questions. First of all, a lot was raised at the hearing about due process issues. And I guess the one thing I would just like to point out is that a lot of this bill is based on the domestic violence statute, which has been in effect for many years, I think perhaps 20, and has worked fairly well, and the courts are quite used to it. With regard to some of the other pieces related to firearms and pieces like that, it's my impression that people might have been really kind of testifying to previous versions of the bill. It's my sense that the bill has been dramatically altered since those first couple of sessions, and I'm not sure that stuff remains relevant at this point. So I think it's really important we focus on the bill in its current iteration and not be focused on what it was at one time. And lastly, let me just say that in my experience in working with adult protection, and also with the criminal justice system, a lot of the justice happens after the fact, and particularly when you're talking about things like exploitation. Once the crime has been committed, it's fine to prosecute the perpetrator, but if the money's gone, and I think it might be that Representative Weber testified to something like this the last time, that's a problem, because I certainly, when I was working in the Department of Health and Human Services as an attorney, there were many instances where we had people who were victims of exploitation who ended up being on Medicaid and nursing homes, and in fact had trouble.
Thank you. Are there any questions for Mr. McNutt from the committee? Seeing none?
I don't see any. I don't see any.
Thank you. I'm going to have to rely upon you, Representative Weber.
I realized I was just relying on silence.
Representative
Sorry.
Marsh is on another hearing. The chair recognizes Mr. Arnold Newman.
Can you hear me?
Yes, we can, sir.
Okay, well, thank you very much for allowing me to testify. I want to thank you for the opportunity. As a senior citizen, I've witnessed abuse aimed at seniors on 2 occasions. The first involves a senior's granddaughter who was a power of attorney and tasked to help him with his regular daily things, because the man suffered with epilepsy. Instead, she withheld his medication and pension and Social Security benefits to extort cash from him. He fell and hit his head on the corner of a coffee table. When the EMTs arrived, she was present, and he withheld the information about his lack of medication. A short time later, she came to visit and bragged about spiking his drinks. He fell twice. The second time, he opened a large cut on his forehead. One of the neighbors called 911. The EMTs came and notified the police. They searched her apartment and found cash and medications that she was holding back. I don't know how she managed it, but her punishment was a restraining order prohibiting her from coming any closer to him 200 feet from his apartment. He passed away a month later, but with no teeth. Whether they did had no teeth. A few days later, I asked one of the policemen that was involved what happened to her, and he told me that they did all they could do. So, and the second one I'd like to talk about is it's robbery, really. about a lady who drove regularly, a very good driving record, but had a son who decided that her car belongs to his son. And he took the car. She reported the car as stolen to her local police. The officer questioned her health and her age. He also made remarks related to her age and may be forgetful. He intimated that she just didn't know where the car was. Seeing that there's no public transportation, she now depends on neighbors. Senior abuse isn't just referring to physical damage, which does happen, but it includes larceny, forgery, illegal use of credit cards. The laws regarding that action should be taken by victims. The law regarding what action should be taken by victims and law enforcement must.
Okay, you've hit your 2 minutes. Thank you for your testimony and those stories. The chair now recognizes Michael Thornton to speak for no more than 2 minutes, please.
If Michael Thornton is on the call, could he raise his hand, please? I got it. Okay, there we go. And you need to unmute, please.
Michael Thornton, 561 North River Road, Milford, New Hampshire. Chair, state representatives, fellow citizens. Speaking today as a private citizen and on this occasion as a representative of the New Hampshire Firearms Coalition. I am and we are opposed to HB 246 and ask you to find it ITL. Earlier legislation deprived accused of many of their rights, including immediate seizure of property, and it presumed guilt. Unfortunately, then they would have 30 to 40 days or more and could be found guilty without jury and only on preponderance of evidence. In response to the representative and attorney who maintained that firearms are not mentioned in the proposed legislation, the official PDF 2:43 a.m. on the morning of 26 January, page 3, lines 20 and 21, quote, order defendant to hand over firearms or deadly weapons. This does not allow a defendant, an accused, to tender their firearms to another private individual who could maintain them safely. At what expense and to what accountability shall a person's private property which is seized be safeguarded and damage compensated? The language in the bill requires a plaintiff to attest that they realize they're accountable for bearing false witness. An incompetent person can provide no such attestation by law. Therefore, the accused had no protections under that clause whatsoever. Career criminals get due process, can have an attorney appointed at no cost. None of these protections seem to apply to a person merely accused. Your intent on face value is laudable. As a senior, I appreciate your concerns, but please don't protect me this way. I'd be a defenseless elder in a world of.
Thank you, sir, for your testimony. The chair recognizes Paul Marcus to speak.
Hello.
Yes.
Yeah, I'm looking over the bill, and I very much agree with what the previous testimony. I'm a senior, and I have people in and out of my house as I have one of my sons is handicapped, and he's considered a vulnerable adult, and we have aides that are in and out of the house on a regular basis. I just see so many opportunities for issues where
my rights would be infringed because of some action on the part of one of his aides that I don't see how this bill addresses any of that. For the most part, the bill starts out with a list of RSAs that already cover everything that is in this bill. And this bill does not seem to offer any additional protections. I noted that the only place where it mentions firearms in this entire bill, at least the copy that I have, is where it says that it reduces the rights of the plaintiff to seek remedy under other RSA if he feels that he's being threatened in that way. And I don't see where that benefits a vulnerable adult.
Thank you, sir. Christina, could you let us know who else is in the queue to testify?
It's Representative Weber, and I have hands from a telephone number.
Wasn't done.
I have a hand from Penny Dean. I know that Buzz Scher was in the line, was on the call, and I thought it signed up to speak, but I don't know if he has or not. The hand is not up. The hand is now up. So I've got a telephone line, Penny Dean and Buzz Scher with hands up.
Let's try the telephone number and see who's there.
Okay, telephone ending in 276. You are going to have to unmute yourself, and you've done that, so go ahead.
Can you folks hear me?
Yep.
My name is James Gaffney. I live in Warner, and this bill should be ITL. This same bill has essentially come up now 3 years in a row, and the same people keep pointing out the same issues with the bill, and nobody seems to be listening. I really wish that folks would pay attention and address the low-hanging fruit, i.e. addressing the exploitation, of financial issues, and take the rest of the BS out of the bill, because it would be non-controversial then, right? The New Hampshire Constitution, Article 19, already guarantees that in cases where there's more than $1,500 of property involved in the case, that a person in a civil case, a person has a right to a jury trial. This bill goes against constitutional guarantees. Furthermore, it has a point in it where it says that they will.
You're putting all my thoughts together, right?
Is supposed to accept quote unquote foreign
before they call
orders.
And
May I speak?
Getting it all together so I'd have something to present. And
somebody,
sorry, Mr. Marquis, could you?
May I get my time back, please?
No, you
Yes,
can have started talking over you. So hang loose for a second, and we will mute. Representative Weber will let me know when the person is muted. And
I believe we're all set. I hope we are all set. And I have stopped the clock, so your time's been added back.
like they say in football, please add 15 seconds to the clock.
Thank you. This bill is, we already have RSA 631(1) through 3 for assault and reckless conduct. Criminal threatening is under 633(4). Sexual assault is 632A2 through 632A5. Interference with freedom is defined in 633(1) through 633(3A). Destruction of property is 634(1) through 634(2). Unauthorized entry is RSA 635(1) and 2. Harassment is 644(4). Cruelty to animals is 644(8). We could go on and on down the line as far as protections that are already in place for people that we don't need another bill to do. What we need the bill to do is to start paying attention to previous testimony.
It's time.
Thank you very much. The chair recognizes Penny Dean.
And Ms. Dean, you need to unmute.
Sorry, I unmuted mine, but not the one on the screen. I'm presuming you can hear me now. Thank you. My name is Penny Dean. I'm from Concord, New Hampshire. I'm an attorney licensed to practice in Maine, New Hampshire, and Massachusetts, and admitted to the federal courts in the United States District Court for the District of New Hampshire, Maine, Massachusetts, First Circuit Court of Appeals, the United States Supreme Court, and the DC Circuit. And I ask that you ITL this bill. For those who have suggested that those calling in to ask that the bill be ITL'd have not read the current version, I can most certainly assure this committee I and many others have read the current version. And just because the authors took the term firearms out does not mean that firearms will still not be taken from those accused here. And I can tell you that if I made those representations before a judge with this language, I would very quickly be fined and sanctioned because it's disingenuous to say the least. The author had admittedly in the initial testimony that they had copied federal law, and that is absolutely correct. And I think what's most important to know is if you look at federal law, which is 18 USC section 922 G8, that is a federal prohibition from an order that basically says if a person's subject to a court order that restrains a person from harassing, stalking, or threatening an intimate partner or child of such intimate partner. But before you say, well, gee, we're not just always talking about intimate partners, you have to look further to 18 USC 921A32 because the definition of intimate partner is not what you might think it is. Furthermore, if one looks at page 5 of this bill, lines 16 through 18, if a person is granted relief, the person who they're granted relief against, it makes it statutorily explicit a finding of abuse, exploitation, or neglect shall mean the defendant represents a credible threat to the safety of the plaintiff or physical, mental, or financial well-being. That is exactly the federal language that requires they take your guns away. So for someone to say, oh, we took all the guns out of here. Yeah, you took the term firearm out of the bill, but what you did is leave the results in any court.
Thank you.
Wow.
We have to shut her down.
Nope, 2 minutes is for everybody. Thank you, Counselor. I'd like to call on Joseph, is it Hebert or Ebert from the New Hampshire Police?
It is Joseph Ebert, E-B-E-R-T, and I am a captain with the New Hampshire State Police. Thank you so much for giving me the opportunity to talk this morning or this afternoon, as the case may be. I want to say first that clearly the state police is interested in any way at reducing harm to our elders. I think as we reviewed this bill, we did have some concern. Attorney Dean was actually referring to a portion of the statute, which caused us some concern in that it seems to take away the statute of limitations, and that's under 173D:6, subsection 6, Roman numeral 2. So it seems to take away the statute of limitations, and it also puts in there that standard of mental well-being. In review and conversation about this, our concern was that if 20 to 30 years had passed and somebody was bringing this forward, it would be very difficult for a member of law enforcement to determine what had caused the intervening issues in an individual's life. We're all impacted by a number of different factors. So when we stretch out over a significant period of time, it becomes very difficult to determine what is the true factor, if only one, that is causing a person mental well-being stress. So that's what we wanted to bring forward today. I'm certainly happy to answer any questions, should there be any.
Did he ever say he was for or against it?
Representative Gay has a question to clarify your testimony, Captain.
And I would ask the captain to unmute because I'm afraid I muted him when I thought there were no questions.
Not a problem, I'm back.
Okay, so may I ask a question?
Absolutely.
Are you for or against this bill?
Yes, so the Division of State Police has not taken a stance on the bill itself. And I know that can be disappointing to both sides, but the direction I got was to look at this procedurally and not to endorse or oppose this particular bill.
Thank you.
Thank you, that's helpful. The chair now recognizes Buzz Schur.
Thank you, Mr. Chair and members of the committee. My name is Albert Buzz Schur. I'm a professor at UNH Law. The opinions I express today are mine only, not those of UNH Law or UNH in Durham. I testify in support of, excuse me, HB 246. All I want to talk about is there's been a good bit of hyperbole from what I've heard about the concept of due process and how this violates due process in so many different ways. I teach in the area of due process. I practiced in the New Hampshire criminal justice system. I'm familiar with what due process is. This statute does not violate anyone's due process rights. Due process is not a fixed entity. It is a sliding scale entity depending on the nature of the right at stake. Like if we're going to violate your parole, you have very significant due process rights. If we're gonna, take away, a piece of candy, you have far less due process rights. This, I'm very familiar with these kind of statutes. I was opposed to legislation last session on red flag legislation, which I think potentially took away someone's constitutional right to possess a gun under the New Hampshire Constitution. And I was opposed to that legislation on due process rights. This statute does not have due process problems. It is much more moderate than the red flag legislation, which had very significant due process problems. This statute does not have due process problems. I'm looking at my notes. It is very similar to domestic violence statutes, all of which have survived due process challenges. So given the rights that are at stake here, as compared to those rights at stake when more significant due process is given, I don't think, as a constitutional matter, in my opinion, this statute's.
Thank you, Professor Schur, for your testimony. The chair recognizes former State Representative J.R. Hole. You have 2 minutes.
Good afternoon. Chair, can you hear me?
Yes, I can, J.R. Representative.
Thank you. I am speaking on behalf of myself as well as the New Hampshire Firearms Coalition. We are adamantly opposed to this bill. It is good to know that a number of people have brought up the fact that firearms issues are in fact related to this bill. Both the proponents for the bill as well as the opponents of the bill recognize the fact that this has real issues regarding the for the firearms owners in the state of New Hampshire, as well as for the elders. Those who want to pass this bill claim it's about financial issues. However, they have not written a bill that does that. This bill is verbatim with House Bill 1660 as vetoed by the governor less than a year ago. I would ask that the committee find this bill ITL until the issues that were in the bill last year are resolved. Minor tweaks are not sufficient. It is clear from the language that you violate numerous protections in our Constitution, both state and federal. Till that language is corrected, please kill this bill. Thank you.
Thank you, Representative. And we seem to have Representative Norm Silber back on the line. Representative Silber.
Representative Silber,
unmute. Can you hear me okay?
Yes, we can.
Sorry that I was delayed. My schedule is all messed up. I am speaking for myself. I'm opposed to the bill. I call this bill as a zombie bill because it was killed in the last biennium. in a different form, a slightly different form. It's been brought forth in another, like I said, a slightly different form, even though the proponents would like to say it has nothing to do with Second Amendment or firearms issues. It really does. That's the undercurrent here. And this is just a disguised effort to, without very much due process, seize firearms from people that someone else thinks are vulnerable. And it's something that is really against the Constitution. So I would urge that the committee find it inexpedient to legislate. Thank you.
Thank you, Representative. The chair calls on Joe Hannon.
Hello, good afternoon, members of the committee. My name is Joe Hannon. I'm a former state rep, and also I'm the vice president for Gun Owners of New Hampshire. I'm testifying in opposition to this bill, and we ask that you ITL it. I don't want to repeat what everyone else has said, like Penny Dean, about the legal implications of why this is wrong, but I do want to just reiterate one thing. It does, even though the authors of the bill have claimed that it's removed the words firearms, and I believe the original versions of this bill had firearms mentioned 30 plus times in it, taking the words out and changing some of the language does not remove the fact that this would trigger a federal prohibition to own firearms for many people. And there are ways to do that in cases of domestic violence and other abuse and other crimes, but this expands that even greater in an area that I don't think people are comprehending from one side of this debate. So we ask that you ITL this bill, and that's about it. I appreciate it. Thank you.
Thank you, Adam. The chair recognizes John Schmidt.
Yeah, I'd just like to say that I agree with a whole bunch of others here who have, I think, correctly said that this could be used for gun confiscation. But my concern is not just gun confiscation, it's confiscation of anything. I don't believe the government should be able to confiscate life, liberty, or property without due process, and constitutionally due process is a trial by jury of your peers, not even by just a ruling of an unelected judge. And I think in New Hampshire, all our judges are unelected. Thank you.
Thank you, sir. The chair recognizes someone calling in from area code 617, Metro Boston.
Good afternoon, Mr. Chairman and members of the committee. My name is Jay Simpkin, 20 Cabot Drive, Nashua, New Hampshire. I offer points that I have not heard anyone else make. First point is that someone who is alleged to have violated this enactment, if enactment it be, faces an uphill fight. Most folks think of litigation as Judge Judy. Someone who is alleged to have violated the terms of this enactment faces tens of thousands of dollars in attorney's fees and costs to contest the allegations brought against them. Very few New Hampshire residents can, without much thought, write checks, note the plural, for $6,000, $8,000, $10,000, $12,000. Thus, this bill should be ITL'd unless it has put into it a provision that any person alleged to have violated the terms of this bill should have their attorney's fees and costs reimbursed by the state from taxpayer funds in full at their attorneys and the experts that their attorneys may choose to hire, normal hourly rates. Without that, a person alleged to have done something wrong within the terms of this law is simply going to be railroaded. I speak from experience, not in New Hampshire, but in Massachusetts. A lawless licensor in Massachusetts, who was and is an attorney, determined that he was going to revoke my license to carry firearms. He did so. It costs well over $100,000 for me to get back my license, which was restored to me by order of the Supreme Judicial Court of Massachusetts. from which you can reasonably infer I had done nothing much wrong.
Thank you very much, sir, for your story. I did not give people the chance. I didn't look around the room. I didn't look at my phone. I think there may have been a question for Penny Dean, a lawyer who had testified before, and Ms. Dean wishes to come back. What I'll do is give you about a half a minute for a reprise or an additional point, and then, to be fair, see if there's a question for you in your professional capacity. So please unmute Penny Dean for 30 seconds.
Ms. Dean is unmuted.
Thank you, Chair. Yes, and I want to apologize for speaking so fast. I had many, many more points to make, but given the allotted time, I could not make them. I respectfully disagree with my professor that due process is solved in this particular bill. There's been different iterations, but the way it is now, because it mirrors the language of federal law, I think that the state police has also identified one of the many, many flaws in the bill. And because I'm given 30 seconds, I can't go through them, but I'm happy to answer any questions that committee members may have and point out many other defects in the bill.
I'm going to allow one question, and again, that is because this is a bit unusual. So I'll allow one question, and if Representative Folsom would pose her question.
Thank you, Mr. Chairman. Thank you, Ms. Dean. My question is, acknowledging that you did talk really, really fast, and I was not able to jot down some of the things you said, would you be willing to submit some written testimony with the information to the committee?
Email.
Through an email?
She's muted, I bet.
If she's muted, you can unmute
She's
her
muted.
for her answer to that question, and that only.
She is available. I can't unmute her. She has to unmute herself.
Okay.
I did unmute can you hear me? Because I did unmute myself.
And so the question is, and this is all we're recognizing you for, is will you submit written testimony to the committee of everything else you had to say?
With all due respect, I don't think I have the time to do that. In order to do that properly in a lawyer job would probably take about 6 hours because there are huge flaws. And I started to write them down just to prepare for this hearing, took a couple hours.
Thank you. You have used your time. Is there anyone else who wishes to speak?
I see no further hands, Mr. Chairman.
In which case, I close this hearing on House Bill 246. And I do have a question for my predecessor. I have several bills in my exec file, but none of them was from today. And am I correct in believing that while I may exec any bill from today, in order to exec a previous bill, that must be published, noticed?
Much as I hate to admit it, no, Mr. Chairman, what the notice says is that executive session on pending legislation, which is all pending legislation, may be held throughout the day, time permitting, from the time the committee is initially convened. So that is the notice, and under the notice that has been given, you are free to take up any bill that has finished its hearing.
With no disrespect to yourself or your wisdom, I would like to put everything on mute for about 5 minutes so I can call the clerk for confirmation of that. I would feel safe for myself.
I'm entirely happy for you to do so. It's a policy I disagree with, but I think that that's what the policy is. But by all means, be guided by the clerk.
Thank you.
Actually, Mr. Chair, may I bring up something though about the last one? And I'm sorry, I missed this. During the testimony, there was a person named Mike Thornton who had written in an email to the committee stating that he had waited to testify before and wanted to be able to testify today, but I do not know if he re-signed up. He had apparently signed up. I see him still listed in the attendees, and I asked him to raise his hand at the end if he had not been called upon, and I didn't act quickly enough to let you know. I do not know if you wish to go back.
Representative Knurk, last time you remember they got a minute. This time, Mr. Thornton was given 2 minutes. So yes, he did testify today.
Oh, he did. I'm sorry. I actually missed it then. Okay, sorry.
Nope, no offense taken.
I can't keep the name straight.
I need a ruling from the clerk, please.
So, hey, everybody. Well, he's hard at work. I had to present one of my bills in eDNA last week. I must say they were nowhere near as warm and friendly as this group is. The comments we got about that were astounding. And it was just, there wasn't any nice chit chat. They didn't seem to be particularly friendly. And actually, I have not had a chance to do it yet, but I will send you all. Those who are old timers will remember Gina Powers. Gina Powers is a lobbyist, and she had a baby about 14 months ago. So, and I haven't seen her here, but she was in one of the committee hearings. She sent a picture of her 14-month-old daughter standing, watching, entranced as we had our session. She said the only thing that would get her daughter quiet was listening to our committee hearing. So we now have a new thing we can add in as one of our skill sets is pacifying toddlers. Not bad.
Or we're boring.
Yeah, well, she thought it might have been the in utero exposure that she had listening to us before that made it feel all soft, cozy, and cuddly for her daughter. I'll try to remember to get that picture. So I got her permission to send the picture.
We are set. And the ruling from the clerk is, yes, we can exec anything. I would really rather exec the things that won't come out 11:10 from before. I really wouldn't. I want to do the things just to burn up some exec stuff that I think we could all pretty well get our minds around. Yet again, Representative Knurk, an illustration of what you've discovered over the years. This is the best committee in the House.
Well, on that happy note, do you want me to present a couple? Because I did a couple of the amendments on the cannabis bills, and I can present those.
Well, I would, but I want to do one first. And
go ahead.
If I may, thank you very much. And this is House Bill 247. Oh, wait a minute. We are now in exec session. This is House Bill 247, relative to treatment alternatives for opioids. And Dr. Lundgren, a chiropractor who also represents Rockingham District 5, and I had a lengthy conversation about the bill. And we, if you remember, most of us found there was some really good ideas and certainly great sentiment in this, but it sure wasn't ready for prime time, nor could we probably get it ready on the fast. So what he suggested is that we retain this bill. He will work on it. We will send it out for a fiscal note, And that would be the motion that the bill's primary sponsor is comfortable with. Over the summer, we would get some folks together and work on this bill, and come fall, we would see it in a much improved version. So I would entertain, on his behalf, someone to make a motion to retain. And I.
So moved.
Okay, let's see. The Representative Gay so moved, and Representative King seconded it. And we thank you for Representative Soloway's enthusiasm as always. So any discussion on this bill 247 that it be retained?
I see no hands up, Mr. Chairman. I would just state for myself, if you would care to recognize me.
I recognize Representative Weber.
Thank you. I would just say I think that that's a very good resolution. I think there's some excellent policy in the bill, but I also think that the execution is going to be really difficult as written. So I think that working on it some more is a very good idea.
Thank you. Any other comments?
I see Representative Marsh waving his hand.
Representative Marsh.
Yes, thank you, Mr. Chairman. First of all, I wanted to say that I am back, and second of all, that I concur with Representative Weber.
I told my wife how we are a group of people who like to fix things. And she says, oh, a room of doctors, clergy, social workers, nurses, art therapists, counselors, and the like. Are fix-it people? Really? That's New York sarcasm coming from her. Any other discussion on retain this bill? Then would the clerk please call the roll?
Representative Snow had his hand up.
Yes, I had my hand up. Could I just ask, comment? I think also this motion would satisfy the Department of Corrections, which was very concerned about it. And I think they would probably be somebody that should be consulted when you look at the bill in more detail, because it did cause considerable problems for them.
I'm sure those who will later volunteer over the summer to be part of Representative Lundgren's rewrite committee will forward a variety of things from a number of the agencies. Thank you for that, Representative Snow. Now we are in the voting mode, and the clerk will please call the roll.
Representative Marsh?
Votes yes.
Representative McMahon?
Yes.
Representative Nelson?
Yes.
Representative Acton?
Yes.
Representative Gay?
Yes.
Representative Cushman?
Yes.
Representative Folsom is yes. Representative Kelsey?
Yes.
Representative King?
Yes.
Representative Kofalt?
Yes.
Representative Weber?
Yes.
Representative McKay?
Yes.
Representative Snow?
Yes.
Representative Knirk?
Yes.
Representative Soloway?
Yes.
Representative Cannon?
Yes.
Representative Nutter Upham?
Yes.
Representative Shapiro?
Yes.
Representative Woods?
Yes.
Representative Merchant?
Yes.
Representative Pearson?
Yes.
That's 21 for. Do we have to do reports for things that are retained?
You don't have to do reports for a retained bill. We
Thank
just
you.
have to send a list to the clerk.
Okay, thank you.
And now Representative Knirk. House Bill 240 relative to identification of cannabis strain for therapeutic cannabis. I would have normally asked you the question, is it okay with you for us to proceed here? But I believe you have been in consultation with either Representative Conley or Daughtonville or both, and you have an amendment to satisfy many concerns. Is that correct?
That is correct. And I sent it out because it's important you all have it. I do presume that they have brought it down to the committee room. In addition, sorry, there's my copy of the bill. I lost it. It was on the floor. Anyway, in addition, I sent it to all of the committee members by email, and I announced that just before lunch so you could find it.
We'll give them a few minutes, Representative, just in case. It's a very few words changed.
That's correct.
Small bill, but still, we'll give a few minutes if they wish.
Are we doing 240 first?
240, yes, 240
Yeah,
is next.
HB 240.
A question?
Let him make his presentation.
Oh.
One of our legislators has a bad cough.
I'm sorry, I have a visiting dog as well as a dog.
I think we're good as long as we can't see them, right?
That's not my rule.
No, I know.
I almost asked Representative Neil Kirk, because I've inherited the punster mantle from him, if he watched Puppy Bowl on the Animal Planet yesterday, which was their run-up to the Super Bowl. There must have been 4 dog puns per minute over 3 hours. I thought of him throughout. Because of the puns, not the dogs.
Right.
Okay, Representative Knurk, would you let us know how your amendment speaks to concerns we raised earlier?
Yes, first of all, I should say that this is not purely me. I did process this with the Therapeutic Cannabis Medical Oversight Board, and we went through this bill. I also need to speak up for one of the advocacy groups because there were concerns. They wanted to make sure that it was properly represented, and give you just a very quick summary of how it evolved so you understand why they made the changes. What it was is advocacy groups are concerned that the using the fancy names like Hindu Kush and stuff were names that might sound appealing to kids, and it was on the social media. The rule was set up that these names could not be used at all on the products, on the websites, on the social media. That was the problem for the patients. So this, the goal of this is to overturn that rule, and indeed that particular advocacy group was present at the hearing as well, and we processed it through. First, we wanted to change, and if you look at the amendment, you will notice, and it's in bold, it says specifying, this is line 6 in the amendment, the commercial strain name of the cannabis. That was instead of the words full name, because full name is exceedingly vague. Chemovar is actually one of the proper names, but that's a little bit confusing. Commercial strain name is what is used in the therapeutic cannabis rules, so it was most consistent. So we changed that to that comment. The other thing which is did not get, well, sorry, there's a second place we changed that, and that is in line 9 to 10. It also changes to commercial strain name. In line 5, we continue to keep it with shall. That means that the ATC must put on a label on the product so they know what the name of the product is. And we did continue with the language that said that that commercial strain name, this is line 7 and 8, will be listed on the public internet website. We continued to not allow it on the social media because that is the part that the kids may get directed to with algorithmic social media feeds. The website allows the patient to be, the certifying patient to be able to go to the website, find out if that particular ATC carries the product that they're looking for, and they can also be able to remember the common name instead of a series of letters and numbers. So this is vetted by the Therapeutic Cannabis Medical Oversight Board. They were happy with it. I can't remember what the vote is, but it doesn't matter. We passed it. And in addition to that, the sponsor was comfortable with this too. So I guess I would like to move amendment number, where is it here? Amendment number 2021-0237H.
Do I hear a second?
Second.
Who is that?
Okay.
Representative McKay, second? Is that correct?
Yes.
Yes.
All right. Any further discussion on the amendment?
I just want to have a question.
Representative Shapiro has his hand up.
Representative Shapiro.
I have a question for Representative Knirk. Since these names seem to me to be somewhat homemade, at least at one point, are there ever competing names for the same strain?
As far as I understand, these are basically, we call them commercial strain names because they are used in the commercial business of therapeutic cannabis, and they are uniform throughout the country. They've been names that have adopted for decades. For example, Hindu Kush was named that way because apparently that strain was either identified or developed in the Hindu Kush area. That's a geographic area. So to be a little like, saying, some other kind of name from for a wine and terrier name for where it comes from. So but yeah, these are basically accepted names that are used in commerce and have been for decades. But yeah, of course, they're all made up.
Thank you.
Any other questions? Representative Gay, you had a question.
Thank you. That was really my question, was this a terminology that was universal? And did they ever make up medical sounding names for them? I kind of guess not.
May I answer?
Yes, go ahead.
I have looked at some of the names, and we were directed to leafly.com, and I scrolled through some of those. They generally don't seem to have true medical names or medical sounding names. They're usually cutesy names, bubblegum, Hindu Kush, that kind of stuff, which is why they were considered to be perhaps difficult or not good to have on social media feeds with algorithms directing kids to them.
Representative Merchant, you have a question or statement.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. To Representative Knirk. On the commercial strain name, is that like a proprietary name that is trademark protected, or is it something more like a generic name that anyone can use?
That I do not know that. I do not know that, but I don't think so because these. Okay, I just better not say anymore. I don't know.
Anyone else with a question? Representative Gay with a follow-up?
Thank you. Thank you very much. Are we supposed to, were we supposed to see or not see? You made mention that there are prohibitions where these names can be used. I don't see them in the bill, but that there's somewhere else that they can't be used in social media?
Yes, Representative, that's already in rule. Indeed, the purpose of this legislation is to overturn the rule that was promulgated by the Therapeutic Cannabis Program that prohibited the use of the commercial strain name on the package label, on the website, and on the social media. So this would allow it back on, not allow it, but force it back onto the product, would allow it on the website, but the rule prohibiting the social media would still be standing.
Thank you.
Anyone else with a question for Representative Knirk or a statement, because this is an exec session? You can make a speech.
I see no further hands up from, I suppose we're the peanut gallery.
Thank you, Representative, for giving me a walk down memory lane, and we can provide an answer to the young members later what that means. It has been moved by Representative Knirk and seconded by Representative McKay. 2021-20237H, the amendment. The clerk will call the roll, please.
Representative Marsh,
Votes yes.
Representative McMahon,
Yes.
Representative Nelson,
Yes.
Representative Acton,
Yes.
Representative Gay,
Yes.
Representative Cushman,
Yes.
Representative Folsom, yes. Representative Kelsey,
Yes.
Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Representative McKay, you have to unmute.
Thank you.
Representative McKay?
Yes.
Thank you. Representative Snow? I read his lips.
Representative Snow, you need to unmute.
Yes.
Thank you. Representative Knirk?
Yes.
Representative Soloway?
Yes.
Representative Cannon?
Yes.
Representative Nutter Upham?
Yes.
Representative Shapiro?
Yes.
Representative Woods?
Yes.
Representative Merchant?
Yes.
Representative Pearson?
Yes.
21.
21-0. Now we have House Bill 240 as amended. I need somebody to move and second.
Make a motion.
Yes.
Okay.
Make your motion.
Make a motion to pass, ought to pass with amendment 240.
OTPA, Representative Merchant. Do we have a second?
Knirk.
Knirk, second. Any further discussion? We basically just did it. So now, see.
I don't see any on the
Thank you. Thank you.
gallery.
Which bill are we working on?
Would the clerk now please call the roll?
We just voted on the amendment.
Mr. Chairman, Dennis Acton had his hand up.
Oh,
I beg your pardon.
Can I just make one quick comment? I think that'll be meaningful. On the very day that that we had this hearing, my wife came home that night from seeing patients as a home care physical therapist, and she didn't even know that we had that hearing. But she had a story from one of her patients that he was suffering from a condition that he was able to at one point obtain a named strain in Maine that helped him. So he went ahead and went through the whole licensing process here in New Hampshire, and went to the Dover ATC and was unable to find. He tried to request that specific name, but they wouldn't give it. They didn't have that information, so he spent $1,000 just kind of trying various things that never worked for him, and then he never used it, and so it was a failure for him to even go and get the card. So that's just we're fixing that problem right here. Thank you.
Anyone else with a comment or a question?
Okay.
Seeing now, the clerk may call the roll. Seeing none.
Representative Marsh?
Votes yes.
Representative McMahon?
Yes.
Representative Nelson?
Yes.
Representative Acton?
Yes.
Representative Gay?
Yes.
Representative Cushman?
Yes.
Representative Folsom, yes. Representative Kelsey?
Yes.
Representative King?
Yes.
Representative Kofal?
Yes.
Representative Weber?
Yes.
Representative McKay?
Yes.
Representative Snow? Representative Snow?
Representative Snow on mute.
Yes. Yes.
You. Representative Knirk?
Yes.
Muted.
Representative Soloway?
Yes.
Representative Cannon?
Yes.
Representative Nutter Upham?
Yes.
Representative Shapiro?
Yes.
Representative Woods?
Yes.
Representative Merchant?
Yes.
Representative Pearson?
Yes.
Okay, 21-0.
21-0. Any objection to consent? Representative Merchant, will you write the report, please?
Yes. When is the report due, please?
Soon.
Thank you.
We normally have the custom that you may not leave the room until the report is turned in to the clerk. While this could be the start of a new custom, I'm not going to do that. If you could email it to me within 48 hours, please, so I can go over it. It can then go to the clerk. It can hop its happy way forward for whenever we actually get to vote in the large group.
Thank you, Mr. Chairman.
48 hours. So Merchant will write the blurb. Thank you. House Bill 163, which is relative to cannabis during pregnancy. It's Representative Marsh's bill, and I put a hold on to it until there was an amendment coming forward from Representative Knurk, which we now have in hand. So Representative Marsh, would you be happy if we proceeded, or would you rather we wait a week?
Mr. Chairman, I would like to proceed. I move ought to pass on House Bill 163, and I would also move the amendment, which is 0238H, and yield the floor to Representative Knurk to speak to that.
Well, wow. I mean, you're good at this. Representative Marsh moves OTP. I'm waiting for a second.
No, we have to move the amendment first.
The amendment
And
first.
the amendment.
Right.
I would second the amendment.
Second, the amendment is Representative Weber. That's Marsh, yes, and Weber, second. On the amendment 0238H.
Right.
Now,
May I speak?
you may speak.
May I speak to his motion?
You may speak to the motion on the amendment and what it does.
Yes. Okay, so again, we processed this in our Therapeutic Cannabis Medical Oversight Board meeting last Wednesday night. And if you pull out your amendment, which again is 0238, and the way this works, everything in the bill is the same on page 1 and the top of page 2. This bill replaces sections 3 and 4, which begins on page 2, line 4. So again, if you were trying to follow both the bill and the amendment, you look in those two places. The concerns were a few, and by the way, at first I should say, as I commented in my testimony on this, TCMOB had already processed the 1581, the bill from last year. No, that was a different bill. Definitely, okay, we had processed last year's bill, and we did. Jeff, that was a good yawn, but can you mute yourself?
Representative Galloway, please mute during yawning.
Yes.
It is nap time.
Yes. Anyway, but I testified, and we had processed last year's bill, and we overall agreed with the concept. We just had a few little concerns. So if we look now on the amendment, on the amendment, it is line 6. The language changed. Before, all it said was that counseling has been provided to all women. We added in by the certifying provider. We did not feel that the ATC was qualified to necessarily provide that type of counseling. They aren't trained for that. They are not medical providers. It would require them to be profiling people as to gender and whether they're of childbearing age. And so we felt it was much more appropriate that the counseling be done by the certifying provider. So this just simply puts that in. And on the next line, the next line when it says on page 7, and the parent or guardian of a patient less than age 18, because the original bill just said counseling anybody under 25 and children under 18 need to have a parent or guardian present when talking about any intervention. So that's the only words that are added in there. And the way that this is going to work, likely the rules will be promulgated. There's already a checkbox that they've counseled on a number of other things. This language would be added in, so it's not an undue burden. Move down further in the amendment to line 14. The objection which I raised at the hearing, and Mike Holt from Therapeutic Cannabis also echoed, and we agreed with in our TCMOB meeting, is that we should not be codifying what the risks are in statute, because statute takes a long time to change. Medical knowledge changes on occasion. And so we thought, instead of having the words that were there before, which is the risks of cannabis use during pregnancy and while breastfeeding, and it used to say, including the risk of low birth weight and developmental issues, strike that language and we just say, as outlined by the Therapeutic Cannabis Medical Oversight Board. I'd already sent you, prior to the hearing, some of the work products we've already developed in preparation to comply with this bill anyway. And so we've already outlined those, and actually they're identical. But this way, if something changes, new issues come up, or issues are proven not to be true, that can be altered internally through rules, not having to go through statute. The next thing, though, on the next line, where it says on line 15, it used to say a warning poster. We did not like the word warning. We certainly agree that warning is a good thing to use when you're buying cigarettes or alcohol, but when you have an issue here where people are coming in for a therapeutic material that they've been certified to use, warning we thought might sound a wee bit harsh, and we said an informational poster. So it still gives the information. It still will be warnings. And again, I sent you some ideas of what that could be with the slide deck that I sent. But the point is, we wouldn't use the word warning, we'd use informational because we're giving information. And the reason partly for that is there may be a very rare time when it actually is appropriate for a pregnant woman to continue using cannabis therapeutically. The wording we have in our work that we've done is that it should not be used if there is any other acceptable alternative. So in the rare situation where somebody has, let's say, a totally out of control PTSD and they will not make it through their pregnancy, perhaps you might, but that's going to be rare. So that was the addition we put in there, or the reason for that, informational rather than warning. Now drop down to number 9, which is line 21 of the amendment. Same principle here. Instead of the long laundry list that was there of all the changes that are in the Surgeon General's advisory, begin their medical, they might change, new things may come up, things may be proven not to be true. We have a default to being in line number 21 and 22, as outlined by the Therapeutic Cannabis Medical Oversight Board. Then if you slide on down to line 23, once again, it becomes an informational poster rather than a warning poster. So those are the only changes, simply making sure that we know that the certified provider does the counseling, that the parent or guardian is there if you're less than 18, that the TCMOB has the ability to be nimble and change these issues as needed, and that it's called informational, not warning. Those are all the changes in the amendment. Any questions?
Does anybody have any questions for Representative Knirk?
Representative Marsh is waving his hand.
Representative Marsh.
Yes, I would like to thank Representative Knirk for taking this on and doing the hard work and making a good bill better, and I fully support his amendment.
Because we just got this today, I'm not going to go at my usual breakneck speed and give us a few minutes just to read anything and formulate a question. And so everybody will know that we've done all the looking we want to on this. Representative Cushman.
Thank you, Mr. Chairman. Representative Marsh and Knirk, whoever would like to answer, does this bill, correct me, let me know if I'm right in thinking this is going to force, say, a provider who doesn't agree with the risk assessment presented by the Surgeon General, if they have a differing opinion, this will force them to state an opinion that they don't have?
May I answer the question, Mr. Chairman?
Yes, sir.
Yes. The question is whether counseling has been given. It does not ask about the content or require any provider to conform with any other provider's opinions. As we all know, doctors are prone to disagreeing about all sorts of things, as Representative Knirk and I disagree about many things.
Not too often. May I answer also?
Go ahead.
We have also, in the Therapeutic Cannabis Medical Oversight Board, spent months this last year working on developing a program of best clinical practices for certifying providers, and those do include counseling. And again, because it is a moving target, we don't put that in as saying you must tell them this or this or this, but that you really should counsel the patients about all of these issues, and that's the adolescents regarding that piece, and the pregnant and lactating females as well.
And Representative Nelson had his hand up.
Representative Nelson.
Yes, I have a question. I do not have the amendment in front of me, but could Representative Knirk on page 2 of the original number 7, just tell me the changes of that again, because I may have a question for you.
Sure thing. Okay, so you're on the original bill, line 13, I presume?
That is correct.
Okay. All it is the original, it says information about the risks of cannabis use during pregnancy and while breastfeeding, comma, including the risk of low birth weight and developmental issues,
right.
Period. We agree with those. That is in our work that we've done. But the issue is that medicine can change, so we changed it to reading instead during pregnancy and while breastfeeding, as outlined by the Therapeutic Cannabis Medical Oversight Board. That way we have the ability to be nimble to change it next year should something new need to be added, or should something need to be removed. And many of these findings are relatively new. Also, many of them are based upon recreational use. We may find different issues with therapeutic use. So the point is we can then be nimble and change it in rules over the course of a year instead of over the course of a couple of years.
Thank you.
And the next section is just changing from a warning poster to a, which is on line 15 of the original bill, to an informational poster.
Question, and I do have a follow-up question.
Go ahead, Representative.
Thank you. I'm sorry, Mr. Chairman. Informational versus, what would that just say? I mean, would it list specific warnings? Because I think if a woman or somebody went in there and they saw very specific things, it might trigger something that it could affect your memory, a whole bunch of other things throughout the bill, rather than just putting, a generic word in there and you really don't know which one they're talking about.
May I answer?
Go ahead, please.
Well, the things that we have been preparing already state things such as there is no known safe amount of cannabis to use during pregnancy and breastfeeding. That's pretty well agreed upon by the Surgeon General and anybody else. That's why, again, well, actually, I must say, even though I was an orthopedic surgeon, if I had a patient who was pregnant and I was considering an intervention or we were talking about medicines, I still would like to get them off as much as I could. And I'm not an obstetrician, but I just simply knew that the cleaner that person would be from anything. It's the same with alcohol, cigarettes. But the thing is, on occasion, there are times when we need to have somebody on a medication because it's the appropriate thing for them to be able to make it through. So we'd use factual information. If you go back to the email that I sent before the hearing on this, I did have a slide deck, and in that there were a couple of schematics, a couple of diagrams of some of the posters that are used, one put out by the CDC, one by one of the other states, and they are, eye-catchy. They have the points about the impact upon the mother, the impact upon the fetus, so that you can kind of know what those are.
Thank you.
Sure.
Anyone else with a question?
Representative Snow had his hand up.
Yes, Representative Snow and then Representative Gay.
You have to unmute.
Ken, unmute.
Representative Snow, you need to unmute.
Unmute, Ken. Good thing we couldn't hear that.
So we can stick it on the edge so we can remind you where the button is.
Oh no, where'd he go?
We lost.
Oh, he hit the leave meeting button.
No,
no, he's still there.
No,
He's still there.
Still with us. He
He hit the video button.
Took the video off.
Yeah. Well, now I can't even read his lips.
Buttons to see. You
No.
have to touch it to turn it on. So.
Try the space bar.
It doesn't work with the. It doesn't work.
It doesn't work with webinar. Okay.
Click on the microphone, Ken.
Microphone in the lower corner.
No, there is no microphone.
Yeah, there you go. You're on now. You're on.
Oh, don't touch.
I'm
Now you're
muted. I'm now unmuted. I'm sorry.
Yes.
I don't know why it keeps doing that. Anyway, there's a part in which you talked about counseling to be provided by the referring physician. Where is that? Because I can't find it.
Okay.
Is it on page 2 in that same?
In the original bill, it is not there. It is there in the amendment. And what it is in the amendment on line 6, that is where it is inserted that the counseling will be provided by the certifying provider.
Okay, that makes sense.
Any other questions, Representative Gay?
Chair, is he through? And thank you, Representative Knurk. It sounds to me, please correct me if I'm wrong. I'll make a statement, you tell me if I'm right or wrong. It sounds like the change in wording makes it better because you're not being restricted to talk to the certifying provider is not restricted to the points made by the Therapeutic Cannabis Medical Oversight Board, that just gives a nice general term in line 14 that they can post those things as the list changes by the Therapeutic Cannabis Medical Board. You can post different lists as they evolve. So this isn't restrictive language. It's actually allowing more flexibility.
Yeah.
May I answer?
Yeah.
Yes, that is the intent of the change, is to keep it nimble, because that is the job of the Therapeutic Cannabis Medical Oversight Board, is to review the medical issues. And we again have spent the entire last year working on provider education pieces with slide decks, handouts, and we were going to start a roadshow, but that's a little on hold for now. And then having also patient information things. That is our job, to do it and to review these things, and that's why we felt, and with Representative Marsh's blessings, that it'd be reasonable to just let the TCMOB do that job as it should.
Any other questions on the amendment?
See no hands up.
Thank you. Seeing none, hearing none, would the clerk please call the roll on the amendment 0238H?
Representative Marsh,
Votes yes.
Representative McMahon,
Yes.
Representative Nelson,
Yeah, yes.
Representative Acton,
Yes.
Representative Gay,
Yes.
Representative Cushman,
Yes.
Representative Folsom, yes. Representative Kelsey,
Yes.
Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson.
Yes, 21-0. And now I know Representative Marsh is quite eager to move House Bill 163 FN amended. And so,
You read my mind, Mr. Chairman. I make that motion.
and who has a second on this?
Second,
Who was that?
Representative Shapiro.
Shapiro, Marsh and Shapiro. Any discussion now on this bill 163 FN amended?
I don't. Hands up, Mr. Chairman. Oh, no, Representative Kofalt has his hand up, Mr. Chairman.
Well, the chair calls Representative Cushman.
I am going to just say that I can't support this bill because I think it's too much meddling in the patient-client relationship. We don't mandate by separate RSA counseling for the dangers of Zofran or other antiemetics during pregnancy. And I've also received a lot of feedback and did some research on the benefits of using cannabis for morning sickness during pregnancy. And I think that since the science is pretty, I don't think that there's a robust body of literature on pregnancy and cannabis use. I know there are a few studies, but I don't think it's reasonable to make a separate RSA to require this counseling. So I won't be supporting it.
Would either Representative Marsh or Knirk
I would like to, please.
do that?
Jerry, Knirk, Representative Knirk.
That's the one.
Okay. Yeah, the difficulty though here, and this always makes it quite difficult, is to remember that cannabis continues to be a Schedule I material, which is why we do not talk about prescribing it. And we have to have a whole set of rules about how we run this program that are so vastly different than how we do medicine in general, because physicians cannot, well, sorry, providers, because other people can write too, are not really, we don't have a proper standard of care. We don't have an FDA rulings on these things. So we have to work in a fashion that combines a currently federally illegal material with something that the state is sanctioning to be used therapeutically. And well, there are points about therapeutic cannabis may be helpful for morning sickness. The point of the matter is, so was thalidomide.
Yeah.
And so we have to remember that all medicines or all materials have goods and bads to them, and a patient should be informed as to the importance of the risks and the benefits. And I agree with you, and so I commented before, we don't have a lot of data from the from the therapeutic cannabis side. It comes from the recreational side currently, and that's why we're defaulting to TCMOB, so we can take out some of these warnings if it turns out that we have new data that says, hey, it isn't so bad if it's under a certain amount of control therapeutically. So that's the idea of making this flexible so it can be changed, but the current information would support being highly cautious in terms of any therapeutic cannabis.
Mr. Chairman, I saw Representative Kofold put up a hand a while ago, but it's down again, so I don't know if he is still intending to talk or not.
It was not my intention to put my hand down. I'm not sure how that happened.
Before I call on you, Representative, do you have a follow-up, Representative Cushman?
Yeah, my statement is that I understand that the regulation mechanism is different and it's kind of a roundabout way. And I understand there's some wiggle room now with this oversight board. Even if there is an oversight board and standards of practice, established by that, it's still the provider's prerogative, in my view, to provide informed consent and their responsibility under the law anyway. So they will do that with their own medically informed opinion.
May I respond, though?
Hey, Representative Knurk.
Again, as Representative Marsh said, this bill does not state what they need to say, just that they have given the counseling. And as Representative Marsh pointed out, many physicians, we often do not agree about medical issues. And so if that particular physician wishes to tell them that it is perfectly fine, they can. They still check the box if they've counseled the patient. I would not personally agree with that counseling, but there's nothing that says what that certifying provider has to say to the patient.
Mr. Chairman, I have my hand up as well.
Yes, Representative Marsh.
Yes, thank you. I would like to point out to the committee that most medications like Zofran, which was given as an example, are approved by the Food and Drug Administration. And the Food and Drug Administration has warning labels and package inserts included with these products before they are distributed to consumers. So there is a mechanism whereby the information that consumers need is conveyed to the consumers. In the case of cannabis, it has not gone through that process. The legislature has determined that cannabis is to be provided as a drug to people in the therapeutic cannabis program, and therefore it becomes incumbent upon the legislature to make sure that the people who are getting this drug get the information they need to make an informed decision, just as the FDA has done on a national level for other prescription drugs like Zofran. So I think in this case, we are just doing the second half of our duty. We've made this drug available to the public, and we have a duty then to make sure that they get the information to make an informed decision. So thank you very much.
Representative Kofold.
Yes, thank you, Mr. Chairman. I have to say, I've kind of been on the fence on this one. I think it makes good sense to inform people about risks. At the same time, I also am concerned about codifying something in the law, which I think is ultimately best handled elsewhere. And if I recall correctly, somebody from DHHS had stated that it was the department's intention to produce similar materials. So, as far as the availability of the materials are concerned, I feel like codifying this in legislation is probably not necessary, and I am a little bit concerned about the state of the relationship between the physician and the patient. So, for that reason, I am going to be voting no on OTP.
Anyone else?
I see no other hands.
Give it 20 seconds.
May I actually answer back to Representative Kofalt for a moment?
Yes, you got in under my 20 seconds. Do it.
Okay, and actually what I'm going to say is very much what Representative Marsh said when he presented this bill. Sometimes legislation helps to make sure something really happens. And indeed, you know, we are on board with this and are working on it, but it is helpful sometimes to make sure that something truly gets done.
And let me underscore that in that I'm involved in something with one of the departments where they had said that they were going to do something and they haven't done it in a few years. And so now there will be a bill that I will be part of for the same reason. I'm sure they just forgot. Having it in law will help them remember. Anybody else?
I don't see any hands, Mr. Chair.
The bill is House Bill 163 FN as amended, moved by Representative Marsh, seconded by Representative Shapiro. Clerk, please call the roll.
Representative Marsh,
Votes yes.
Representative McMahon,
Yes.
Representative Nelson,
No.
Representative Acton,
Yes.
Representative Gay,
Yes.
Representative Cushman,
No.
Representative Folsom, yes. Representative Kelsey,
Yes.
Representative King,
Yes.
Representative Kofalt,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
Yes.
18-3.
Who is the third? No.
Jim Kofalt, Cushman.
I have Cushman and
Nelson,
Kofalt as no. Was there a
and
third?
Nelson. Nelson.
Representative
was.
Nelson voted.
Nelson.
Nelson, yeah.
So then it is 18-3. Thank you for correcting me. And it will not go on consent. Thank you.
Majority and minority,
Oh, that's correct.
because she'll let it on.
Now, Representative Marsh, would you like to write the majority report?
Yes, Mr. Chairman, I'll have it to you within a matter of minutes.
Speed it up if you can.
Got to hit the send button.
One amongst Representatives Nelson, Cushman, and Kofalt wish to write the minority report.
And I'll speak at once.
It is not necessary, but you may do it. And
If
let us
no one
know
else
why.
will, I will.
All right, Representative Cushman writes minority report.
And in the report, they need to say what they're asking to vote for, whether it's ought to pass or not.
The minority report tells us why they are against the bill. And the majority report will take into account what the amendment does. But
Mr. Chairman, I actually have a piece that I wrote some time ago, if I can find it, about how to write blurbs, which we don't call blurbs anymore. We just call committee reports. But if you would like me to send that around, I would be glad to do so.
I'd like a copy of that for myself, thank you, and I'm sure my colleagues would as well. Now, let me ask you, Representative Weber, in the minority report, as I understand it, it is simply saying why they believe that this is not a good bill to pass. They don't recommend any other motion.
No, the minority also does actually select a different motion. In this case, it would be inexpedient to legislate. I think, because they want it, they simply don't agree with the bill. They could say that they wish the committee had retained it, although maybe you can't do that one because I don't think the House can tell us to retain. But we often have them that one report is ought to pass with an amendment and another report is ought to pass with a different amendment.
Well, I learned something.
I think it's relatively simple. It just, they don't want, the people in the minority, I don't think, want it to pass at all. So that's ITL for the recommendation.
Thank you. I learned something from my
I
clerk
got
just
chased
now.
down on that one.
Okay, good. Now, under 350, which is Representative Acton's, I don't have a copy of the amendment. Do other people?
350.
350.
I don't think I've seen an amendment.
We didn't do an amendment on that.
Representative Acton, is there an amendment?
No, there isn't.
There is not?
No.
Okay. Then the chair entertains a motion.
Okay, I'd like to make a motion if possible.
Say again?
Can I do that, Mr. Chair?
Yes, yeah, that's usually
Okay.
custom is to give the bill sponsor first whack at it.
Thank you. I'd like to move that we vote ought to pass on House Bill 350.
Ought to pass. Representative Acton, is there a second?
Second.
And Representative Snow seconds it, and now we may discuss it. Representative Acton, you get first at bats.
Okay, so we went through this pretty comprehensively, and we've done it a number of years in a row here. So I don't think we need to spend too much time, but I will certainly take any questions. Just keep in mind that we really did spend a lot of time going line by line through this. We made a lot of amendments last year, and we did a lot of subcommittee work that really went well, a lot of input. So I think this is ready to go, and we'll pass the House again, I hope, and see what happens in the Senate.
Any questions for the principal sponsor?
I'm not seeing, oh, no, Representative Nelson has his hand.
Representative.
Thank you, Mr. Chairman. Just a question. What was for the person that's growing them for the caregiver, how many plants or how many people can they grow for?
I can only grow for one person. And it's 3 mature plants, 3 immature plants, and 12 seedlings.
Thank you.
Representative Shapiro has a hand up.
Representative Shapiro.
Yes, thank you, Mr. Chairman. I don't have a question. I just have an opinion, which is that while I'm not somebody who thinks marijuana use is benign, I think, in fact, it's a problem for a lot of people, especially adolescents. I just think that prohibition of marijuana has been a disaster in so many ways, and that this is a vestige of prohibition. And if people are concerned about diversion of this grown cannabis, I think cannabis that is bought in a dispensary can also be diverted. And I think cannabis is so readily available to people that, to me, it's not an issue. I wholeheartedly support this, and I think people should be allowed to be able to grow their own cannabis because it's cheaper, because it's because they have more choice, and because it's about self-reliance. So I wholeheartedly support this bill.
Thank you,
Chairman, I have Representative Merchant with a hand up, and I have Representative Kelsey with a hand up.
Representative
Thank you.
Merchant.
Thank you, Mr. Chairman. And also, I'm trying to go through my notes, and I remember someone making a comment that it's not inexpensive to buy cannabis. And for somebody who's on it, who needs it, particularly chemo patients, it can be a cost burden. So I was trying to go through my notes, and I think I had somewhere around $200 or $300 a month that would cost them to go to a dispensary. what I'm trying to get to is this, I think, minimizes the cost barrier to patients getting their cannabis to make the medical treatment that they need, particularly people with oncology and the like. So just wanted to verify my notes that it's like $300 per month, I believe is what they had. Is that correct? Does anyone know?
Yeah, I can take that one. The cost of 1 ounce of flower, the typical bag of cannabis, is about in the range of $360. So it depends on your needs. Some people could use that, could go through that every 2 weeks. If you're making edibles, maybe even more so. So the cost could be double that, upwards of $1,000. Most people who are just using for pain and so forth would be less than that. So, but it is considerable amount of money, to the tune of 200 to 300 minimum, I would say, for cost.
Representative Kelsey had her hand up, and I believe that Representative Knirk is now asking to speak after Representative Kelsey.
Representative Kelsey.
Thank you, Mr. Chairman. I guess my concern with this is being a big proponent of the Second Amendment. Is this not going to hurt somebody's Second Amendment rights if the ATF were to find out that somebody was cultivating therapeutic marijuana? Is it still the stance of the ATF to then come in and be able to take away someone's guns?
That's a good question. Representative Knirk, would you answer that? Care to answer that?
Actually, I'll give what my memory is, but I think perhaps Representative Acton may know. If I recall, even just being a certified patient has the same risk. Isn't that correct, Representative Acton?
Yes, it does, because you have to fill out on the form to purchase a firearm. It specifically states it calls out cannabis in medical form. And so there is a prohibition on that at the federal level. And now so you get into that gray area of, is it enforced or not? Right now, it's not being enforced. So we look to the future, and that's the problem with this dubious status we have of states approving it and the status it has at the federal level. Hopefully that'll change it. I don't think there'll be a crackdown, but who even knows?
Follow up.
So yeah, I mean, so Representative Kelsey, yes, that is a valid concern.
Yes.
Follow up, please. Okay, so then people would know that they were putting their Second Amendment rights, they were risking them by doing this, correct? They know.
Yes, it's something that the community talks about a lot. So,
okay.
Yeah.
Thank you.
Mm-hmm.
Anyone else? Representative Knirk, did you wish to speak again? I have a note here that you do.
Yes, yes. I'll actually finish that last. And the point is that you've run that same risk just being a certified patient, whether you're growing or not growing. So that risk is already there. Growing will not increase it. The point I wanted to make, though, is the access issue is not just a financial access issue. That is a very important point that Representative Merchant brought up, but it's also a geographical access issue because the dispensaries are rather scattered. And if you are in the North Country, you may have a very long drive to your closest dispensary, and including those who are in the southwest corner of the state who may need to be crossing state lines, which is a problem as well. So the issue is it allows a geographic ease to be able to grow and process your own material rather than having to drive somewhere to get it. So both financial and geographic access.
Thank you. Anyone else? Representative Folsom.
Thank you, Mr. Chairman. I normally am a big stickler about marijuana coming from Colorado, but I'm actually in favor of this bill, and it's been touched on a little bit, and the pricing is really what drove it home for me. And I've had conversations with several people already the numbers that I have gathered, it's be $350 for an ounce in a dispensary, $150 to $200 on the black market, and about $25 if you grow your own. So I know people with a medical marijuana card who are already doing one of the two options that aren't technically not allowed yet. So I'm going in favor of this bill.
Thank you, Representative.
Representative Nutter Upham has her hand up.
Representative Nutter Upham.
Thank you. I remember distinctly the testimony from people last year that said you can only, when they go to the dispensary to get their prescription, they're only allowed 10 days worth of product, which meant if you lived an hour and a half from the dispensary, you might have to travel to that dispensary 3 times in 1 month, which there were some of the people that testified in front of our committee that were in pain. It was very difficult for them to travel at all. And that would mean they would have to make, 6 trips back and forth, back and forth. So I just wanted to add that in as a consideration with the cost as well. So I'm definitely in favor of letting people take care of themselves. So I'll be voting for this. Thank you.
I see no further hands.
The bill before us is House Bill 350, permitting qualified patients and designated caregivers to cultivate cannabis for therapeutic use, moved by Representative Acton, seconded by Representative Snow. Would the clerk please call the roll?
Representative Marsh.
Votes yes.
Representative McMahon.
Yes.
Representative Nelson.
No.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kopal.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
To my great surprise, yes.
Yeah.
And that will go on consent. And Representative Nelson, do you wish to write a minority report?
No.
On a consent.
I'm sorry?
You cannot write a minority report. It doesn't go on consent if there's a minority report.
Thank you very much. Representative Nelson, is there any objection to go on consent?
No objection.
Then it's on consent. And Representative Acton, you may write the blurb.
I will. And let me just say thank you all for approaching this with an open mind and logic and reason and compassion. It's really, it's something else and it's quite an honor to be a part of this. Thank you.
Well, you know how the vote went last time, and it's your good work and presentation that carried the day for you.
He did do a good job. I'm sorry I'm one of those ones who voted no, but that's it.
It's okay. This is a tough topic.
It really is, but House Bill 314, relative to homestead food operation licensure. Representative Herschel Nunez is the principal sponsor, and Representative Marsh has a motion.
Thank you, Mr. Chairman. I move that we retain this bill because I think this bill needs work.
Do we have a second?
I would second that, Weber, but I see a lot of other hands up too.
Marsh moves, Weber seconds. And Representative Marsh, please speak to this motion.
I think it's important to allow small farms in the state of New Hampshire to be able to sell their goods directly to the public. I think there may be some issues regarding internet and that sort of thing in this bill. I don't think this is something we can fix with a simple amendment. I do think it warrants looking at more closely, and therefore retaining the bill gives us the opportunity to do that.
Any other further discussion?
Representative Weber has her hand up.
Representative Weber, please.
Well, thank you for recognizing this, Mr. Chairman. I concur with what Representative Marsh said, and the other thing that we talked about was perhaps involving a member or members of the Environment and Agriculture Committee who have also dealt with this issue extensively in the past, to have their input as well as ours, because I think it affects both of us. Representative Knirk has his hand up.
Representative Knirk.
Yes, and I would echo that. Peter Bitsby, the vice chair at ENA, contacted me about this, and his comment was that they actually they did not change other parts of the bill, but they did vote to increase the cap to $35,000 last year, and that the DHHS was okay with that at that time. So this is one of those interdepartmental things. So they've already processed it. We definitely want to get them involved.
Thank you.
I just wanted to add.
Representative Gay.
I just wanted to add that it was pointed out to us that increasing the cap meant we had to fix another limit and another RSA or rule. So yes, I certainly support the goal, but it looks like it's going to take some careful writing.
Anyone else?
Yeah, I'd like to just quickly say, let me unraise my hand here.
Yes, please, go ahead.
Yes, I wish we had the time to go through subcommittee and get this done. In normal conditions, I think we could, because I'm really worried to put this out another year. Time is of the essence to make these changes, because we could get them applied for this harvest season. But I do agree that there is some work that's needed to get this right, and I'll certainly, if needed, volunteer. I'm a homesteader. I would like to go down this road sometime, so I will volunteer to make this a real retaining, not just a death with dignity type situation. Thanks.
I have a question.
Representative Gay.
Okay, here's it bluntly. Why can't we have the meetings? Why can't we have subcommittee meetings? Because we don't have to go anywhere. We can do them from home. It's just a matter of time.
First of all, the chair did not say we cannot have subcommittee meetings. The chair said that we are being encouraged to have quite a bit fewer of them, because it has to do with the staff on the fourth floor. I have asked the staff on the fourth floor today for something, and they said they are massively shorthanded today, which is why Representative Weber is doing the part that often Christina Dyer did. So that is why we cannot have a lot of subcommittee meetings. So we will probably have a few, but we're not able to have a lot of them.
Well, I realize their work is often hidden from us. It would be helpful to know all the extra work they have to do to set up a Zoom meeting. Can one of us do that, or is it by statute?
It's actually not quite that simple. It has to be noticed in the calendar. There has to be somebody monitoring a dedicated number so that the public can dial in or email in and let us know if they're having difficulties. There's a lot of moving parts.
So subcommittee meetings have to be made to the public too?
Absolutely. Every time we hold a meeting, it is a public meeting. It's not necessarily a public hearing. The public doesn't necessarily get the right to speak, but all of our meetings and all of our subcommittee meetings must be open to the public and are subject to the notice requirements of the right to know law.
Okay. And none of us could host a Zoom meeting? It has to be hosted with staff from here?
I'm not going to answer for the current administration, but when I was in the majority and working on this issue, these are not meetings that are set up under anybody's 40-minute Zoom use meeting. These are webinars that are done on a much higher level of licensing, and we do it that way to ensure things like that committee members can speak and members of the public can't. We do it to ensure that we are not Zoom bombed while we are holding the meetings. Each notice for a committee member is set out separately in that case. It's a lot of work, and when we were in the majority, felt that it was inadvisable to just have people going off and having meetings at any old time, because the notice requirements and other requirements might get skimped on. And I don't know what the current thinking on it is, but my guess is that they have the same concerns.
Anyone else to the question of homestead food operation, licensure bill, retention?
And Representative Knirk waved at the camera again.
Representative Knirk, please.
I only wanted to say, perhaps, Representative Weber, this might be a good time for you to give a reminder to the whole committee that we likewise cannot send an email to the whole committee regarding our deliberations on a bill, nor can we even be calling a bunch of people or meeting with them, anything over outside of your caucus or over the majority or the quorum +1, because we have to make sure we all abide by 91A. Did I get that correct?
That's correct. And the other part of 91A is you cannot make 21 separate phone calls either. You cannot do in series that which you could not do all together. So, you know, if it's a caucus, it's fine. If it's less than half of the committee, it's fine. But when it goes beyond that, it is an issue.
I too like the idea of homesteading for food operation. I made quite a bit of money with a little vegetable garden as a child. So this is just taking it to a bigger scale.
And Representative Shapiro has a hand up.
Representative Shapiro.
I just want to say that should we retain this bill, another area of the bill that we did talk about working on was the addition of poultry products, and whether that was I can't remember the terminology, but a shelf-safe product. So that would be another thing that should be explored when it is worked on.
And come summer, I'm sure there'll be numbers of people who will be very willing to work with each other.
Representative Knirk has his hand up again.
Yes, go ahead, please.
Yes, I just happen to know a bit about this because of some of the work I've done with ENA. There's a separate whole program for poultry, allowing it to be done by the small producer. They have a bird limit so that you don't have to go through a federal slaughterhouse and so on. So that's already in statute for small farms anyway. So again, that's why we want to get the ENA people here so we don't do something redundant, which already exists in statute. It's a rabbit and poultry were brought in together a number of years ago.
Thank you. Seeing and hearing no one else, the motion relative to homestead food operation. The motion was there a motion?
Yes.
Yes, Mr. Chairman, I moved retain, and it was seconded by Representative Weber.
Okay, there it is. Oh, I had my thumb over it. Sorry, guys. Moved by Representative Marsh and seconded by Representative Weber. The clerk will please call the roll.
Representative Marsh.
Votes yes.
Representative McManus.
Yes.
Representative Nelson.
Yes.
Representative Afton.
Yes.
Representative Gay.
Reluctantly, yes, I want to discuss it.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey,
Yes.
Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
Yes.
21.
21 to zip, it goes in the later file, retained. And, excuse me here a second.
I'm sorry, what was the number on that bill again, please?
314.
Thank you so much.
Now, we just, Representative Marsh, we just got down here the amendment to HB 220 that I believe you sent to everybody. Are you of a mind to exec at this time?
I believe that's your call, Mr. Chairman, but I am of the mind that this amendment fixes the problems with the bill so that we can actually affirm medical freedom in the state of New Hampshire without interfering with the public health operations of the Department of Health and Human Services.
I'm going to ask Mr. Chairman, we have not seen that yet, and that was a bill of significant concern. Is there any possibility that those of us who already are using up the screens of 3 different devices and cannot, consistent with that, look at the amendment? Can we put this one off to another time?
We could do that, yes. It is a brief amendment. It's only 12 lines long, but still, if that is your desire, I could honor that, certainly.
I would very much appreciate it on behalf of myself, at least. I'm looking at my list, and it may not be appropriate, but I thought that 131 might be ready to go. That's reporting of healthcare associated infections.
131, okay, I have that. I do not see that in my okay to exec folder.
Okay. Never mind, sorry.
Words I have under 131, words considering Cushman's questions about the word measures.
Mm-hmm.
And have we gone anywhere with that? Are you going to do an amendment or?
No, sir.
I'm asking Representative Cushman here.
I will if I have an opportunity. I don't have one written up.
Okay, Representative Wood, I believe, I can't find it, but I think it's your bill, correct?
Yes.
That's correct.
The next page is
Actually, my notes on this was Representative Woods was going to research measures.
Would you, Representative King, I think has a good point. Would you say that louder, please?
Yes, in my notes, I had Representative Woods was to research the word measures.
Yes, that's correct. I did get a chance to talk with Representative Cushman. Representative Kofalt and I have been playing telephone tag. I did get a chance to speak at length with DHHS about both items, i.e. the vaccination issue as well as the measures. But if there is a amendment coming forward, that would have to wait, of course.
This was again number
131.
131.
I have that in my wait file, so anything we need to do, if that could be done in the next week. Representative Cushman?
I don't have an amendment to propose personally. I think the bill should be ITL.
Okay. That having been said, Representative Cushman says she thinks the bill should be ITL'd, and so that I think Representative Woods, you've done some homework on this, and it's your bill. Would you like us to exec it now?
That's fine with me. I didn't get a chance to connect. As I said, we played telephone tag with Representative Kofalt. If he has any reservations at this juncture, I would certainly be amenable to waiting, but I could go ahead.
Oh, what's going on?
Representative Kofalt, good to go or wait a week?
I actually, I don't, well, I'm happy to talk to Representative Woods. I have serious concerns about the language as it is currently. Open to hearing what, you know, yeah, I'm open to listening. I guess my concern is that no matter what answer comes back, there's still a still a problem with the fact that the language is vague. If there were an amendment to be proposed, I guess I would propose striking the language that has been added to section 3 and simply leaving the language in or simply leaving the strikeout in lines 4 and 5. I would have to sort of review again in detail, but I have serious concerns about the inclusion of the language on lines 18 to 20.
Then I'm going to rule that it goes in my wait a week file. And I would suggest that anybody with questions or concerns have a good conversation with the sponsor, which may resolve nothing or may resolve something, them's being the choices, and we'll look at it later. We've got some time.
Chair.
Yes, sir. And
Thank you.
You're welcome. Representative Marsh suggests we take up House Bill 157, which is repealing the State Health Assessment and State Health Improvement Plan Council. And boy, did we have some meetings on this one. So Representative Marsh, you have the floor.
Thank you, Mr. Chairman. I will point out to the committee that I just sent out an amended amendment. The Department of Health and Human Services found and told me to correct a statutory reference on page 1, line 14, which is the only change between that and the amendment which was circulated previously. So for the purposes of discussion, I will move ought to pass on.
Before we go any further, we're going to have to talk about just that, because not everybody has everything. So let's make sure we have what we need.
This is 157.
The correct amendment number is 0270H.
Do we have that?
Can you say that again, please?
The correct amendment number is amendment 2021-0270H.
All right, let's stop right there.
02 what?
What, 02 what?
0270H.
0270.
Yeah, it's not here. I don't have an email. We don't have it.
When should this have been sent to us?
Again, Mr. Chairman, I'm going to ask your indulgence. That came in, according to my email, 10 or 15 minutes ago. Maybe it was a little longer than that.
Okay.
It is 3:30, and if there's anything that has a significant amendment, I can't see the amendments on my screen and
Okay.
still participate in the meeting. And I think other people are in that condition as well. And given that we have to figure out where the bill is in our filing system and any previous amendments and this amendment, I would be very appreciative if we could hold it for the next meeting.
We will do that.
That would be very much appreciated.
Now, is there any other low-picking fruit? I'm going to hold the vulnerable adult bill for a week. And is there any low-hanging fruit that we might?
Could I ask one question on 157? He mentioned, Representative Marsh mentioned that there was a problem on line 14. The bill I have in front of me only has 13 lines. Am I got an old version?
You're looking at the original bill, Representative Snow, and not the amendment that was circulated previously. There was a problem on line 14 of the amendment where a number 88 was written down as an 8. So we corrected that. That's the only
And
difference.
that amendment has been sent to us how long ago?
Yes, Representative Weber said she received it approximately 15 minutes ago.
Okay.
No, I received the second amendment just recently, but there was an earlier amendment that Representative Marsh sent, and I don't remember when that came to us.
But the one that we have.
That was at 3:40 Friday afternoon.
But the one we have to look at is the one that came in today, correct?
Yes, there's that minor correction in this one.
Okay, thank you.
Okay, that's off till next week. And the last one I'd like to do today is House Bill 185 footnotes. We concluded the hearing last Monday, removing the work requirement of the New Hampshire Granite Advantage Healthcare Program. And that, Representative Shapiro, is your bill.
I would move ought to pass.
And I'll second.
185, Representative Shapiro moves it, and who seconded it?
Snow.
Representative Snow.
Snow, second. Okay, Representative Shapiro, we recall the discussion, but remind us.
Okay, I didn't expect this one to come today, but I'll do my best.
Shapiro, if you wish, I can defer it.
I think we could go through with it.
Your pleasure. Go ahead.
Okay. I think my testimony spoke in detail to why I think it's a good idea to repeal the work requirement / community engagement aspect of expanded Medicaid. I can go through some of it again, abbreviated. While
what do you need?
So while I believe that this was came into law in 2018, and that was before my time in the House, and I think, as I said in my testimony, I think that this was a compromise made in good faith. I believe there was a Democratic governor and majorities in the House and Senate for the Republicans, and it was a compromise made in good faith, bringing together two different philosophical points of view so that, in fact, expanded Medicaid could be renewed for 5 years, and that did happen. And it was called the Granite Advantage Healthcare Program. But since that time, I think the landscape has changed dramatically. Initially, there were similar plans in other states that, specifically Arkansas, that had similar but less work requirements that implemented their plan. They had a similar waiver. And many, many people lost their insurance. I think it was 18,000 people lost their insurance in Arkansas, and they discontinued at that point. In New Hampshire, Health and Human Services attempted to implement our version of the plan, and I believe this would have been 2019, and I had considerable difficulty registering people who would have qualified for the work requirement. So I believe it was out of 50,000 people that might have been part of the program, 20,000 of them were not able to be registered. Either they couldn't be reached or they couldn't get them successfully to fill out the right forms. A considerable amount of money was spent trying to roll out the plan, and considerable amount of effort from Health and Human Services was spent trying to lay out the plan. But Governor Sununu, at a certain point, acknowledged that it hadn't been done satisfactorily, and they deferred it at that point. In the meantime, there's been a series of court cases both for Kentucky and Arkansas, who had similar plans, and New Hampshire, where federal courts struck down these waivers. Basically saying that Medicaid is, the core principle of Medicaid is that it is a healthcare program for indigent people, and that it is not a work readiness program or a character building program. So these programs in Arkansas, Kentucky, and New Hampshire will all ruled unlawful by federal courts. At this very point, there is an appeal, and I believe it is the Arkansas and the New Hampshire, I know it's the Arkansas and New Hampshire case combined to the Supreme Court that the former Trump administration brought with the support of New Hampshire and Arkansas. And as Henry Littman said during our hearings, they had just scheduled oral arguments for the Supreme Court on March 29th. But we shouldn't think in any way that that means there'll be a ruling on March 29th. There's likely will be a ruling weeks or months later, possibly in June, when many Supreme Court rulings come out. In the meantime, I'd say another factor in terms of repealing this work requirement is that as all of us are having to deal with, as we're having to deal with today, COVID came to be. And I think in light of COVID, the idea of implementing this work requirement is even less viable. The idea of removing people from their insurance, which actually would be impossible anyway because the regulations don't allow it during this health emergency. But the ethical considerations about throwing people off their insurance and the public health considerations of having people having to go to jobs and volunteer jobs and just going out and being around when there's a public health crisis and we're asking people to stay at home as much as possible is another consideration. I understand that this is a very emotional issue, and I understand that people on one side feel like healthcare is a human right, and I would count myself in that group. However, it's not a human right because on some kind of principle or because God says it's a human right. It's a human right if we make it a human right. So that's why we have to make decisions like we're making today. We're about 2.5 years into the 5 years of expanded Medicaid. I do not think it's going to happen. I don't know if the new Biden administration is going to, what they're going to do in terms of pursuing this case in the Supreme Court. I just think that this program has run its course and we should repeal it and align New Hampshire statute with the federal reality. And I understand that that will be a difficult emotional decision for some people. I respect the fact that people wholeheartedly feel that people should not be dependent on government subsidies and government programs, and this would push people in the other direction. But I think it is time to repeal this particular program. And I'm glad to answer questions if people have them.
Well, this is an exec session and they may ask the sponsor questions or they may wish to make a statement. Do we have hands up?
Yes, you have Representative Marsh and you have Representative Knirk.
Let's start with Representative Marsh.
Thank you, Representative Shapiro. You and I have disagreed on this topic many times in the past. And as many of you know, I and several others in this meeting struck an agreement with each other that we would include this provision as part of the Medicaid expansion program. And to me, it feels like we are backing out of an agreement that was sincerely made on everyone's behalf. I agree that this provision is not being enforced at this time. It may be that repealing this would make the question before the Supreme Court moot, although Henry Littman said it would not save the state of New Hampshire any money. I know certainly at this point in time it is against the law with COVID to throw people off of the program who may not be abiding by this requirement. But that being said, we aren't going to be in COVID forever. And we make laws last for a longer time sometimes than we realize. So I cannot support removing this requirement at this point in time.
Thank you, Representative Marsh. Representative Knirk.
Thank you very much. One of those rare places where Marsh and Knirk actually disagree. But in any case, when this did come through, though, last year, I did not support the bill to just repeal. And that is because I shared Representative Marsh's feelings, and that is we made a deal. We needed to honor that deal because I had been, part of that agreement as well. But things have changed, and that is why I've actually changed my mind about it. And first of all, we know that the majority of people on Medicaid already work anyway. Secondly, is we saw the shambles of trying to begin to enforce it in this state where we spent a lot of money and were unable to even begin to get things organized to do it. And we have seen the effects in other states. The bill that I actually supported back when this came up the last time was actually, that was 2 years ago, was a bill which was, it was SB 290, which was had a metric that if a certain number of people lost insurance, that it would suspend it. And that was, kind of a stopgap and sort of halfway between just repealing it and letting it go forward. It was a kind of a harms limitation. The thing is, we've now seen the disaster of trying to enforce it. We've seen the results in the other states. We've seen people lose their insurance coverage. And with all that in mind and no compelling data that it was actually going to improve people's health, but actually more importantly, we need to keep people healthy to be able to be at work. I have changed my mind from my opposition to just repeal 2 years ago, and I now do support repealing, but it's a long, convoluted course to get there.
Anyone else?
Representative Weber.
Representative Weber, please.
Thank you, Mr. Chairman. I just want to second the piece of Representative Knirk's testimony, which was that the enforcement phase of this was very expensive and was a complete disaster. And it required the removal of workers from other areas that they were working in to go and search for people to find out whether they were meeting their work requirement or not. So it had consequences far beyond this particular bill. And I will end with that, but I will let you know, Mr. Chairman, that both Representative Acton and Representative Shapiro have their hands up.
Thank you, Representative Weber. Representative Acton.
Okay. I was originally against removing this, and I've been doing a lot of soul searching on this one. I've lived in poverty in my life, and it wasn't ages gone by. It was fairly recently where my family almost lost everything, and we would have been in the situation where we needed to go on Medicaid. And one thing I learned is that being broke is hard work. I had to do everything I could just to keep the household together. We were so broke at one point, I had to go and fill a 5-gallon diesel jug to pour in for heating oil. I had to just scam up $20 to fill the jug, and that would be enough to get us through a couple of days. It did the whole winter. So I've been through that. And the other issue I have is that I think we've fallen into a rut here with Medicaid, where we assume that we have this assumption that everyone's just sitting home doing nothing and just collecting And I just don't think that, I think that's a myth. And I think it's time to move beyond that. Secondly, or thirdly, you know, we're not just going to pull out of COVID. This is going to be years. The economy is severely damaged, and there's not many jobs. We may go into, it may take years and years of layoffs, and we got a foreclosure crisis coming. People are going to need Medicaid. And I don't like the program. I wish I could rewrite the whole thing, but it's what we have right now. I can't vote to throw people off of Medicaid healthcare, believing what I believe is going to happen to this country in the next couple of years, which is a severe recession.
Thank
So that's it. I'm going to vote accordingly.
Thank you, Representative.
And
Is
Representative Nutter-Upham has her hand up in addition to Representative Shapiro.
Representative Nutter-Upham?
I have a close family member who is on Medicaid. Were she functional enough to work 10 hours a week, 20 hours a week, she would not need to be on Medicaid. She could hold a regular job and maybe have insurance through them, but she cannot. She's receiving treatment now, you know, each time she goes in, we hope it will be the last time. But so there's a, you know, it's a personal story. It's a little hard because I know we're public, but when somebody needs Medicaid like that and is unable to function well enough to do, you know, 10 hours of volunteering at our soup kitchen or whatever, they should be able to have the treatment that they need. So please vote accordingly.
Anyone else before we go to the second round?
Representative Merchant also has his hand up.
It's Representative Gay. Thank you.
When people are ill and handicapped, doesn't that mean that they don't have to be working?
Who is that addressed to?
Anybody who knows the answer, because this just sounds strange to say that it's an excuse not to require working. If somebody
I could answer that, Mr. Chair, if that's helpful.
and is handicapped, I mean, that's a form of handicap.
Yes, Representative Weber, if you wish.
There are a number of exceptions in the rule. And some of those are very early child care, and I can't remember when that goes up to. And there are some exceptions for medical reasons, both physical and behavioral. But there are a lot of people who are on the borderlines of that. And so, no, it was contemplated when the statute was passed that there were certain categories of people who simply couldn't go to work, and that was recognized. The issue is all of the people who are sort of sneaking up to that borderline, and they are also the very people who have a great deal of difficulty organizing themselves well enough to fill out the paperwork to justify or verify what they have or have not done to complete the requirements. So there are some provisions in the bill. It's not everybody who has to work, but there are gaps as well. And I will let the chair know that the hands that I see now, and I've lost all control over the order, are Representative Shapiro, Representative Merchant, and Representative Woods.
While you are giving what I thought was a very fair answer to the question, I was trying to keep the order, and Representative Shapiro is next.
Yes, thank you, Mr. Chairman. Several people have mentioned the amount of money that it cost trying to roll out the program a couple of years ago. And so I'll just say that the Federal Government Accounting Office said that $4.4 million was spent, most of it in federal money, a little bit less than $200,000 in New Hampshire state money was spent trying to roll out the program that didn't get rolled out. I would like to address the issue that Representative Marsh brought up about this going back on an agreement that was made. And I'm very sensitive to that issue. I feel like in a sense he's correct. I would say that for myself, when I first was elected and this, a similar bill was brought up, I think in 2019, it was brought up by a also newly elected representative. And one of the things I remember her saying when she introduced the bill to repeal the work requirement was that she had not been in the legislature when the deal was made, and therefore she was not a party to the deal, and that she didn't have to go by it. I disagreed. My sentiments were really different. I had a hard time with that. I felt a deal was a deal, whether I made it or whether I didn't make it. So I'm sensitive to the idea that some people might feel that we're changing an agreement. I feel that we're changing an agreement because the circumstances have changed so dramatically. Not because we had the Democrats had the majority like we did the last 2 years, or not because we can just bring up any bill we want. I really think the circumstances are dramatically different. I would also say that for representatives who were on the committee the last term know that I have a daughter with stage 4 cancer. And that has changed my feelings dramatically about the idea of someone having insurance or not having insurance. And the idea that we would take people off their insurance, especially people who have a difficult time negotiating getting insurance, is just something I think we shouldn't do. So I would ask all of you to rethink this idea about a compromise made or a deal made, and try to think of this from the point of view of a family or an individual who has to face a serious illness without insurance.
Thank you, Representative. The chair recognizes Representative Marsh.
I did not have my hand up, Mr. Chairman.
The chair recognizes Representative Merchant.
Thank you, Mr. Chairman. A question to someone on the committee. Looking for what percentage of the population we're talking about now that is not working, that's causing the problem? Is it a large percentage? That's one question. The other one, informational wise, is how much of this program is paid by the federal government versus the state government? I'm trying to understand the financial side of the equation, because it is only 3 or 4% of the population out there that's really at risk of enforcement. That's one thing versus saying 30%. And the other one, of course, is how much money the state's putting into the bucket versus the federal government.
Can anyone answer that?
I can answer part of it. Representative Shapiro can probably answer part of it.
Representative Shapiro.
Yes, I'm not sure when we're talking about cost, I'm not sure if we're talking about cost of insurance or cost of running the work requirement program. In terms of the insurance, in terms of expanded Medicaid, 90% of the cost of expanded Medicaid is borne by the federal government, 10% by the state. In terms of rolling out a work requirement and running that program, I just know from past information that the federal government paid for a lot of that. I don't assume that they would be responsible for paying for that. I assume that it would come out of the budget of Health and Human Services.
If I could just add something to that.
Representative Snow, Representative Wood is next, and I'll put you on the list.
Mr. Chairman, if I may.
Yes, sir.
Follow up.
Follow up.
To Representative Shapiro, thank you for the information. In regards to the other question, what percentage of the population covered through this program is a questionable amount that needs to be enforced as far as the work requirement? Is it a small percentage of the pie, or are we talking about a large percentage? Because I'm looking at it and saying there's only 3% of the population that's really afoul of the work requirement. Is that kind of what we're talking about, or is it greater than that? It's more like 30, 40%. Where are we in that spectrum?
I could speak to that, or
I could too.
Weber, or anybody wants to speak to that?
My recollection, this is Representative Weber, and I noticed that Representative Knirk is also waving his hand. My recollection from the last time we went through this was that there was a concern that there were about 17,000 people who were at risk. And I'm not 100% certain of that. So if somebody else had better information, I would yield to them.
I believe that there were over 50,000 people on the expanded Medicaid program, but that has been inflated with COVID and with people losing their employee-based health insurance. And now it's up to in the mid 60,000s. And if you remember correctly, we talked about that with the dental benefit because they wanted to wait till COVID resolved somewhat, because the cost of implementing that program, they expect to be less eventually. So I'm not really sure, as Representative Weber said before, there are a number of exceptions to the work program that people can get, waivers from the work program that people can get who are on expanded Medicaid. I don't know what percentage that represents of the over 60,000 people that receive expanded Medicaid right now.
And Representative Knirk, I think, also had an addition to that.
Yes, I mean, I think here's the issue is that we heard the testimony back before that it was roughly about 75% of people on Medicaid work anyway. So we're looking at maybe about 25%. The number of people on Medicaid is, I think, and this is real back of the envelope, but somewhere around 150,000, or, if you look at it about, 10% of the population. So if you have a quarter or 10%, we are indeed looking at about 2 to 3% of the population. But then with the exemptions, that gets us down to Representative Weber's comment, because if you have about 17,000 out of the 1.5 million we have roughly, you're talking about 1%. So we are talking about a very small number of people. And that was one of the questions is it worth the amount of enforcement money that would be done to try to do this to actually achieve anything, and would we? I would actually circle back to Representative Gay's question. In SB 313, it's important to realize that went through HHSEA first. Representative Marsh, Edwards, and Knirk sat down and came up with 10 different amendments for the program, and these had to do a lot of them with their exemptions. We actually passed in 5 of them, went through the House, the first committee. Finance, of course, in their ultimate wisdom, totally went back to the original bill and got rid of all of our policy recommendations. So none of those got in there. As a result, what we're left with, just out of curiosity, is it is a caretaker of a child under age 6 is exempted. That means your 7-year-old can be home alone. That doesn't usually work well for most people. Likewise, the way that it's worded does not work well for seasonal employees. We have people up in my neck of the woods that work for 80 hours a week for a couple of months in the summer doing landscaping, and then running lifts for a couple of months, but have a few months they don't. They're going to be then going into and out of the program back and forth, and that is very disruptive to medical care, and it increases the administrative costs. So these were all things that, again, Marsh and Edwards and Knirk dealt with and put in as amendments, but got lost as the bill went through finance and then ultimately was passed. So there are some exemptions, but some of them are a little strange. I think most of us wouldn't leave our 7-year-olds home alone.
I would like to move towards closure on this. We do have Representative Wood, who had his hand up.
Just very briefly, just to make my position known. I too felt this was a commitment, and before I was in the legislature, I worked through the Medical Society to get this passed with the understanding that there was a compromise. By the same token, as been pointed out, the situation has dramatically changed. And as Commissioner Myers at that time said, the implementation is just a headache, as we've pointed out. And just to get a little bit into the weeds on that, you had to renew it every month. And some people who don't know how to get online and couldn't get the phone number, couldn't get it. So they were then kicked off, which really was complete antithesis of the whole program. And just from an overview, the whole concept is a little bit fallacious from the standpoint of medicine. Medicine is meant to make you healthy so you can work, not make you work so you can get health care. It's just the reverse. Thank you.
Thank you, Representative. And Representative.
We have Representative Snow also with a hand up.
Representative, as I was saying, Representative Snow is called on.
Oh, I'm sorry.
Yes, thank you, Mr. Chairman. Just to expand a little bit on what Representative Shapiro said, the typical federal state split for Medicaid, other than the new innovative programs, is a 50-50 split, 50% federal, 50% state. Under the expanded Medicaid, he is correct that some of the programs is a 90% federal, 10% spread. And how much all of that is worth, I don't have that information in front of me. I would also just like to say, it seems to me that this bill is sort of backwards. When I was working in mental health, I started a large sheltered workshop and also a supported employment program using the regular competitive job market to place patients to work. And one of the things that we discovered rather quickly is when you got people jobs, even in a sheltered environment, their Medicaid would cover them until they earned a certain amount of money, and suddenly they were cut off. And I thought the sensible way to deal with that is if they reached a certain level and moved ahead and were doing well, don't cut them off. Instead, keep them on and begin to charge a graduated fee or premium for them to stay on, which made a lot of sense. And they actually did it as a trial. Now, I don't know whatever happened to that trial because I've since retired. But the fact of the matter is that gets people used to the idea that insurance is not something that they give you. Insurance is something that you earn. Now, that's not done. But the opposite of that is to take people's insurance away because they haven't met some other standard. And just to give you a little idea, if people are involved in community activities of one kind or another, if they're in some kind of a treatment or training program, the training programs that automatically lead to employment and so forth, you can get around this community. But you know, a lot of the people that are on Medicaid don't want to listen to a lot of this. And that's one of the reasons they had so much trouble with trying to roll this program out, because you're talking about people that have never been treated particularly well by the system that takes care of them. To me, it's ridiculous to threaten people with the Medicaid being taken away. And if this goes out of the way, we're going to see lots of people dropped off the rolls, and that's inhumane as far as I'm concerned. So I'm strongly in favor of this particular bill. And anyway, I'll quiet at this point.
Thank you, Representative Snow. For myself, all my adult life, I've been to some degree or other responsible for people, many of whom have had serious, genuine needs. But I lay alongside that numbers of working class people that I've known, and many in my district today, who are having to pick up an extra shift or work a second job, and who can tell me and point to me people who could work but are not working and are getting a check. I had a family member exactly like that. She could have worked, she should have worked. If she wasn't a relative, I would have turned her in. And she got her check and refused to work. And what this does to many people who are just getting by is compassion fatigue. They've cared a lot about people, but there's a point at which they stop because this is what they see. And I understand their concern as well. I do know that there are numbers of safety nets and waivers in this program. I'm conflicted. There's different, I vote one way, I'm affirming one part of who I am and violating another. I vote the other way, I'm doing the same in reverse. But I just wanted to bring this part of it up, that there's people out there right now who are angry. I am trying to encourage them in the various compassion things I put forward. And when they see somebody who could work but won't work, it makes my job to do this very difficult. Is there anyone else who wishes to speak for the first time? Because we need to move. If you've spoken before, I think you've had your say, but is there anybody who hasn't spoken and wishes to?
I see no further hands, Mr. Chairman.
Thank you. And I want to be very sensitive to the fourth floor. They are very short-handed today, and they've been doubling up, and they want to go home. So if anybody has not spoken on this and wishes to, please signify, and you will be recognized to speak.
I see no further hands, Mr. Chairman.
Thank you, Representative. And hearing that, then I will ask the clerk on House Bill 185 FN, removing the work requirement for the New Hampshire Granite Advantage Healthcare Program, ought to pass, moved by Representative Shapiro and seconded by Representative Snow. Would the clerk please call the roll?
Representative Marsh,
Votes no.
Representative McMahon,
No.
Representative Nelson,
Oh,
Representative Acton,
Yes.
Representative Gay,
No.
Representative Cushman,
No.
Representative Folsom, no. Representative Kelsey,
No.
Representative King,
No.
Representative Kofalt,
No.
Representative Weber,
Yes.
Representative McKay,
yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
No.
eleven to 10 it passes.
It passes 11 to 10.
Mr.
Representative
Chairman,
Shapiro, yes.
I would like to file a minority report.
Representative Shapiro, will you file the majority report?
You need to unmute Representative Shapiro.
I'm unclear. Did it pass or did it not pass?
Yes, it
Yes,
passed.
11 to 10. That's why you get the chance to file the majority
Why
report.
are you barking?
Okay, so it was 11 to 10 to
Ought to pass.
want to pass.
You won.
I'd be glad to write the majority report.
Thank you. Representative Marsh, the minority report.
Yes, I will, Mr. Chairman.
And with that, we are adjourned. And it seems like we're 95% sure we will meet again next week on Tuesday.
Is it going to be just the one day, Mr. Chairman?
Ma'am?
Just one day.
Is it going to be just the one day?
That's all I can get out of them at the moment. One day next week. I'm trying to get another day. We did exec a bunch of bills today, which really clears up next Tuesday afternoon. But that's the best we've got at the present.
And Mr. Chairman, just so I know, that day we are going to have to do the first committee bills that remain. It's the second, the first committee bills that remain, right?
Any remaining bills that go to another committee will be out the door next Tuesday. So if anybody has amendments or what have you, this is it. Next Tuesday is it on the 1 or 2 bills that are still remaining.
Which two of the, did you have a list of which the 2 numbers of those are that are short?
I will email everyone a list of what I will be having us do next Tuesday, and with that, a list of the bills remaining afterwards.
There's a lot of that. Lindsay just sent us a flow chart. And is that, is what's an early bill and not an early bill, is that listed in that flow chart?
No.
Yes, it is. Yes, it is, because if you look at the second column is the due date, and most of them are March 11th, but some of them you will find the due date is February 18th. So the February.
Those are the early bills.
Take care of.
Sorry.
We have some of them. And what Lindsay sent out will not incorporate anything that we did today, so.
That is correct. Any other procedural questions? Hearing none, thank you, everybody.
Thank you very much, all of you.